started. Good morning, everyone. Committee is going to come to order. Chair recognizes himself for an opening statement. We are here today to consider a series of bills that share a common theme: protecting the American taxpayer. We will vote today on 5 bills to repeal unaccountable mandatory spending in the health care law, some of which is better authorized to be funded through the discretionary process if Congress deems it a priority, and some of it which could be eliminated altogether. We'll also consider legislation to ensure reclaimed broadband stimulus funds can be returned to the U.S. Treasury, and I appreciate the work of the Democratic side as we work that issue through. 3 months ago, John Boehner assumed the Speaker's gavel and began a transformation of the House. We said that we'd focus on jobs, and we have. We said that we would cut spending, and we have. We said we would vote to repeal the unpopular health care law to pave the way to replace it with something better, and we have done part of that. Yesterday, I reported to our colleagues in the House leadership on what we have accomplished here at the Energy and Commerce Committee in the first quarter of 2011. 30 hearings, substantive investigations uncovering little-known programs and spending in the health care law. And as I reported yesterday, we are just getting started. The bills that we're voting on today fit with this record of accomplishment on behalf of the American people, so let's continue to get started. We all know that the health reform package was rushed to a vote, and no one actually expected, at least not a lot of people perhaps, expected that the Senate bill would become law. All the warts in the inartful legislative drafting were going to be addressed during the House and Senate conference. Then Scott Brown was elected, and the Senate no longer had the votes to pass the controversial bill. Rather than go to a conference and negotiate a compromise, the Senate bill was jammed through the House. Republicans couldn't amend it, nor could Democrats change the even obvious flaws. As an example, the Senate authors exempted leadership and committee staff from being forced to buy insurance in the exchange. Certainly an exemption for leadership staff was, I don't believe, the intent of the authors. But by circumventing regular order, there wasn't an opportunity to fix it. Another egregious example was to provide the Secretary of HHS an unlimited tap on the federal treasury. Section 1311A of PPACA provides the Secretary a direct appropriation of such sums as necessary for grants to states to facilitate the purchase of qualified health plans in newly created exchanges. The Secretary can determine the amount of spending and spend the funds without further congressional action. The legislative language was written so broadly that the only real restriction on what can be funded is how the Secretary defines terms such as facilitate enrollment. I'll give my friends on the other side of the aisle the benefit of the doubt. You probably intended to fix this in conference. When drafting it, the authors didn't have time to determine the cost of the program and wrote a blank check to be filled in later. Unfortunately, later never came. And now a blank line in the bill has turned into a blank check signed by the taxpayers. Today, we will vote to repeal that unchecked spending power. We'll also consider legislation introduced by Chairman Pitts to eliminate the public health slush fund that was created under Section 4002. In a nutshell, it was a slush fund for the Secretary to spend on any activity under the Public Health Service Act, spending that would come above and beyond the amount Congress appropriates for that activity. By 2015, $2 billion will be automatically deposited into the fund each year in perpetuity, and the Secretary will be able to spend the money without further congressional oversight. I would urge my colleagues to remember that we are $14 trillion in debt. Our deficit this year again will exceed $1.5 trillion. We must prioritize our spending and ensure that we're not funding duplicative programs. Our country is broke, and we cannot continue to spend money that we do not have. Slush funds and unlimited taps on the Treasury must be the first to go. If my Democratic colleagues have other suggestions to reduce spending, we certainly stand ready to work with you. Programs must be weighed and prioritized against the merits of other programs. We must get our federal spending under control, and we have to do it starting today. Yesterday would have been better. I urge members to support all 5 health bills that we are going to mark up. The first bill that we will consider was in a February hearing on the broadband stimulus funds, and last week swiftly passed through the subcommittee with a unanimous voice vote. It improves oversight of the awards and clarifies some ambiguities that the IG raised regarding what happens to returned or reclaimed funds. These are not major changes, but I think they're wise, and because of the large sums of money that we're talking about, and because while most of the money remains to be spent, we are already seeing some of the funds returned or reclaimed. I look forward to working with Ranking Member Waxman and his staff as this bill advances and we look at additional protections for the taxpayers. I'd also note that we're going to adjourn temporarily at noon and come back promptly at 1 o'clock. And at this point, I yield 5 minutes to the ranking member of the Energy and Commerce Committee, Mr. Waxman, my friend from California.
Thank you very much, Mr. Chairman. We're not broke. We're not broke as a nation. We can afford certain basic priorities, and the bills that we have before us serve to fund those very basic priorities. The Republican budget that has just come out shows what the Republican priorities really are all about, and they are to end Medicare as we've known it, end Medicaid as we've known it, let the middle income and the lower income bear the burden so that we could keep the tax cuts for the upper income. If we had those taxes and people shared in the burden of dealing with our fiscal issues, we would not be broke and we would be a more just society. Today we're going to consider 5 controversial health bills and 1 non-controversial telecommunications bill. The 5 health bills are not about the merits of mandatory versus discretionary spending, as our Republican colleagues continue to assert, nor are they about protecting Congress's prerogative to fund or not to fund health programs. We make those kinds of choices, often difficult choices, all the time. And they are certainly not about the substance of any of the programs that are the subject of the 5 bills. Today I'm releasing fact sheets for every member on this committee about the impact of these bills. Each fact sheet includes state and district level information about premature deaths, smoking rates, obesity rates, and how the Prevention and Public Health Fund, which would be defunded under the legislation, addresses these public health threats. Pure and simple, this markup represents the Republicans' newest line of attack to disrupt, dismantle, and ultimately destroy the Affordable Care Act. They are doing so by sacrificing long-standing bipartisan policies to advance a narrow partisan ideology. For many years, Republicans have joined with Democrats in making the case to do more to prevent disease and promote health, and in turn to cut health care costs. But today the committee will vote to end funding for the first and only federal program with a dedicated ongoing resources designed to make us a healthier nation. I know they'll say we can get appropriations, but let us look someday at all the programs we've authorized and all the appropriations that did not follow. And one of the types of programs that gets defunded first are these kinds of programs. For me, that's why it's important to have a guaranteed funding source. For many years, Republicans carried the mantle for state-based health reform, but today the committee will vote to take away money states need at a time of enormous pressure for them to develop their own unique insurance exchange programs that are the cornerstones for the full implementation of the health reform law. Republicans have scolded Democrats for not doing enough to expand the country's health workforce. They highlight the need for more physicians, particularly primary care providers, to meet the growing demand for services. But today the committee will vote to cut support for a workforce program that would enlarge that pool of providers. And the committee will also vote to eliminate funding for school-based health centers that provide primary care services to vulnerable children and adolescents. We also have before the committee a bill that would terminate mandatory funding for the only evidence-based teen pregnancy program, but retain mandatory spending for an abstinence-only until marriage program that study after study shows is ineffective. This is a blatant double standard that may advance a partisan agenda, but it makes absolutely no policy sense. Each one of these programs was established in the hated Affordable Care Act. I put hated in quotes only to indicate the Republican sincere, on the part of some members, view of that law. I think it's a good law, but apparently no program in the bill even those with strong bipartisan roots, is immune from partisan attack. And the partisan agenda that these bills represent will not be a winning formula, not for health care reform, not for public health, and not for the American people. We may lose the votes today, but these bills, I hope, will not go anywhere in the Senate. On the other hand, we are considering a bill that tells the Commerce Department and the Agriculture Department to deposit in the Treasury any Recovery Act funds for broadband deployment that are returned by grant or loan recipients. We support that legislation. We work together with Chairman Walden, and we appreciate his willingness to work with us. I hope to support the amendment that the majority will offer today that reflects suggestions from the agencies on that point, and I yield back the balance of my time.
Thank you. I would remind all members that pursuant to the committee rules, all members' opening statements will be made part of the record. Are there further opening statements requested? I would yield 1 minute to the gentleman from Florida, Mr.
Thank you,
Stern.
Mr. Chairman. And let me just say to my colleague, Mr. Waxman, that the national debt of the United States has increased by $98 billion during the month of March. So I hope a lot of his amendments are going to help reduce that deficit. You know, as a country, we need to obviously get a handle on the control of this debt. Just because we followed Greece into democracy does not mean that we should follow them into bankruptcy. So I'm pleased that we're taking up this bill, and I commend the chairman on H.R. 1213. My colleagues, which would eliminate an uncapped, unlimited program in what the Democrats call the Patient Protection Affordable Care Act, which we call President Obama's health care bill, because this health care bill that the president is supporting and all the Democrats support grants far too much budgetary authority to the Secretary of Health and Human Services and far too little program requirements to ensure proper oversight. So I think our role here as Republicans is to bring oversight. It's fiscally irresponsible to give any one individual unlimited mandatory spending authority. I'm glad we can have the opportunity to correct this legislative error, and I thank you.
Do other members seek to make an opening statement? Gentleman from New Jersey, Mr. Pallone, is recognized for 3 minutes as the ranking member of the Health Subcommittee.
I hope. I was hoping.
Thank you, Mr. Chairman. The purpose of these bills is basically to defund the Affordable Care Act. But think about what the Republicans are actually taking money away from. You can't claim states have no flexibility within the Affordable Care Act and then defund one of the very foundations of state flexibility, the state exchange grants. You can't say in one breath that the Affordable Care Act doesn't do enough to address workforce training and then rescind funding in the law that provides for the training of primary care doctors. And you shouldn't claim to want to do more to curb teen pregnancy and then repeal a program created to reduce the rates of unintended pregnancy. And you shouldn't claim that prevention matters and then repeal the first real effort by Congress to commit a steady stream of funding to prevention programs. There's no real concern by my Republican colleagues about the use of mandatory funding, because if there was, you wouldn't have promoted mandatory funding time and time again for programs that you support, like the abstinence-only program. This markup isn't about funding streams. It's simply an effort to dismantle the health care reform law without offering any solutions in return. Now, I've been looking for these solutions at the hearings in the Health Subcommittee. They never come up. Our colleagues on the Democratic side keep challenging our Republican colleagues to come up with solutions for the problems in the health care system. They never have any. But we did get one today, or we're about to, and that is the Republican budget. I listened to the chairman of the Republican Budget Committee, Mr. Ryan, several times over the last few days, and basically what he's doing is what the GOP usually does, get old people. I think Mr. Markey has used that term many times, not the grand old party, but the party that gets old people. What they want to do now is privatize in their budget Medicare, basically say that seniors should go out like they used to in the old days before Medicare, trying to find a health care policy, and then they'll get some premium support, like a voucher. They'll get a little money to pay for it, and the rest of it they have to pay out of pocket. So there'll be no more guarantee of health care or health care insurance the way there is now under Medicare, because it essentially becomes privatized or vouchered, and you pay out of pocket. The budget also is going to severely cut Medicaid, another effort to GOP or get old people. And what is that going to mean? States aren't going to have the money for reimbursement for nursing homes. Nursing homes will close, or they'll, we'll go back to the days when there are fires or inadequate care. It is just amazing to me. I really think the Republicans ought to be ashamed of themselves if their solution to health care is to get rid of Medicare and Medicaid, which is essentially what I see in the Republican budget today. So now I know what the solution is. Repeal health care reform, get rid of Medicare and Medicaid, and I'm just wondering when we're going to move on to create jobs, grow the economy, and all the other things that my constituents ask about and which this committee has not been doing since January. I yield back.
Chairman yields back. Other members seeking recognition. Mr. Bass is recognized for 1 minute.
Mr. Chairman, thank you very much. I know most of the attention and debate today will be focused on the health care bills that we're marking up. I'd just like to comment that the first bill will take up the bill having to do with returning unused or reclaimed funds made available under the stimulus bill to the Treasury of the United States. May not seem like a significant piece of legislation. I'd only point out that this is a $7.2 billion program. Most of the money hasn't been allocated yet. The broadband map has just come out, and there may be significant issues relating to oversight that the subcommittee and the full committee will have to address over the coming months to make sure that we don't have significant hearings on waste, fraud, and abuse. I appreciate the fact that this is a bipartisan effort, and I think it's a good piece of insurance, if you will, that this committee needs to enact in order to assure that this program operates successfully. And I yield back.
Chair would recognize the gentlelady from California, Ms. Eshoo, for 3 minutes.
Thank you, Mr. Chairman, and good morning to all of the members. On the first bill that we're taking up relative to broadband, the minority supports it, and it actually is the second time we'll be voting on this issue because the language was contained in the Dodd-Frank legislation that any unused dollars would be returned to the Treasury. But we're ready to vote on this again, and we want effective oversight, and we want, if there is any, and I hope there isn't, but if there is, that oversight would identify where there's any abuse or fraud or waste, and dollars returned to the U.S. Treasury. I want to thank the majority for agreeing to work with us on some of the ambiguities in the legislation that could have unintended consequences on agency oversight relative to the OIG and the DOJ. On the health care bills, what do I say? First of all, this notion that this side of the aisle does not recognize the challenge of our nation's debt and deficit is simply not the case. In December, we voted for $41 billion in cuts in December. That was in December. But there is a saying, Mr. Chairman, there are those that know the price of everything and value nothing. If we were to go member by member and just pose the question, do you believe that prevention saves money? Did you have your children inoculated? You're not for a prevention fund? Investment in prevention and public health programs? These are some of the soundest investments across our nation and in communities across our nation. Are you not for tackling tobacco use? Are you against trying to do something about obesity that is so costly, not only to the federal programs, but to the states as well? I mean, it leads to diabetes, heart disease. We can go on and on. We have physicians on this committee. They know that. Are you not interested in tackling disease, stroke, and cancer? You're against that? That's what you're doing today. That's what you're doing today with these bills. Is there anyone here that's against graduate medical education funding? This is where our primary doctors are trained. It's a program that has proven itself over and over and over again. From Stanford University Medical Center to Lucille Packard Children's Hospital to the children's hospitals across our country. You're against that? I guess so. That's what's in your bills. I think that there is something in the DNA of the Republican Party, something in the DNA that when there is something for the many, for average people, you can't help yourselves. That's cost too much. That costs too much. I think that this is really a slippery slope today. I think it is a sad statement about this committee that for years, as Mr. Waxman said, continued to build on bipartisan agreements on where we could make progress on health care issues for the people of this country. I think it's a sad day, and I think these attacks are really dreadful. I yield back.
It has expired. Gentleman from Georgia, Dr. Gingrich, is recognized for 1 minute.
Mr. Chairman, thank you very much. And if you ask the questions in the way the distinguished ranking member of the subcommittee put them, sure, the answers would be yes, we're for all these things. But if you ask the American people the question, are you also, along with that, for $49,000 worth of debt for everybody in your household, you'd get a different answer. As everyone knows, the financial health of the nation is in a very precarious state. And I want to thank Chairman Upton for holding the markup today. Some in this room may argue, as Ms. Eshoo just did, the potential health benefits that the funding stream in these bills may provide. My concern is how much damage to our national budget the White House can do with, and will do with these funding streams. Buried in the 2,400 pages of Obamacare is a direct pipeline to the Treasury that allows the White House to tap into an unlimited amount of federal funding and sidestep any congressional oversight in the process. This funding stream represents a clear and present danger to the financial health of this nation, and it must have congressional oversight. If this is truly the people's house, give them back what the last Congress took away, control over their budget. If this body is sincere in its wishes to restore fiscal sanity in this country, I see no reason why we should not be voting in a bipartisan manner to prevent this president or any president from spending our nation into insolvency. Mr. Chairman, I yield back. Thank you.
Gentleman's time has expired. Other members seeking time. The gentleman from Michigan, the great state of Michigan, is recognized for 3 minutes. Mr. Dingell.
Mr. Chairman, I thank you for your courtesy. Today's markup serves as yet another opportunity for the majority to strike away at the heart of the Affordable Care Act through its public health programs and state-based exchange grants. These attempts to defund or convert pieces of the Affordable Care Act seem contrary to what my colleagues in the majority claim to be in favor of. They say they're for improving the nation's health, yet they're going to repeal the Prevention and Public Health Fund, which would make national investments into innovative prevention and public wellness activities. They claim to support the school-based health centers, yet they're going to repeal the construction and renovation funds which serve as the first major investment in these badly needed centers. They claim to want to allow the states to address the needs and challenges of their individual populations, yet they're going to repeal the state-based exchange grants which will help the states to set up exchanges that will work best for them in their own unique circumstances. In the subcommittee, we heard time and time again about the purported outrage over the fact that these programs, the Prevention and Public Health Fund, the Teaching Health Centers, the Personal Responsibility Education Programs, the School-Based Health Center construction grants, and the state extension grants were mandatory in nature. Yet we have seen numerous pieces of legislation that have come and gone before members of this committee and have included both mandatory and discretionary streams of funding. And my colleagues on the other side have not infrequently supported that. I do not believe that today's markup is going to produce any bit of substantive legislation that will improve or contribute to the nation's public health or the well-being of American families. I would also note that probably these bills are not going to become law. The American public demands more than no solution to the health problems. More importantly, American families are tired of continued infighting in Washington. They deserve more than a rehash of last Congress's debates. They want to know how they will benefit from the changes in our health system laid out in the Affordable Care Act. And it's our duty as members of Congress to provide them with these answers. They want progress and resolution of our nation's problems based on honest and meaningful cooperation in Washington. The Affordable Care Act includes some of the strongest consumer protections in our health system in years. Insurance companies can no longer make health decisions for families. Patients can no longer be denied health insurance due to pre-existing conditions. Seniors will have help in affording their prescriptions. College students will be allowed, amongst others, to stay on their parents' health insurance plans. This is legislation at its best, protecting consumers from abuses in industry. We all want health care coverage that is more affordable and covers the uninsured and underinsured, and we have a chance to do so at this time. I urge us to work together on this rather than spend our time carping about what we don't like that the last Congress did.
Gentleman's time has expired. Chair would recognize the gentleman from Ohio, Mr. Latta, for 1 minute.
Thank you, Mr. Chairman, and thank you very much for holding the markup today on 5 important bills on helping to control the out-of-control spending in Obamacare. From the beginning of the health care debate, House Republicans have worked to provide meaningful health care reform solutions. Unfortunately, last year, the Democrat-controlled Congress pushed through a bill that Americans did not want or could not afford. During the last district work period, I held courthouse conferences in 10 of my 16 counties. During this time, I had over 134 one-on-one meetings with my constituents, and the message I got loud and clear was repeal Obamacare and get the federal government out of our lives. I believe the bills before us today will help Congress to rein in this out-of-control spending at a time when the President's fiscal year 2011 deficit will reach an all-time high of $1.6 trillion, 10.9% of the GDP, and spending in fiscal year 2011 will reach an all-time high of $3.8 trillion. It is extremely irresponsible to allow the spending in Obamacare to continue. We are on an unsustainable path, and we must balance our federal budget just like American families have to. And with that, Mr. Chairman, I yield back.
Gentleman yields back. Would recognize the gentleman from Texas, Mr. Green, for 1 minute.
Thank you, Mr. Chairman. I appreciate the opportunity. I ask unanimous consent to full statement be placed in the record. Let's face it, we're having a political debate today, and we can't ignore the fact that these difficult times Americans are struggling to pay for their insurance. A large number of Americans have access to quality, affordable health care through the Affordable Care Act. Even in Texas, our Department of Insurance reported our legislature acknowledged the positive impact of the Affordable Care Act. As the Texas Department report states, the removal of underwriting restrictions, new premium rating reforms, availability of subsidies, and limitations on out-of-pocket expenses for low and middle-income families should make it easier for many lower-income Texans to obtain private insurance. By these bills today, you're attempting to do what you can't do legislatively, is to actually cut the funding for the Affordable Care Act. You're attempting by undermining the basic structure of the health care reform, including eliminating funding for the states to set up these health insurance exchanges, stripping funding from public health and prevention fund, and a bill to convert mandatory funding for teaching health center program to discretionary funding. Mr. Chairman, I would look forward to working on reform of the Affordable Care Act on a bipartisan matter, and I would hope that we would be able to do that. And we need to work together and ensure all Americans have access to health care and hopefully stop the political grandstanding. I yield back my time.
Chairman yields back. Other members seeking recognition. Gentleman from Texas, Mr. Olson.
Thank you, Mr. Chairman, and thank you for your leadership in holding this important markup. One of the many reasons I voted against the President's health care bill was because it contained mandatory slush funding spending provisions, such as the $17.75 billion account for the Prevention and Public Health Fund, and the unlimited direct appropriation to help states set up exchanges created under Obamacare. And echoing my colleague from Georgia's concerns, these provisions take away congressional spending authority and give it directly to Secretary Sebelius, granting her full authority to spend the funds in these accounts practically on any practical program or activity she chooses. So much for the Constitution. The American people deserve better than having unelected bureaucrats control tens of billions of their hard-earned tax dollars. With the passage of these 5 bills today, we will be taking tremendous steps forward in keeping our promise to the American people to repeal and replace the President's health care bill with common sense reforms and bring fiscal sanity back to Washington. Thank you. I yield back.
Gentleman's time has expired. Other members, the gentlelady from Wisconsin, Ms. Baldwin. Oh, I saw your hand for gentleman from Pennsylvania, Mr. Doyle, is recognized for 1 minute. I was looking for hands first.
Thank you, Mr. Chairman. We're here to address 6 bills today, 5 to repeal various components of the Affordable Care Act signed into law last year. 1 addresses a telecom issue, and I appreciate Chairman Walden's working with our side of the aisle to improve that bill. As I said last week, I don't think this bill is usually critical, but I will support its passage. Regarding the additional 5 ridiculous bills before us today, my limited time only allows me to address one piece of legislation that is of particular concern, H.R. 1216, offered by Mr. Guthrie, which would fundamentally change the funding mechanism for Medicare graduate medical education. We all agree there's a shortage in primary care physicians. I don't think anyone disputes that. So why are we here debating this bill? This legislation would take the jurisdiction out of the hands of this committee and allow our friends in the Appropriations Committee to decide whether or not to fund training for primary care providers, even though that's an issue that this committee has jurisdiction over and has devoted time, research, and energy to. Mr. Chairman, these 5 bills are nothing more than a war on doctors and a war on patients. I hope they all fail.
Thank you, I think. Recognize the gentleman from Mississippi, 1 minute, Mr. Harper.
Thank you, Mr. Chairman. The Affordable Care Act jeopardizes care for the elderly, compromises the beliefs of pro-life Americans, penalizes job creators, limits states' flexibility under Medicaid, and results in job losses. You know, I believe that individuals with pre-existing conditions should have access to care. Also, if you change your job, you and your family should be able to keep your health insurance. These are simple solutions that both parties of Congress could have agreed to adopt. But instead of advancing a bill that focuses on access to care, protects the patient-doctor relationship, and lowers health care premiums through increased competition and choice, the President signed a $1.445 trillion law that reduces seniors' Medicare benefits $523 billion and raises taxes $569 billion. Further, this carelessly drafted law includes mandatory funding that bypass the standard committee process. I'll support today's bills that defund and or make mandatory funding subject to the normal appropriations process. Thank you, and I yield back the balance of my time.
I'm going to yield back. Recognize the gentlelady from Illinois, Ms. Chakowski.
Thank you. These are totally counterproductive pieces of legislation that will make the health of our citizens much worse and aren't going to do a darn thing to really put a dent in any kind of savings. It'll cost more in the end. Eliminating critical investments in public health and prevention. There's a good one. Or cutting funding to prevent smoking. 21% of the people in my district, adult population, smoke. That's not going to help them. Cutting funding to prevent obesity, the number one problem, healthcare problem in our country. Does this make any sense to eliminate? And eliminating efforts to reduce premature deaths. Do the American people know what you're doing? I am joining this week a fast that was called by the religious community and some progressive organizations. Jim Wallace, president of Sojourners and Bread for the World, and others who are continuing a prayer fast to express moral outrage at the devastating impact of proposed federal budget cuts on those most vulnerable in our society. Case in point are the bills that we're seeing today. This is a moral issue. We should not support these bills.
Chair to recognize the gentleman from West Virginia, Mr. McKinley.
Thank you, Mr. Chairman. I'm grateful to this committee for taking the time to mark up these 5 health bills, which will defund and limit the slush funds under President Obama's unconstitutional health care bill. This is an important step, one more step in showing the American people we are here to fight for them. Despite the irresponsible and offensive language of those who say we are not broke, they must not recognize that we have been spending money we don't have.
What part of $1.6 trillion in deficit do people not understand? This has to stop. These bills reflect the fiscal common sense that has been missing in adult conversations in Congress for too long. Mr. Chairman, I yield back my time.
Chairman yields back. Would recognize the gentlelady from Wisconsin, Ms. Baldwin.
Thank you, Mr. Chairman. Bait and switch. That's what it's called when you run for office saying one thing, you get elected, and you start doing something entirely different. Bait and switch is why Wisconsinites have taken to the streets by tens of thousands. Last election was about jobs and the economy. The Energy and Commerce Committee should be in the forefront of our nation's jobs agenda. But instead of leading on putting Americans back to work, what are we doing? We're marking up 5 bills offered by the Republicans that will not create jobs, will not stimulate our economy, and they will not put middle-class Americans back to work. I urge my colleagues to oppose these 5 bills and yield back the balance of my time.
Gentlelady yields back. Are there other members on the Republican side seeking to make an opening statement?
Mr. Chairman.
Gentleman from California.
Mr. Chairman, I wasn't planning on making a statement, but let me just say, after listening to my colleagues, some of us were around last year when the so-called health care bill was being proposed and being placed through so quickly that we said, let's give us time to read it. There were many people on the other side of the aisle that said, look, we need to pass this now. We can always go back and straighten out and correct the problems that you find later once we get to read the bill. So I really find it hard to believe that you didn't expect some kind of review, some kind of correction, some kind of at least scrutiny over this issue. And I said that before, probably the kindest words I've ever heard about this town is the problem with Washington isn't that they try new things or that they make mistakes. But when they try new things and make mistakes, they're not brave enough to go back and correct it. And so I just ask that you may not agree with the changes, but you must embrace the concept that it's not only a right, but a responsibility of this committee to try to go through and improve it as we see appropriate at the time. This is what we're elected to do. Like it or not, we didn't take the time to read and go through the bill before it was passed. We darn well have the responsibility to do it now, as promised the American people when it was passed. I yield back.
Chair would recognize the gentleman from North Carolina, Mr. Butterfield, for 1 minute.
Thank you very much, Mr. Chairman. Mr. Chairman, the bills that we are marking up today are very, very troubling, to say the least. My colleagues make the argument that the Affordable Care Act adds to the deficit and to the debt, and that is absolutely not the case. The Congressional Budget Office has said it time and time again. The Affordable Care Act is an issue that obviously continues to divide the Congress, and it divides the American people, and I acknowledge that. But let me tell you, in my district, the constituents that I represent by an overwhelming majority support the Affordable Care Act. And this is not Obamacare. This is the Patient Protection and Affordable Care Act. That is the name of this law. I ask my colleagues to read the bill. You talk about reading the bill. You read the bill and see if the word Obamacare is in this bill in any way. This is a political witch hunt today. I ask you to stop it. Let's reconcile our differences, and let's put this to rest once and for all. I yield back.
Are there other members on the Republican side seeking to make an opening statement? If not, the chair would recognize the gentlelady from California, Ms. Matsui.
Thank you, Mr. Chairman. I'm in opposition to the health bills before our committee today. They will work to limit choice, limit access, and limit the quality of care to all Americans. They cut funding to states and localities that help ensure better preventive care is present in their communities. They cut programs aimed at helping provide low-income kids with long overdue medical care. They cut funding to medical students seeking careers in primary care, and they cut funding to states to help establish more efficient health insurance marketplaces. These bills collectively and individually harm our most at-risk populations, children and seniors. We should reject these bills so that we can work together to improve our health care delivery system in a meaningful and constructive manner. I yield back the balance of my time.
Chair would recognize the Chair Emeritus of the committee, Mr. Barton, for 3 minutes.
Thank you. I won't need but one, Mr. Chairman. I'm going to submit my opening statement for the record. I just want to say, having listened to all my friends on the minority side, I would give Mr. Butterfield the A+ for the most intense delivery, the best use of props, and I hope that Mr. Waxman gives him a popsicle. And I yield back.
Chair would recognize the gentlelady from the Virgin Islands, Ms. Christensen.
Thank you, Mr. Chairman. Mr. Chairman, I'm just amazed at what's happening here today. Not only has the majority not created jobs or done anything to support the recovery, but today these bills threaten to throw this country back into the ditch the Bush administration put us in. Just when President Obama and Democratic policies are slowly beginning to create jobs and revive the economy, defunding these critical parts of the Affordable Care Act would make insurance unaffordable to middle-class families, make sure we don't have sufficient providers to care for the sick, and undermine the Prevention and Public Health Fund, the very programs that would reduce health care costs, not to mention make this country healthier. These bills would hurt the American people, hurt our country, and waste time we should be using to deal with the serious challenges the poor and middle class in this country are facing. Thank you. I yield back.
Are there other members wishing to make an opening statement? If not, if there are no further opening statements, the chair will call up H.R. 1213 and ask the clerk to report.
H.R. 1213 to repeal mandatory funding provided to states in the Patient Protection and Affordable Care Act to establish American health.
Without objection, the first reading of the bill is dispensed with, so ordered, and would recognize myself for 5 minutes for an opening statement on the bill. Let me just get this clock right. I'm going to be brief because I discussed my bill during my opening statement. As we all know, the federal government is borrowing 41 cents of every dollar that it spends. We are facing a $1.6 trillion deficit for this fiscal year and the next, the third straight year of trillion-dollar deficits, an all-time record in nominal terms and a new post-World War II record as a share of the economy. There are no two ways about it. We're broke. Some say increase taxes, but Washington is already spending more than 1 out of every $4 that the country has. We don't have a revenue problem. We have a spending problem, in my belief, and it is a problem that we must get under control. Section 1311A1 of PPACA provides a direct appropriation of the amount necessary to enable the HHS Secretary to make awards for state-based exchanges. That language empowers the Secretary to determine the amount that she wants to spend with no limit. These awards can be used to facilitate enrollment in the exchanges. However, there is no definition of what that means. It could be interpreted to mean a variety of things. Mr. Guthrie brought up comments from an HHS employee telling states that they can get out of their budget problems driven by Medicaid spending by tapping other streams of revenue. For example, these exchange subsidies. Many amendments have been filed to this bill, but not one so far would actually curtail the power of the Secretary to spend unlimited amounts from the Treasury. Not one amendment that would put some fiscal limitation to the direct tap into the taxpayer's pocket. This is essentially a mandatory spending provision that includes such sums as necessary and gives the Secretary sole power to determine what is necessary. Then you have government bureaucrats suggesting that the money can be used for purposes unrelated to the supposed purpose of the fund. How can anyone not be concerned with a provision like that when our country is facing such a serious fiscal challenge? Regardless of our views on the health care law, no one should support providing the Secretary of HHS an unlimited tap in the Treasury for undefined activities, and thus I would urge my colleagues to support H.R. 1213. Yield back my time. Are there amendments or discussions further on the bill? Gentleman from New Jersey, Mr. Pallone, has an amendment at the desk and is recognized 5 minutes to talk about his amendment, and the clerk will report the title of the amendment.
Number 25. Have I been recognized, Mr. Chairman, to speak?
Yeah, the gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. This bill attacks one of the linchpins of health reform, grants to states to establish their insurance exchanges. Exchanges are a work in progress, and all the work that 49 states, the District of Columbia, and 4 territories are engaged in would be fully undermined by a repeal of the exchange establishment grants by H.R. 1213. These grants are structured to allow states to develop a state-specific solution and design for their individual marketplace. The exchanges are to be what states want to make of them, giving them the kind of flexibility and choice that is needed to meet the unique needs of their residents. Now, if we don't have this funding under the grants, states will not be able to choose the type of marketplace that is best for their families and businesses. In addition, repeal of these grants could not come at a worse time for states. Given current budget deficits in most states, repeal would result in states not meeting the benchmarks for running their own state-based exchanges. The truth is, these funds are not taking away the exchanges. The Affordable Care Act requires every state to have a health insurance exchange, and in instances where the state opts out, the federal government steps in. Therefore, the federal government will run the state exchange if the state does not set one up and doesn't have the money to do so. The federal government will decide how many exchanges there will be in a state. The federal government will decide how to open the marketplace and what plans there will be. And the federal government will set up a competitive, transparent marketplace. Now, I know that my colleagues on the other side of the aisle have been advocates for state rights in general, and they've been talking endlessly at the Health Subcommittee meetings about the need for flexibility with states given the budget crisis. So how in the world does it make any sense to take away the grants that would allow the states to set up their own exchanges and have some ability to run them and decide how to tailor them for what's best in the state's needs? This makes no sense. I understand they want to repeal the exchanges outright, but the defunding bill makes even less sense because, in fact, what it means is that the federal government is essentially going to take over and run these state exchanges. Now, what I am doing in my amendment, Mr. Chairman, is to prevent the repeal of these funds in states where the governor certifies that the governor does not want the federal government running their exchange marketplace and the governor wants to establish a state exchange. So what we're basically saying here is we know there are a number of states, the majority by far, that want to run their own exchanges, would like to have the funding available so that they don't have the federal government running the state exchanges. And if the governor certifies that that's what he wants to do, which I think most governors probably will, then there would not be repeal of these funds under my amendment. I think it makes perfect sense. I certainly would not want to be a member of Congress from a state that is looking for this money so that they have some control over what goes on with these exchanges and have the federal government take that money away. The other thing that I would point out, and I don't need to, I guess, is that why the state exchanges are so important. I mean, obviously, the state exchanges are a fundamental linchpin, if you will, of the whole health care reform. They're the way that people become part of a large insurance pool, don't have to go on the individual markets, small groups as well can buy it, so that essentially you're treated like you would if you were negotiating with a large corporation. You have numerous choices. These are all private plans. They have a very good benefit package, generally speaking, as good as you would get for Blue Cross or Blue Shield on your states. And, of course, the idea is to provide universal coverage and provide also tax support so that your premium, depending upon your income, is significantly less than it would be now if you had to go out on the open market. But again, I would stress, Mr. Chairman, that this amendment doesn't even get rid of the state exchanges. Essentially what it does is make them federal exchanges, and I don't understand how any of my colleagues on the Republican side could support that. I yield back.
Chair, thanks, gentlemen. Is there further discussion of the amendment? The Chair recognizes gentleman, Mr. Stearns, for 5 minutes.
Thank you, Mr. Chairman. I rise in opposition to the amendment. Congressional research has confirmed that it's an unlimited grant. There's no ceiling. Unlimited amount of American taxpayers' money can be used to fund. Now, on this side of the aisle, you know, at one time the bill was Pelosi Care because it was basically the Pelosi bill. Then it became the Senate bill, and then the leading drive was President Obama, so we call it Obamacare. Now, the gentleman from North Carolina complains about us using this terminology, but within the bill's title, they say the Affordability Act. I think most of us on this side don't think Affordability Act is an accurate description of what this bill is. And this is a good example of this amendment from New Jersey, where it allows unlimited amount of grants to be provided to states to establish exchange. And when you think about it, each state should be allowed a certain amount of innovation. But if they don't comply with the federal government specifically and distinctly, then they don't get the funds. So in a larger sense, we are not allowing innovation of the states, the best ideas of the citizens, depending upon whether you're in Vermont or whether you're in Florida, whether you're in California or whether you're in Iowa. The Secretary can simply withhold the funds, and that means the state can't get it unless they comply. So in a larger sense, the amendment is wrong in terms of allowing elegance and innovation in this healthcare system. In a larger sense, it's creating further problems with our deficit. As we talk about this, it's $1.6 trillion deficit. It's an all-time large amount. This is the third straight year of trillion-dollar deficits, an all-time record in nominal terms since World War II. And so when people complain about Republicans objecting to amendments that are like this, it's clear that we just can't afford it. If the gentleman from New Jersey would amend his amendment to try and put a ceiling on it, I think that would perhaps allow some of us to even
Would the
consider
gentleman
it.
yield?
No, I won't yield.
Well,
but I think
you just asked me if I a question.
well, I'll let you yield. I'll yield to you when I have a little less time. But I think at this point, if CRS says it's unlimited and we think it's going to be a dictate to the states, then we can't agree on it. And I would say to the gentleman from North Carolina that to call this amendment part of improving the Affordability Act, which he likes to use, is just wrong, because in a larger sense it's creating even more spending. And the fact that the gentleman from New Jersey has to come here and offer this amendment to increase spending is really perplexing to all of us on this side. And with that, I'll yield to him.
Well, first of all, I want to point out that the grants available under the Affordable Care Act to the states are not open-ended. They're not available beyond 2015. Starting January 1st, 2015, state exchanges will have to be self-sufficient.
Let me take back my time. The fact that you have a date when they're not allowed doesn't mean that this money can't be given out freely during that period. In fact, we have two recent examinations in the Oversight and Investigation Committee that I chair that the Health and Human Services is handing out money to corporations that are very profitable, and they're giving this money to help them transition for the employees that are early retirement. And large corporations across this country are getting a huge amount of money from the Health and Human Services, and this is going on, and many are perplexed why profitable corporations would get so much money, including the UAW. They got $206 million.
Will the gentleman yield again?
No, I won't yield. And so the argument is that your amendment clearly is a case where it's unlimited, and you say it'll stop at a certain date. But if you give out money and you've got a period that you can give it out, then all the states are going to want this money because they're in the same shape in a larger sense like the United States. They have deficits too, but they have to balance their budget. So they're more amenable to getting grants. So I think what's going to happen, Mr. Chairman, is these grants are all going to be given out before the exclusion date that he has specified. And so I strongly urge my members to oppose this amendment.
You have 30 seconds. Could I just take that up a minute? Would you yield me the last 30 seconds? My only point is that the states have...
I will yield. I will yield to the gentleman from New Jersey.
The states have to set up these exchanges anyway, and if you deprive them of the money to do so, then the federal government is going to run the exchanges and spend money running the exchanges. So you don't accomplish anything by taking away the state's money.
Take back my time. I'm just looking at the bill itself, that basically the federal government is setting up the grants based upon what the states must do, so there's no innovation allowed for the states.
The gentleman's time has expired. Is there further discussion of the amendment? The chair, for what purpose does the gentlelady seek recognition?
To strike the last word.
The gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. Once again, instead of focusing on creating jobs and bolstering our economy, we are considering a series of bills today that lead to job loss and will hinder our economic recovery. Today we are considering a Republican proposal that would repeal funding to states to establish health insurance exchanges. Health insurance exchanges will serve as an open marketplace where consumers can comparison shop among various private health insurance plans. For the first time, individuals can select the insurance option that best suits their health care needs. These exchanges are critical for ensuring that thousands of small businesses and 24 million Americans have access to new coverage options. The grants to states provide states with the flexibility to create an exchange that best meets their own state's unique needs. Wisconsin has already received a $38 million grant through, and it's an early innovator grant, and this critical funding will spur job creation and improve access to quality, low-cost health care coverage. The Republican bill raises an important question. Are we going to ask cash-strapped states to return money they've already been awarded? Will Wisconsin have to return the $38 million that Governor Walker recently accepted? And I fail to see how rescinding money that will create jobs is the right thing to do to get our economy back on track. Furthermore, I'd like to remind my colleagues that the idea of using an exchange to allow consumers to select a health care plan that best suits their own needs is not a new idea. In fact, it's not even an idea that has been proposed just by Democrats. The Medicare Part D prescription drug program, which was established through the Medicare Modernization Act under Republican leadership, operates under an exchange model. Medicare participants have access to the Medicare drug benefit through private plans approved by the federal government. These Part D plans are required to provide a standard benefit or one that is actuarially equivalent. In 2011, there are 47 million Medicare beneficiaries who will have a choice of 1,109 prescription drug plans across 34 prescription drug plan regions nationwide. Now, while we may not use the word exchange, this Republican program sounds remarkably similar to the plan to establish state exchanges for health insurance. I'd also like to remind my colleagues of another similarity. Given that many states already had different programs to assist seniors with prescription drug costs, the Medicare Modernization Act included a transitional grant program that provided states with federal funding to ensure a smooth transition. These grants were awarded to states to cover the costs associated with setting up the new exchanges, including educating eligible individuals, providing technical assistance and counseling to enrollees, and promoting effective coordination of enrollment, coverage, and payment between state programs and Part D plans. I'd like to point out to my colleagues on the other side of the aisle that despite much Democratic opposition to the Medicare Modernization Act, a law that was not paid for and has contributed to our current financial crisis, Democrats nonetheless did not spend our time trying to repeal this law. We did not spend our time debating ill-conceived proposals to gut implementation or eliminating funding like the transitional grant program. Instead, we focused our efforts on issues facing the American people, providing affordable health care coverage and creating jobs. I urge my colleagues to do the same. Let's work together to provide real solutions for the American people rather than waste our time on measures that will take away health care and jobs from the people who need it most. I support the gentleman's amendment and oppose the underlying bill and yield back the balance of my...
Will the gentlewoman yield? Gentlewoman yield?
Oh, yes.
Yeah, I appreciate your comments, and I just wanted to say, I know, I'm so tired of having the Republicans. You had Haley Barbour come here, talk about flexibility, flexibility, flexibility. The state-based health insurance exchanges give states all kinds of flexibility to establish exchanges that meet the unique needs of their residents. States can determine which insurers are permitted to offer products, consumer-driven health plans, and things like health savings accounts that the Republicans have been championed will be available. The flexibility is there. Just let them use the money, and they will create the flexibility. Thank the gentlewoman.
Is there further discussion of the amendment? Gentleman from California.
Mr. Chairman, just quickly, I'm not going to use up all my time. I'm going to say, you talk about the flexibility. You already have one state with Bernie Sanders actually asking the fact that the Obamacare, the package did not give their state the flexibility to become a single-payer state until they couldn't even be considered until 17. They're asking to 14. So let's not talk about the flexibility here. Even in the base bill that was passed last year, that doesn't give the states the flexibility you keep talking about. And now you got the left complaining that they don't get to take it far enough because of the restrictions that bill. And I yield back.
Will the gentleman yield?
Gentleman yields back. Is there further discussion of the amendment?
Now he's complaining because
Either side. If there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All those opposed, no. No. The nays have it. The amendment is not agreed to. The ranking member requests a roll call vote. The clerk will call a roll.
Mr. Barton? No. Mr. Barton? No. Mr. Stearns? No. Mr. Stearns? No. Mr. Whitfield? Mr. Shimkus? Mr. Pitts?
No.
Mr. Pitts? No. Mrs. Bono-Mack? Mrs. Bono-Mack? No. Mr. Walden? Mr. Terry? Mr. Rogers? Mr. Terry? No. Mr. Rogers? Mr. Rogers? No. Mrs. Myrick? No. Mrs. Myrick? No. Mr. Sullivan? Mr. Sullivan? No. Mr. Murphy? Mr. Murphy? No. Mr. Burgess? Mr. Burgess? No. Mrs. Blackburn? Mr. Bilbray?
Bilbray, no.
Mr. Bilbray? No. Mr. Bass? Mr. Bass? No. Mr. Gingrey? Mr. Gingrey? No. Mr. Scalise? Mr. Scalise? No. Mr. Wada? Mr. Wada? No. Mrs. McMorris Rogers? Mrs. McMorris Rogers? No. Mr. Harper? Mr. Harper? No. Mr. Lance? Mr. Lance? No. Mr. Cassidy? Mr. Cassidy? No. Mr. Guthrie? Mr. Guthrie? No. Mr. Olson? Mr. Olson? No. Mr. McKinley? Mr. McKinley? No. Mr. Gardner? Mr. Gardner? No. Mr. Pompeo? Mr. Pompeo? No. Mr. Kinzinger? Mr. Kinzinger? No. Mr. Griffith? Mr. Griffith? No. Mr. Waxman?
Aye.
Mr. Waxman? Aye. Mr. Dingle? Mr. Dingle? Aye. Mr. Markey? Aye. Mr. Markey? Aye. Mr. Towns? Mr. Pallone? Aye. Mr. Pallone? Aye. Mr. Rush? Ms. Eshoo? Aye. Ms. Eshoo? Aye. Mr. Engel? Mr. Green? Aye. Mr. Green? Aye. Ms. DeGette? Mrs. Capps? Mrs. Capps? Aye. Mr. Doyle? Mr. Doyle? Aye. Ms. Schakowsky? Mr. Gonzalez? Mr. Inslee? Ms. Baldwin? Ms. Baldwin? Aye. Mr. Ross? Mr. Wiener? Mr. Wiener? Aye. Mr. Matheson? Mr. Matheson? Aye. Mr. Butterfield? Mr. Butterfield? Aye. Mr. Barrow? Mr. Barrow? Aye. Ms. Matsui? Ms. Matsui? Aye. Ms. Christensen? Ms. Christensen? Aye. Mr. Upton?
Votes no.
Mr. Upton? Nay.
Are there any other members wishing to be recorded? Mr. Whitfield?
Mr. Whitfield? No. Mr. Walden? No. Mrs. Blackburn? No.
Shimkus?
Mr. Shimkus? Mr. Shimkus? No. Ms. Schakowsky? Ms. DeGette? Sorry. Ms. DeGette? Aye. Is that all we got?
The clerk will report the result.
So we got a full vote on our side? Mr. Chairman, on that.
Mr. Chair, I got a couple other people to recognize, I hope, on the vote.
Mr. Inslee?
Mr. Inslee as aye.
Mr. Inslee, aye.
Anyone else? If not, the clerk will report the result.
Mr. Chairman, on that, there were 31 ayes, 17 nays. 17 ayes, 31 nays.
Yeah. Mr. Ross.
I'd like to ask unanimous consent to be included in the roll call. Without objection.
Without objection? So ordered.
Mr. Ross, aye.
Okay, the clerk will report.
Mr. Chairman, on that, there were 18 ayes, 31 nays.
The amendment is not agreed to. Are there further amendments? Gentleman, Mr. Markey is recognized.
Thank you, Mr. Chairman. I have an amendment at the desk.
Clerk will report.
What number, Mr. Markey?
Number 22.
An amendment by Mr. Markey.
Without objection, the rating's dispensed with. Chair recognizes gentleman for 5 minutes in support of his amendment.
Thank you, Mr. Chairman, very much. My amendment is quite simple. It protects people from facing sky-high insurance premium because they have battled cancer or are fighting diabetes or have any other pre-existing condition. A key protection in the health care law passed a year ago is that insurance companies can no longer turn away someone or charge them a higher premium based on pre-existing conditions. States will review the health plans that insurance companies will be offering in the exchanges to ensure that the plans follow the rules outlined in the law, including the rule that they can't charge higher premiums because someone has been sick. But this Republican bill would deny states the funding they need to do just that. It repeals the funding for states to perform these quality control checks on health insurance plans that will be newly available in the exchange pool. And given the current budget crises amongst the states, taking away this important source of funding would handicap their ability to perform these checks, leaving consumers at risk and unable to obtain adequate insurance coverage. So, I propose an amendment that would protect this funding for states if they are using it to certify that health plans meet the standards outlined in the health law and do not charge higher premiums based on pre-existing conditions. This is an important protection to ensure that consumers aren't getting gouged by the insurance companies. I encourage my colleagues to support this amendment. It goes right at the heart of one thing that I think every American is concerned about, and that is that their families will be penalized because a family member has a pre-existing condition. So with that, I yield to the gentleman from New Jersey, Mr. Paloma.
Thank you, Mr. Chairman. And just briefly, I just wanted to add my support for this amendment. My own state of New Jersey has been awarded a $1 million grant to research the number, demographics, and health characteristics of New Jersey residents who would be eligible and likely to enroll in the exchange products, and they're conducting forums and online surveys to obtain input into the design of the exchange. So this is one of the things, as Mr. Markey explained, that's very important that's going on now, and that is to find out what the situation is and to what extent you have people who have pre-existing conditions and how that's going to be addressed as you set up the exchange. Again, this is part of the state flexibility, which the Republicans have been championed and talking about for so long. We had it at our health subcommittee hearing. We had some Republican governors come in. They talk about the need for flexibility. Why in the world would you want to eliminate that when these state exchanges are going to be part of the health insurance reform, and the states are going to be required to set them up or have the federal government take them over? I yield back to the gentleman.
Thank you, gentlemen, and I yield back the balance of my time.
Chair, thanks to the gentleman. Is there further discussion of the amendment? The chair recognizes the gentleman from Georgia for 5 minutes.
Mr. Chairman, thank you. You know, my Democratic colleagues are arguing
for this unlimited tap into the federal treasury by the Secretary of Health and Human Services, giving any executive branch official a blank check, in my opinion, is a bad idea. It doesn't matter whether it's a Democratic administration or a Republican administration. The only thing worse than writing a blank check to federal political appointees and Washington bureaucrats is to cover up these slush funds under false claims that we are helping Americans by doing so. Growing the federal deficit will not help Americans. And as I said in my opening remarks, $49,000 worth of debt for every man, woman, and child is what we need to be focusing on. We all believe that every American should have the ability to access affordable health care coverage. However, I almost said Obamacare, but in deference to Mr. Butterfield, that Patient Protection and Affordable Care Act has been analyzed repeatedly by unbiased sources, and the evidence is clear. The costs will rise, premiums will rise, access to care will decrease, and jobs will be lost. A vote against eliminating the slush funds created in Obamacare is a vote to exacerbate the problem that the same bill already created the future of our health care system and the sustainability of our nation. This committee has a responsibility to ensure that health care programs are authorized and reviewed for efficiency, integrity, and effectiveness. And not just health care programs, but, Mr. Chairman, every program that we have jurisdiction over, and we have broad jurisdiction, obviously, in this great committee, Energy and Commerce. And for us to give up that responsibility, why do we even show up? A blank check to the Secretary of HHS rejects the possibility of that oversight. And for that reason, I urge my colleagues, please,
Would the gentleman yield?
Oppose the amendment.
The gentleman yield?
I will yield to Mr. Pallone.
You know, when the Medicare Prescription Drug Improvement and Modernization Act was adopted, it included specific mandatory appropriations, including an unlimited mandatory appropriation for a drug assistance program. Just very similar. In other words, until the regular Part D was set up, there was unlimited appropriations which the Secretary had control of to fund a transitional drug assistance program.
Well, let me reclaim my time, Mr. Pallone. This is my time, and I would say to you, and this is oversimplification, that two wrongs don't make a right. Go back to November of 2003. I voted for Medicare modernization, the Prescription Drug Act, Medicare Part D. I think the seniors in this country are very happy with Medicare Part D, but we didn't pay for it. We should have paid for it. It added to the debt. It added to the deficit. In retrospect, we should have paid for it. But don't go back and say because we did this, that, or the other thing that we should do something wrong again today. As I point out, two wrongs do not make a right, and I think this is wrong. And I yield back the balance of my time.
Gentleman yields back his time. Are there other members wishing to speak on the Markey Amendment? If not, we're prepared for the vote. Do you want a recorded vote? And I'll ask the clerk to call the roll. All those in favor of the Markey vote will respond aye. Those opposed say no. Clerk will call the roll.
Mr. Barton. Mr. Barton, no. Mr. Stearns. Mr. Whitfield. Mr. Shimkus. No. Mr. Shimkus, no. Mr. Pitts. Mr. Pitts, no. Mrs. Bono-Mack. Mrs. Bono-Mack, no. Mr. Walden. Mr. Terry. Mr. Terry, no. Mr. Rogers. No. Mr. Rogers, no. Mrs. Myrick. Mrs. Myrick, no. Mr. Sullivan. Mr. Murphy. Mr. Murphy, no. Mr. Burgess. Mr. Burgess, no. Mrs. Blackburn. Mrs. Blackburn, no. Mr. Bilbray. Mr. Bilbray, no. Mr. Bass. Mr. Bass, no. Mr. Gingrey. Mr. Gingrey, no. Mr. Scalise. Mr. Scalise, no. Mr. Latta. Mr. Latta, no. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers, no. Mr. Harper. Mr. Harper, no. Mr. Lance. Mr. Lance, no. Mr. Cassidy. Mr. Cassidy, no. Mr. Guthrie. Mr. Guthrie, no. Mr. Olson. Mr. Olson, no. Mr. McKinley. Mr. McKinley, no. Mr. Gardner. Mr. Gardner, no. Mr. Pompeo. Mr. Pompeo, no. Mr. Kinzinger. Mr. Kinzinger, no. Mr. Griffith. Mr. Griffith, no. Mr. Waxman. Mr. Dingle. Mr. Dingle, aye. Mr. Murky. Mr. Murky, aye. Mr. Towns. Mr. Towns, aye. Mr. Pallone. Mr. Pallone, aye. Mr. Rush. Ms. Eshoo. Ms. Eshoo, aye. Mr. Engel. Mr. Green. Ms. DeGette. Ms. DeGette, aye. Mrs. Capps. Mrs. Capps, aye. Mr. Doyle. Mr. Doyle, aye. Ms. Schakowsky. Mr. Gonzalez. Mr. Inslee. Mr. Inslee, aye. Ms. Baldwin. Ms. Baldwin, aye. Mr. Ross. Mr. Ross, aye. Mr. Weiner. Mr. Weiner, aye. Mr. Matheson. Mr. Matheson, aye. Mr. Butterfield. Mr. Butterfield, aye. Mr. Barrow. Mr. Barrow, aye. Ms. Matsui. Ms. Matsui, aye. Ms. Christensen. Ms. Christensen, aye. Mr. Upton.
Oh.
Mr. Upton.
Are there other members wishing to vote? Mr. Stearns?
Mr. Stearns, no.
Mr. Whitfield?
Mr. Whitfield, no.
Mr. Walden?
Mr. Walden, no.
Mr. Weiner, are there other members wishing to cast a vote who didn't get recorded?
Is he here?
If
Mr. Chairman, I'm not sure how Mr. Sullivan's recorded.
Mr. Sullivan?
Mr. Sullivan, no.
Are there other members? If not, the clerk will report the tally.
Mr. Chairman, on that, there were 17 ayes, 31 nays.
17 ayes, 31 nays. The amendment is not agreed to. Are there other amendments to the bill? The chair would recognize the gentlelady from Wisconsin.
Thank you, Mr. Chairman. I have an amendment at the desk, 27.
27?
27. The amendment will be considered as read, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. You're well aware that I would like our committee to be focused on job creation and bolstering our struggling economy, when instead we're considering bills today that lead to job loss and, in effect, hinder our economic recovery. Today we are considering a Republican proposal that would repeal funding for grants to states to establish health insurance exchanges, funding that will create jobs and provide families and small businesses with access to affordable, quality health care options. Health insurance exchanges are critical for ensuring that thousands of small businesses and 24 million Americans have access to new health insurance coverage options. These exchanges will serve as an open marketplace where consumers can comparison shop among various private health insurance plans. For the first time, individuals will be able to compare health insurance plans, including information about benefits, prices, quality, and physician and hospital networks, and they'll be able to select an option that best suits their individual and family's health care needs. Furthermore, exchanges will increase competition among private insurance plans, ultimately lowering health insurance costs for families and small businesses. The grants to states, which this bill seeks to repeal and rescind, provide states with the flexibility to create an exchange that best meets their state's needs. 48 states, including Wisconsin, have already received up to $1 million each to get the exchanges up and running, including hiring key staff for implementation. In other words, this funding is creating jobs as we speak. Additionally, 7 states, including the state of Wisconsin, have been awarded early innovator grants, funding that will allow these states to lead the way in creating innovative information technology approaches for the exchange system. The $38 million grant that Wisconsin has received will spur job creation and improve access to quality, low-cost health insurance coverage. This Republican bill raises an important question. Are we going to ask cash-strapped states to return the money they've already been awarded? Will Wisconsin have to return its early innovator grant that Governor Walker has already accepted? Are we going to prevent these cash-strapped states from receiving further funding that will result in job creation? I fail to see how rescinding money that will create jobs is the right thing to do at this point with our struggling economy to help get it back on track. My amendment is simple. It states that this bill cannot take effect until the national unemployment rate is less than 4%. And that's not an unrealistic goal. Our national unemployment rate was below 4% when President George Bush got elected in November 2000, after 8 years of fiscal responsibility under President Clinton. Mr. Chairman, the American people expect us to be focusing on initiatives to create jobs and reduce unemployment, not bills that will lead to further job loss. I urge my colleagues to stand up for the American people looking for jobs and do so by supporting this amendment. I yield back the balance of my time.
Gentlelady yields back. Are there other members wishing to speak for or against the amendment? The chair would recognize the gentleman from Illinois, Mr. Shimkus, for 5 minutes.
Thank you, Mr. Chairman. My colleagues on the other side are going to be on a slippery slope on this jobs issue, because the reason why we became the majority is because of Obamacare and the fear that it would cost jobs. So we are taking the actions that were asked by the folks who sent us here to start bringing more certainty to the business community by repealing portions of the health care law. 200,000 jobs were created last month. The unemployment rate is down to 8.8%. Democrats have, and the administration has extolled that virtue. The president has said positive things about this. I would submit that part of that is because the business community now knows that they do not have to fear additional rules and regulations being thrust upon them because there's a Republican majority in the House, and that we will now move to unravel this big government, high taxation regime that's been passed upon. So, we all hope that we get to 4% unemployment. I think economists and most people who observe this is that if you're at 5% unemployment, you are in essence at full employment. 5% unemployment in this country is really full employment, as everyone who wants to find a job can find a job at that rate. So 4% is really unrealistic in the national unemployment standards. But having said that, when we hear about $1 million grants to states, $420,000 of that is borrowed. Let me say that again. When $1 million grant is given to a state, we borrow $420,000. And about $200,000 of that is borrowed from China, or the UK, or Japan. So of that $1 million grant to a state, $200,000 is borrowed from foreign countries. And that's what this debate's about. A $14.5 trillion national debt that we now have to say no. Now, in the Obamacare bill, we gave mandatory spending to the Secretary of Health and Human Services without regards to regular annual appropriations from the national government and through the chief appropriators, which is the House of Representatives. So we have decided, or we decided in the last Congress, passed into law, that we would not be involved. And if you remember in the last fall, before the election, we brought through this committee like about 7 to 8 to 9 bills moved by the health subcommittee to say, we want to give the secretary more direction because, yeah, we know she's got this slush fund, but we want to make sure that she funds these areas. The ranking member of the subcommittee knows this because he presided over that markup, where we said, yeah, she's got this slush fund. Our position was, why do we have to move these bills? She has a slush fund to do this. So again, when we give a state $1 million grant, we borrow $420,000 to do that. less than half of that is money that that China, Japan, the UK is lending to us. $14.5 trillion national debt. We can no longer afford to go on this. We have to make changes. Please, this amendment moves to take this debate off the table. I'd ask that you reject it, and I yield back the balance of my time.
Gentleman yields back. The other gentleman, or the chair would recognize the gentleman from New Jersey for 5 minutes.
Thank you, Mr. Chairman. You know, I listened to my colleague from Illinois, and I heard the same argument on the floor the other day when the unemployment numbers came out, and they showed that they had gone down to from 8.9 to 8.8 nationally, and there were over 200 private sector jobs. Mr. Dreyer came to the floor. It was during the debate on H.R. 1 and started to say that it was all because of Republican policies. And I was like, okay, so you've been in office since January. You've had 3 short-term continuing resolutions. You can't even agree on, how to deal with the spending bill at all, and you're going to now take credit for decreased unemployment and these private sector jobs. I mean, it's a fiction. We did a Recovery Act with major tax breaks for the middle class and with funding for infrastructure and education and teachers and police. We did, I don't know, at least a dozen tax breaks for small businesses, including the HIRE Act, to encourage businesses to hire more employees and not have to pay the payroll tax. And during the lame duck, we did a major bill that provided extended unemployment, major tax breaks that would continue for 4 years, or at least for, I'll just take credit for the last 2 if you want, with a Democratic president, Democratic Congress. We inherited this awful recession, and for the last 2 years, with an all-Democratic Congress and president, we had, I can't imagine how many initiatives. I could spend the next day here talking about all the initiatives, Recovery Act, tax breaks, on and on, money back to the states to pay for teachers and police. And all this is coming to fruition now. We're starting to see unemployment go down, private sector jobs come back, manufacturing come back in a major way. And then I hear Mr. Dreyer, now my colleague from Illinois, say, oh, yeah, that's because we've been here since February, and all of a sudden everybody thinks everything's wonderful, and we're going to take credit for it.
Gentleman yield?
Yeah, I certainly will.
I want to join you in expressing concern about the argument that has been made. Our colleague, Mr. Shimkus, said that we're going to have to borrow to pay the money to the states to set up these exchanges. And let me point out a fact. We're going to have to borrow, and in fact we are borrowing $147 billion to extend the Bush tax cuts to the wealthiest. So to borrow some money, or to otherwise spend money, a relatively small amount, to help the state set up a proper exchange for people to be able to compare insurance policies, to use market forces to hold the insurance companies responsible for their claims, seems to me a very good investment in holding down health care costs. And if we're going to talk about the money we have to borrow for this small area, let's put it in perspective for the $147 billion for the Bush tax cuts just to the wealthiest. Yield back to you.
In any case, I don't look. I'm more than willing, if Mr. Shimkus wants to take credit for recovery, I'll take credit. The main thing is that we are in the middle of a recovery. I'd like to see it continue, though, and expand. I'm very fearful that the Republican policies with the CR and the budget, and we know that all the economists say that these policies are really going to kill jobs. CR, most analysts say anywhere from 500 to 700,000 jobs will be lost with the CR. So let's continue with policies, progressive policies that are actually going to create jobs, not move along with these Republican policies and the CR and the new budget that comes out today, which most analysts are going to say are going to just kill jobs and really threaten the recovery. But back to the issue at hand with the 40 seconds I have left. The main thing here is these states are going to have to establish these exchanges regardless. Give them the money so they have the flexibility. They can, You know, some of it's going to be job creation. Some of it's going to ultimately save money because the exchanges will result in lower premiums and better insurance. And certainly don't let the federal government step in and run the state exchange, which is also going to cost money. It may cost even more money. I don't have the data here, but I wouldn't be surprised if the states didn't get these grants and the federal government took over the exchanges. It might even cost more money for all we know. So this just doesn't make any sense. If you want flexibility, you should keep with the current law. But I do support the gentlewoman's amendment because she points out how this should be linked to the employment rate. It is significant in that regard.
Gentleman's time has expired. Are there other members wishing to speak in support or against the amendment? The gentleman from Texas is recognized, Mr. Olson.
I thank the chair. And I speak in strong opposition to this amendment because it defies logic in that it allows one of the key provisions of the job-destroying Obamacare to continue until a state's unemployment rate goes below 4%. There's no way unemployment will go below 4% if we allow the job-destroying Obamacare to continue. How does Obamacare destroy jobs? Well, it could take all day to describe because Obamacare contains so many onerous policies, but we know that the employer mandate and over $800 billion in new taxes will destroy hundreds of thousands of American jobs. But don't take my word. The Congressional Budget Office thinks Obamacare will cost jobs. According to the CBO director, the law will cost 800,000 Americans their jobs, and most believe that the director underestimated that amount. According to a study by the National Federation of Independent Businesses, an employer mandate like the one included in Obamacare could eliminate additional 1.6 million jobs by 2014. 66% of those job losses could come from small businesses. Instead of playing games, I ask my Democrat colleagues to vote against this amendment and vote with us to repeal this job-destroying provision of Obamacare. I yield back my time.
Gentleman yields back. Are there other members wishing to speak on the amendment? Chair recognizes the gentleman from the great state of Michigan for 5 minutes.
Mr. Chairman, I thank you for your courtesy. I want to express my strong support for the amendment to establish the funding for state-based exchange grants. And I think that it is something that we have to do. It says that this will not take effect until unemployment falls. This is good. But I remind my colleagues that this business of the state exchange grants is a good Republican idea. It came from my good friend Bob Dole, who some of my Republican colleagues might still remember. And what it does is it allows the states, and the grants that we're going to make the states, allow the states to first of all begin to craft the plans that best equal their concerns with regard to health care, and to see to it that they can do so in a way which will perhaps ultimately save money, will make this country cease being essentially a third world nation with regard to the health care we're providing for our people. We have the best medicine in the world, but we can't get it to our people. And so the ACA was an attempt for us to finally get away from that appalling situation so that we no longer are going to rank with the third world nations on infant mortality, so that we could get the life expectancy of our people up to that which goes in some of the other advanced nations in the world, so that we can do some intelligent things about reducing the excessive costs of health care and the excessive rate of growth in the health care in the United States, which is going up about twice as fast as it is in any other nation in the world. All the states are receiving grants if they wish them and if they wish to go forward. These grants are going to help them in a difficult time to begin to move forward with regard to providing the state exchanges which will enable them to provide the precise kind of care that they think ought to be given to the people of their respective states. This is an excellent, sensible proposal, And it's something which is going to make it possible for us to see to it that the nation gets the health care it needs and does so in a way that helps us to finally control the costs, see to it that the benefits of good health care are available to our people. And I would remind my friends on the other side that health care is not a matter of privilege. It's a matter of right. If you don't have it, you're going to die. And I don't think that that comports with our idea of what this nation should be with regard to how we treat our people and how we deal with not only the humanitarian concerns, but very frankly, the economic curse that our runaway health care costs are creating for the people of the United States and for the different government programs which try over the years to address these concerns of our people. I would urge my friends to adopt the amendment. I would urge my friends on the committee on both sides to reject this bill, which is nothing more or less than a manifestation of mischief which was promised this Congress by my Republican friends who said they're going to do everything they can to do away with the health care bill of the last Congress, and that they're going to do everything to see that they can, that there is no money, and that there are no personnel to administer the statute. Let's give this statute a chance to work for the benefit of the people. Let's see to it that the decisions made by last Congress are not wrangled over on a continuing basis by those of us here who are less concerned with the benefit of the people than in dealing with some kind of political rigmarole that stems from the last session of this Congress. I urge my colleagues to support the amendment. I urge them to reject this and the other bill, the other bills that we have this morning, which are mischievous in the extreme. And then let's get on to the business of restoring the economy of the nation, getting our people back to work, dealing with jobs, and taking responsible steps to balance the budget and to eliminate the huge expenses that we are finding imposed on us by the deficit, which in good part was left us by our Republican friends and by their Republican presidents who created this wonderful mess with 2 wars, phone, and a credit card. So I yield back the balance of my time.
Gentleman's time is expired. I think we're ready to vote on this amendment. Are there other members wishing to speak?
Mr. Chair, if I may be so bold as to move to strike the requisite number
Gentleman
of
is recognized for 5 minutes.
repetitive verbiage and yield to Ms. Baldwin.
Thank you, Mr. Chairman. I just wanted to correct the record on the Affordable Care Act and its impact so far on job creation as well as the projected impact in the future. In sharp contrast to during the Bush administration where 673,000 private sector jobs were lost, the economy in the U.S. has created 1.4 million private sector jobs in the past year, that past year being since the passage of the Affordable Care Act. Of the 1.4 million private sector jobs, 243,000 of them were in the healthcare field, in the healthcare industry. A study by Harvard University and the Commonwealth Fund estimates that the Affordable Care Act will strengthen the economy and the job market by creating between 250,000 to 400,000 jobs per year for the next decade. The increase is due to cost-saving provisions, especially for small businesses, which will allow for the money to be spent on job creation and hiring instead of rising health care costs. In addition, provisions in the bill address the severe shortages of primary care physicians, physician assistants, and nurses, and in 2010, funds were allocated to train more than 16,000 new primary care providers. That's the jobs impact of the Affordable Care Act. I yield back.
Gentleman, does he yield back?
Yeah, I yield back.
Are there other members wishing to speak? Seeing none, I think we're ready to vote on the amendment. Are we going to ask for a recorded vote? Yes. Clerk will read the... All those in favor will respond by saying aye. Those opposed say nay. The clerk will read the names.
Mr. Barton. Mr. Barton, no. Mr. Stearns. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus, no. Mr. Pitts. Mrs. Bono-Mack. Mrs. Bono-Mack, no. Mr. Walden. Mr. Walden, no. Mr. Terry. Mr. Terry, no. Mr. Rogers. Mr. Rogers, no. Mrs. Myrick. Mrs. Myrick, no. Mr. Sullivan. Mr. Sullivan, no. Mr. Murphy. Mr. Murphy, no. Mr. Burgess. Mr. Burgess, no. Mrs. Blackburn. Mr. Bilbray. Mr. Bilbray, no. Mr. Bass. Mr. Bass, no. Mr. Gingrey. Mr. Gingrey, no. Mr. Scalise. Mr. Scalise, no. Mr. Latta. Mr. Latta, no. Mrs. McMorris Rogers. Mrs. McMorris Rogers, no. Mr. Harper. Mr. Harper, no. Mr. Lance. Mr. Lance, no. Mr. Cassidy. Mr. Cassidy, no. Mr. Guthrie. Mr. Guthrie, no. Mr. Olson. Mr. Olson, no. Mr. McKinley. Mr. McKinley, no. Mr. Gardner. Mr. Gardner, no. Mr. Pompeo. Mr. Pompeo, no. Mr. Kinzinger. Mr. Kinzinger, no. Mr. Griffith. Mr. Griffith, no. Mr. Waxman. Mr. Waxman, aye. Mr. Dingle. Mr. Dingle, aye. Mr. Markey. Mr. Towns. Mr. Towns, aye. Mr. Pallone. Mr. Pallone, aye. Mr. Rush. Mr. Rush, aye. Ms. Eshu. Ms. Eshu, aye. Mr. Engel. Mr. Green. Ms. DeGette. Ms. DeGette, aye. Mrs. Capps. Mrs. Capps, aye. Mr. Doyle. Mr. Doyle, aye. Ms. Schakowsky. Mr. Gonzalez. Mr. Inslee. Mr. Inslee, aye. Ms. Baldwin. Ms. Baldwin, aye. Mr. Ross. Mr. Ross, aye. Mr. Weiner. Mr. Weiner, aye. Mr. Matheson. Mr. Matheson, aye. Mr. Butterfield. Mr. Butterfield, aye. Mr. Barrow. Mr. Barrow, aye. Ms. Matsui. Ms. Matsui, aye. Ms. Christensen. Ms. Christensen, aye. Mr. Upton.
Votes no.
Mr. Upton.
Other members wishing to
No.
vote, Mr. Stearns.
Mr. Stearns, no.
Mr. Pitts.
Mr. Pitts.
Mr. Whitfield.
No. Mr. Whitfield, no.
Are there other members wishing to cast a vote? If not, the clerk will report the tally. Mr. Sullivan, are you voted? Yes. Yes. Clerk will report the tally.
Mr. Chairman, on that, there were 18 ayes, 30 nays.
18 ayes, 30 nays. The amendment is not agreed to. The chair understands there are two amendments left that are likely to be offered to this bill, and we will dispense with those two amendments, vote on final, and stop for lunch, if we can. No. Well, I mean, finish the debate on the amendment. We'll work on what member wishes to offer an amendment to the bill? Gentlelady from California, Ms. Capps.
Mr. Chairman, I have an amendment at the desk.
Clerk will report the title.
An amendment offered by Mrs. Capps.
The amendment will be considered as read, and the gentlelady is recognized for 5 minutes in support of her amendment.
Mr. Chairman, H.R. 1213 is a misguided bill that would harm already cash-strapped states and take away a state's ability to provide access to health insurance for their citizens. The Health Exchange Implementation Program exists to assist states in planning and establishing health benefit exchanges which are tailored to their state-specific needs. In fact, it's the exact type of program that gives states the flexibility they need to design a program that suits their citizens, exactly what some of my colleagues on the other side of the aisle have been calling for. These exchanges will make it easier for consumers and small businesses to better shop for health insurance coverage based on price, benefits, and services, and quality. They will provide the key structure to ensuring that the numerous consumer protection provisions in the law are enacted for state residents, and they will make health insurance market both more competitive and more transparent. And this would all be accomplished through a state-specific plan that takes into account the unique needs of our constituents. I think we can all agree that no one health exchange is going to fit the needs of every state. I acknowledge that the needs of a small state might be quite different from the needs of my home state of California. And that is why the exchange program funds enables states to create their unique approach. But this bill would change all that. The exchanges would still need to be created, and yet there would be no funding or help to make that a reality. Or they could just accept the plan that the federal government provides them. A vote for this bill is a vote against the fiscal and physical health of our states. And it is wasteful, as each of our states have already received at least $1 million to begin this process, something that will stop in its tracks if the program is repealed. In fact, it also might be rescinded. But it also threatens the important consumer protections that the law puts in place to ensure that each of us receives a plan that takes care of us when we are sick at a fair price. And that includes a prohibition on gender rating, or charging women more for a plan just because of her gender. That was something that was severely lacking before the Affordable Care Act passed. The data collected, marketplace comparisons provided, and competition that will be found in these new exchanges will be critical to ensuring that women receive a fair price for a fair plan. We all know that the reason this bill is here being considered is that my colleagues on the other side of the aisle know that exchanges are the central piece of making the Affordable Care Act work for all Americans. Their function is key to promote fair, transparent marketplace that is accessible for everyone. To ensure that these protections for women are not harmed by removing these funds, my amendment would simply ensure that the money that H.R. 1213 would repeal to fund the development of these important marketplaces remains intact to enforce the provisions that end the discriminatory practice of gender rating. Before the Affordable Care Act was passed, American women who purchased health insurance through the individual market paid up to 84% more than men did for their individual plans. This wasn't for added benefits. This was for plans that did not even include maternity care. Moreover, 95% of plans in states that did not specifically bar gender rating used the practice to indiscriminately charge women more for the same care. This is clearly unjust, and we cannot allow the politics of repealing any little piece of the Affordable Care Act getting in the way of ensuring American women will be treated fairly in the individual health insurance market. Vote yes on this amendment and show American women that you are on their side, not on the insurance company's side. And I'm prepared to yield back the balance of my time.
Gentlelady yields back. Chair would recognize the gentlelady from Washington State, Ms. McMorris Rogers, for 5 minutes.
Thank you, Mr. Chairman, and I am in opposition to this amendment. In reality, it is simply another attempt to protect the unlimited pot of money for the Secretary of Health and Human Services in the underlying bill. There's already a preclusion on gender discrimination in the underlying legislation. In reality, it's the federal government, through the Secretary of Health and Human Services, that will control what kind of essential benefits must be included and impose price controls on health coverage. States will be a servant, not a partner. And far from flexibility, it's the Secretary of Health and Human Services that is determining how you certify, whether plans have networks, provider rates, transparency. It's the Secretary of Health and Human Services determining how much it will cost, how much they will spend. Mr. Chairman, at the end of the day, this amendment is simply another attempt to access an unlimited pot of money, giving any executive branch official a blank check is a bad idea during a Democrat administration or a Republican administration, and I urge opposition to the amendment.
Gentlelady's time has expired. Chair would recognize the ranking member of the committee, Mr. Waxman, for 5 minutes.
Thank you very much, Mr. Chairman. I listened carefully to what our colleague, Ms. McMorris Rogers, had to say, and she sees this as a way to set up the exchanges for the health care bill with a lot of the features that many Republican members find disagreeable. But I know that there's an attempt to repeal that bill. And if you repealed the health care bill and you replaced it, one of the things it seems to me you would want to have is money planning grants for the states to set up exchanges. You don't need the whole health care bill for the exchanges. Exchanges are a very good idea. Utah already has one. Massachusetts has one, of course, in the context of their health care reform. The reason an exchange is a good idea is it becomes a way for consumers to make choices between competing insurance plans. That competition between plans for the consumer's choice serves a very important purpose. If there were a standardized benefit, for example, you could compare one plan to the other. on price and on quality. But even if it weren't standardized, you at least have a place where you can compare them. We have our exchange every year when federal employees make a choice, and then we decide which of the options that are available to us do we want to sign up during the open enrollment period. So my argument is this bill eliminates the money for the exchanges to be planned by the states. I would suggest this is not an appropriate bill by itself, but we're of course having it by itself. I think we ought to have it no matter what you want to do in health care reform, if you can find the votes to do it, to stop the states from having the grants to set up exchanges. Now, as to this particular amendment by Ms. Capps, this amendment says that when the states get this money, they should at least certify that insurance plans that are offered in the exchange not discriminate in premiums based on gender. Well, I'd hope that's something Republicans would want to do as well. I heard Mr. Harper a few minutes ago say that he felt that we ought to stop discrimination against people with pre-existing conditions from getting health insurance. If you all agree to that, we ought to see that in your bill to replace the health insurance bill that is now law. But I haven't seen any proposal because it's so tricky. If you say that you're not going to discriminate based on pre-existing conditions, then insurance companies don't know if they're going to be able to spread the costs from those who have pre-existing conditions, which will cost them more money, to a broader group, which of course led us to the mandate. The Republican approach, by the way, in the last couple of years was to set up a high-risk pool. But ironically enough, we now have attempts by the Republicans to eliminate the high-risk pool. No, I don't know if that we have attempts to eliminate it. We had a hearing on it, and the high-risk pool was criticized because not enough people were taking it up. Of course, that's a problem with high-risk pools. High-risk pools still mean that the person with pre-existing conditions have to spend more money. But this particular amendment is an amendment that would ensure that whatever our disagreements on health reform, we pursue policies that do not allow health insurance companies to discriminate against women. This is a civil rights issue, it's not an ideological one, so I hope that we can all get behind this amendment. Health insurance exchanges are required to certify that health plans meet the protections laid out in the Affordable Care Act. Even if you eliminate the Affordable Care Act, we should still want exchanges to certify that they're not allowing discrimination against women. Right now, insurers charge up to 48% more to women in the individual insurance market. 79% of women with an individual market policy do not have any maternity coverage because insurers don't want to pay for deliveries of babies. The Affordable Care Act would put an end to that. But without these exchanges and the establishment grants to the states to set them up, we won't have the opportunity for the states to decide that if we went your direction to prohibit this kind of discrimination. So what this amendment says is if states get money to set up exchanges, don't allow discrimination against women. I urge support for this amendment. I urge opposition to strike the funds for the state, which is the purpose of the bill, and I yield back my time.
Other members wishing to speak? Gentleman from Texas is recognized for 5 minutes.
I know, Mr. Chairman, that we're about to finish this bill and break for lunch, so I won't take too long. There's a movie called Cool Hand Luke, and the protagonist, or the hero, however you want to define him in the movie, is Paul Newman, who portrays this man who kind of goes his own way, and he doesn't really care about the rules. He just does whatever he wants to do, and he ends up in prison, and of course there he becomes a folk hero in the prison because he doesn't listen to the warden or doesn't abide with any of the rules in the prison. And there's a famous scene in this movie where Luke has done something he shouldn't have done, or at least it was against the rules, and the warden is standing up on the levee and Luke is down manacled, and the warden says, what we have here is a failure to communicate. It's a classic line. Well, that's what we've got right now in this committee, is a failure to communicate. The majority has decided that the the new health care law has got too many mandates, spends too much money, takes away too much freedom of choice, it's non-transparent, and we're doing everything we can to repeal it, and once we get it repealed, we want to replace it. And our friends on the minority side seem bound and determined to do everything they can to defend every last bit of it, no matter what. This bill that is before us right now, the main point is that it gives the Secretary of Health and Human Services an unlimited ability to spend money with no oversight and no checks and balances. And we oppose that. We want to repeal that unlimited authority. We're not necessarily opposed to state health exchanges, but we do think if you're going to have an exchange, it should be open, transparent, and probably voluntary, or use something like a co-op. So our friends on the minority side keep acting like that we don't think these state-based health exchanges are a good idea. I happen to think that they are a good idea, but I also happen to think that giving the Secretary of Health and Human Services a blank check is wrong. And so we've gone through 3 or 4 amendments now. You know, this one is on gender-based rating. We've had all the others. It's the same basic amendment.
Would the distinguished
Sure.
Chairman Emeritus yield?
Sure. I was about out of gas anyway.
I appreciate I appreciate the Chairman Emeritus for yielding, because this movie, Cool Hand Luke, is also one of my favorites. My grandson, who is 1.5 years old, is named Luke, and I call him Cool Hand. He is a cool hand. But also in that movie,
hopefully he's not in prison.
Cool Hand Luke, as you remember, my colleagues,
not in prison,
tried to eat those 50 eggs, you know, and he finally got that 50th egg down, and it just about killed him. And what we're looking at here is not only a failure to communicate, but also trying to eat too darn many eggs. And this federal government has already done that, and is choking on them, and it's time to stop. So
speaking of food, it's time for lunch.
It's a bridge too far or an egg too many. And I
also,
yield back to my
colleague. I'm going to yield back. I just oppose this amendment and would hope that once we get the bill passed, and maybe we can later in this Congress actually work together on some of these ideas. I hope we can.
Gentleman yields back. The chair would recognize the gentleman from New York, Mr. Weiner.
Thank you, Mr. Chairman. I got a movie. I got a movie. I got to fail you to communicate. I think you're going to like this. You guys have heard the language from the Lewis Carroll play Alice in Wonderland, Jabberwocky, where it's just a completely meaningless series of words all strung together that don't mean much of anything. Yeah, we do have a failure to communicate because, frankly, it's such a moving target. You say you don't want there to be central executive branch making decisions on minimum standards in products, so who do you imagine does that? I guess the insurance company is going to do that. That's the distinction that we have here. We actually do have a fairly clear dividing line. On that side of the hall here, we have people who believe that if you let the insurance companies make up the standards, they'll just, in their sense of beneficence and just their utter wisdom and their great sense of goodness, will make standards that don't harm anybody. Okay, maybe you're right. Well, ask your state insurance commissioners whether they believe that's the case. They will tell you that obviously you need to have some common standards or else consumers get ripped off and discriminated against. Now, you can come to this place with this notion that, all right, if you don't have regulations, that the great fairies of the insurance industry will come in here and choose to do the right thing. They won't. One of our basic obligations as being people who kind of set the rules of the road here is that there need to be rules of the road. So the question becomes, do you believe in Ms. Capps' philosophy that you need to have some regulatory organ that does that, or Ms. McMorris's idea that you let the insurance companies do it? What we're doing here is empowering the states. As Mr. Waxman said, you know, when you set up these exchanges, it's a way to empower states and even further to empower consumers to have standards that they can look at down the row and realize they're all basically the same. You know, we do it for our insurance. For ours, we do it. Why don't we do it for citizens? We have basic standards in the Federal Employees Health Benefits Program. Are you aware of that, gentlemen? Who do you think does it? Is it Aetna's CEO? No. Is it Oxford's CEO? No. Is it Blue Cross? No. We do it because it's good enough for us, and we don't want our families to sign up for health insurance plans that are deficient or discriminate. But it ain't good enough for our constituents, huh? It's not good enough for them. Why? Why not make it so we have an orderly marketplace that people can compare prices and think, because it's good enough for us and the 9 million employees and their families and the federal government and FEHB, but it ain't good enough for the rest of the American people.
Gentlemen, yield.
I certainly will.
I thank you for yielding. I think we ought to remind our Republicans, if they vote for the budget that's being proposed to change Medicare into a voucher system, they should want states to have exchanges, because these people otherwise are going to be facing the same problems that others have, going to an individual exchange, individual insurance to see what is going to replace their Medicare. So
well, if
you ought to be for it.
If I can reclaim, look, we have to try to figure it out, Mr. Waxman. They don't believe that the federal government should have the authority to do it, so we empower the states to do it. They don't believe the states should have the power to do it because they're about to vote no on the CAPS amendment. So who is it they believe to do it? Well, let's leave consumers on their own, because you know how powerful consumers are as individuals dealing with an insurance company. We all know how powerful we are when we have to dial that 800 number, just how much economic might we have. I mean, the fact of the matter is these guys don't believe in the 10th Amendment, Mr. Waxman. We're trying to empower states to do this, and they're saying, no. Because at the end of the day, my Republican friends, they keep coming, whether they do it mindfully or not, are advocating for the primacy of health insurance companies, as if somehow they're some entity that needs to be defended in this debate, that, oh, no, we can't make insurance companies do stuff. And let me make one final point to my final 50 seconds. Our colleagues have argued 1,000 times, let's let consumers buy health care over state lines, okay? That's a reasonable thing to do, but if you don't have anyone setting the standards, what you're really doing is letting Tennessee or Mississippi or Montana or New York set the standards for everyone else, right? Because what's the point of having standards in your state if your consumers can then go buy products in someone else's state with a dramatically lower standard? You need to have an orderly marketplace. But if you worship every day at the altar of health insurance companies, you definitely don't want to vote for the CAPS amendment. Definitely not. If you get up every day, you brush your teeth, you comb your hair, you put on a nice suit, and then dive in at the altar of insurance companies, yes, you want to vote no for the CAPS amendment. Everyone else should vote yes.
Are there other members wishing to speak on the amendment? I'm told we're going to have a recorded vote on this, so we are going to delay this vote until we're going to have a recorded vote on this amendment, and we're going to delay that recorded vote until the completion of the next amendment, if that's okay. So are there other members wishing to offer an amendment? The chair would recognize the gentlelady from California. Clerk will report the title of the amendment.
15.
15, yes.
The amendment will be considered as read, and the gentlelady is recognized for 5 minutes. This is expected to be the last amendment on this bill, so we'll finish this amendment, have a recorded vote on Ms. Capp's amendment, and then a recorded vote on the final of the bill, and we'll adjourn for lunch.
Okay.
Gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. I promise not to talk about eggs or anything like that. H.R. 1213 will repeal all federal funding to assist the states with establishing health benefit exchanges. Repealing this funding would not only work to undo the progress that my home state of California has made in establishing its own exchange, but would put the whole exchange concept into question. These exchanges will help provide consumers with the freedom to better choose what health insurance plan suits their needs. They can help bring down costs for small businesses if the state chooses to institute a small business exchange. They can also increase competition in the marketplace through the establishment of regional exchanges should states decide to band together and sell insurance across their borders. The exchanges will also host a number of insurance market reforms that will provide the consumer with a better, more affordable product. My amendment goes to the heart of that. Simply stated, it would not allow this bill to be enacted until all Americans have free preventive care, as will be the case when the health benefit exchanges go online in 2014. This benefit was included in the Affordable Care Act for a reason. One of the primary barriers to Americans seeing a primary care provider on a regular basis is cost. For the average American, it costs too much money to go to the doctor for annual physicals and wellness exams. This in turn causes people to go to the doctor only after they get sick, as opposed to seeing a physician in order to stay healthy. By waiting until you're already sick, one's road to recovery is that much more difficult, that much more time-consuming, and that much more expensive. The Affordable Care Act eliminates the cost factor for those purchasing insurance on the exchange. Therefore, consumers are given a very good market incentive to see their doctor on a regular basis. And studies show that when someone is able to see a doctor on a regular basis, they lead healthier lives and can catch potentially long-term and debilitating diseases earlier, therefore reducing hospital stays and a need for costly medical procedures and medicines. The legislation before us would strip that benefit away from the American people. By stripping the funding to states for the exchanges, this bill would only help to reestablish barriers to those seeking preventive care, help increase America's out-of-pocket expenses, and help make people sicker. This would mean that nearly 550,000 Sacramento residents would see higher out-of-pocket expenses, 550,000 Sacramentans sicker, 550,000 Sacramentans with potentially higher medical debt due to unchecked long-term diseases. Ultimately, what all this does is to help bend the cost curve upward, which I think is the opposite of what all of us on this committee want to do. I urge my colleagues to vote for my amendment, which again only seeks to assure consumers that their benefits are protected.
Will the gentlelady yield?
I yield, certainly.
Thank you. I got to introduce Paul Newman once. He was at a Al Gore for President rally, and the guy should be a hero. I know he is to many Americans. He established these camps for these kids who have real severe physical problems around the country, and one of them is in our state. He just did some remarkable thing, and I can't speak for him, obviously, but I don't think he'd be wild about efforts to repeal the ability for kids to get health care in our country. So I just want to quote another line from Cool Hand Luke. Two lines, one from the boss and one from Luke that he played. Here's what the boss says, and it reminds me sort of what the Republican approach is to health care. Here's the boss. Sorry, Luke, I'm just doing my job. You got to appreciate that. Luke responds, nah, calling it your job, just don't make it right, boss. What you guys are doing is not right, trying to take health care from these kids that Paul Newman has helped. And this is a real-world ramification of what you're doing. Maybe your job, but it's not right. Thanks.
Mr. Chairman, I yield back.
Gentlelady yields back. I'm going to recognize myself for 5 minutes. I oppose the amendment because if the amendment passes and the bill, it will continue to give unlimited money to spend on questionable activities. Now, I'd just like to say that in the last couple of weeks, I've had a chance to talk to a number of governors on both sides of the aisle. And I'll tell you, one of the things that I'm hearing from a number of them is the questions as to whether PPACA is going to be ruled constitutional or not. And until that decision is finally rendered, in my view, by the Supreme Court, because the loser, as we know, is going to appeal it until it reaches there, until that decision is finally rendered, and if it is, in fact, is ruled unconstitutional by the Supreme Court, the states are going to wonder why they are spending hundreds of millions of dollars collectively across the board for these, if in fact it may be for naught. And one of the ideas, frankly, that I've been considering, maybe would like to spend a little time working with some of my colleagues on the Democratic side, is whether or not we might want to suspend money again until we actually see a decision by the Supreme Court, which may mean that we might try to push them to actually consider arguments this summer and maybe see a decision sometime this fall. So maybe that's an issue that we can talk about and pursue legislation as relate. I would yield to the gentleman first from New York and then New Jersey. For
Just the gentleman is aware that the part that is at issue in the Supreme Court is only the narrow issue of the mandate, which in Massachusetts under Romney Care, less than 2/3 of 1% didn't take up.
Reclaiming my time, there's not the severability clause. Maybe that was a mistake in the Senate bill that they didn't include it. But again, we didn't have a chance to amend it. So here we are. So I would like to conclude debate if I can on this. Maybe yield, gentleman from New Jersey.
Yes, thank you, Mr. Chairman. On that issue, I agree with you completely, and I would hope the Supreme Court would take the case granting certiorari from the various district courts and not having to go through the circuit courts of appeals. I have a resolution to that effect with Congressman Forbes of Virginia, the Judiciary Committee. I believe a similar resolution has been introduced in the Senate by Senator Nelson, a Democrat, and I would urge you, sir, and distinguished members of the committee to look at that. I think that the Supreme Court should decide this issue as quickly as possible, and there is precedent for that. The Supreme Court took the case regarding the seizure of the steel mills by President Truman directly from the district court in 1952. This issue is as important as that, and I agree with Congressman Wiener that what is actionable is the individual mandate, but given the lack of severability, I think the Supreme Court might rule beyond that, and as a matter of finality, I would hope the Supreme Court would take the case immediately. Thank you very much.
I'll yield further to a gentleman from Pennsylvania, Dr. Murphy.
Thank you, Mr. Chairman. I believe all of us are pretty strongly in favor of anything that has to do with prevention. However, there's a number of issues involved with these prevention issues which we have not yet resolved, such as what is included in preventative care. There's primary, secondary, tertiary prevention. Does it include websites a medical practice or insurance company operate? Does it include a medical exam, history, physicals, inoculations? And how are those paid for? You can't offer something for free and not having that actual time accounted for or paid for in these elements. If a state has a plan that they are offering and they have to offer it for free, are they allowed to raise taxes to pay for it? We also notice a number of insurance plans have already raised their rates considerably. Now, I believe this committee should do some considerable work on prevention and everything from community health care centers to other actions. However, what we have not solved here is the problem of how you pay for something that's supposed to be free. These are very expensive, and they can save money, but I think we need to do some more work on this before this amendment comes through. Thank you, Mr. Chairman.
Okay, I'm going to yield back my time. I'd like to think that we might be able to vote on this amendment. There are further members seeking to comment. If not, all those in favor of the Matsui amendment will say aye. All those opposed say no. No. The noes have it. The noes have it. The amendment is not agreed to. It's my understanding. Are there further amendments? At this point, are there further amendments to the bill? Seeing none, the order of business will be to vote first on the CAPS amendment, and concluding that vote, we'll vote immediately on final passage. Both will be recorded votes. The clerk will report, and at that point, then we'll adjourn for lunch. The clerk will call the roll on the CAPS amendment. Those in favor say aye. Those in favor will respond by saying aye.
Mr. Barton. Mr. Stearns. Mr. Whitfield. Mr. Whitfield, no. Mr. Shimkus. Mr. Shimkus, no. Mr. Pitts. Mr. Pitts, no. Ms. Bono-Mack. Ms. Bono-Mack, no. Mr. Walden. Mr. Walden, no. Mr. Terry. Mr. Terry, no. Mr. Rogers. Mr. Rogers, no. Mrs. Myrick. Mrs. Myrick, no. Mr. Sullivan. Mr. Murphy. Mr. Murphy, no. Mr. Burgess. Mr. Burgess, no. Mrs. Blackburn. Mrs. Blackburn, no. Mr. Bilbray. Mr. Bilbray, no. Mr. Bass. Mr. Bass, no. Mr. Gingrey. Mr. Gingrey, no. Mr. Scalise. Mr. Scalise, no. Mr. Latta. Mr. Latta, no. Mrs. McMorris Rogers. Mrs. McMorris Rogers, no. Mr. Harper. Mr. Harper, no. Mr. Lance. Mr. Lance, no. Mr. Cassidy. Mr. Cassidy, no. Mr. Guthrie. Mr. Guthrie, no. Mr. Olson. Mr. Olson, no. Mr. McKinley. Mr. McKinley, no. Mr. Gardner. Mr. Gardner, no. Mr. Pompeo. Mr. Pompeo, no. Mr. Kinzinger. Mr. Kinzinger, no. Mr. Griffith. Mr. Griffith, no. Mr. Waxman. Mr. Waxman, aye. Mr. Dingle. Mr. Dingle, aye. Mr. Markey. Mr. Towns. Mr. Pallone. Mr. Pallone, aye. Mr. Rush. Mr. Rush, aye. Ms. Eshu. Ms. Eshu, aye. Mr. Engel. Mr. Green. Mr. Green, aye. Ms. DeGette. Ms. DeGette, aye. Mrs. Capps. Mrs. Capps, aye. Mr. Doyle. Mr. Doyle, aye. Ms. Schakowsky. Mr. Gonzalez. Mr. Gonzalez, aye. Mr. Inslee. Mr. Inslee, aye. Ms. Baldwin. Ms. Baldwin, aye. Mr. Ross. Mr. Ross, aye. Mr. Weiner. Mr. Weiner, aye. Mr. Matheson. Mr. Matheson, aye. Mr. Butterfield. Mr. Barrow. Mr. Barrow, aye. Ms. Matsui. Ms. Matsui, aye. Ms. Christensen. Ms. Christensen, aye. Mr. Upton.
Votes
Mr.
no.
Upton?
Other members, Mr. Stearns?
Mr. Stearns, no.
Mr. Sullivan?
Mr. Sullivan, no.
Are there other members present wishing to vote? If not, the clerk will report the tally. Oh, Mr. Barton. Mr. Barton votes no. Yeah, that's no. Yeah, but I need you to. Yeah.
Mr. Barton, no. Mr. Chairman, on that, there are 18 ayes, 31 nays.
18 ayes, 31 nays. The amendment is not agreed to. At this point, we are prepared to vote on final passage of the bill. We'll ask for a recorded vote, and we will resume at 1:15 when this vote is done. So
Mr. Chairman, before you go to the I'm assuming this you may win on this, and therefore, if you do, pursuant to House Rule 11, Clause 2.1, I request that all members have the requisite time to file supplemental, minority, or additional views to H.R. 1213.
Without objection.
Mr. Barton's done.
Clerk will report the clerk will call the names.
Mr. Barton. Mr. Barton, aye. Mr. Stearns. Mr. Stearns, aye. Mr. Whitfield. Mr. Whitfield, aye. Mr. Shimkus. Mr. Shimkus, aye. Mr. Pitts. Mr. Pitts, aye. Ms. Bono-Mack. Ms. Bono-Mack, aye. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mrs. Myrick, aye. Mr. Sullivan. Mr. Sullivan, aye. Mr. Murphy. Mr. Murphy, aye. Mr. Burgess. Mr. Burgess, aye. Ms. Blackburn. Ms. Blackburn, aye. Mr. Bilbray.
Aye.
Mr. Bilbray, aye. Mr. Bass. Mr. Bass, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Scalise. Mr. Scalise, aye. Mr. Latta. Mr. Latta, aye. Mrs. McMorris Rogers. Mrs. McMorris Rogers, aye. Mr. Harper. Mr. Harper, aye. Mr. Lance. Mr. Lance, aye. Mr. Cassidy. Mr. Cassidy, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Olson. Mr. Olson, aye. Mr. McKinley. Mr. McKinley, aye. Mr. Gardner. Mr. Gardner, aye. Mr. Pompeo. Mr. Pompeo, aye. Mr. Kinzinger. Mr. Kinzinger, aye. Mr. Griffith. Mr. Griffith, aye. Mr. Waxman. Mr. Waxman, no. Mr. Dingle. Mr. Dingle, no. Mr. Markey. Mr. Towns. Mr. Pallone. Mr. Pallone, no. Mr. Rush. Mr. Rush, no. Ms. Eshu. Ms. Eshu, no. Mr. Engel. Mr. Green. Mr. Green, no. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Mr. Doyle, no. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. Mr. Gonzalez, no. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Ross, no. Mr. Weiner. Mr. Weiner, no. Mr. Matheson. Mr. Matheson? No. Mr. Butterfield? Mr. Butterfield? No. Mr. Barrow? Mr. Barrow? No. Ms. Matsui? Ms. Matsui? No. Ms. Christensen? Ms. Christensen? No. Mr. Upton?
Votes aye. Other members wishing to vote? I think everybody's here. The clerk will report the tally.
Mr. Chairman, on that, there are 31 ayes, 20 nays.
I'm sorry, say that again.
31 ayes, 20 nays.
31 ayes, 20 nays. The bill is agreed to, and at this point we will recess until 1:15. At this point, we're prepared to call up H.R. 1214 and ask the clerk to report the title of the bill.
H.R. 1214 to repeal mandatory funding for school-based health center construction.
Without objection, the first reading of the bill is dispensed with. So ordered. Are there amendments to the bill? Ms. Capps, for what purpose does the gentlelady from California seek recognition?
I was going to strike the last word again, to speak against the bill in general. Is that possible?
Again, I will recognize the gentlelady for 5 minutes.
I appreciate that, Mr. Chairman. Here we are yet again. Today's markup is another effort by this committee to do everything it can to take away access to health care for thousands of Americans, including our children. As we learned during our subcommittee's work on the subject, many of my Republican colleagues agree that school-based health centers provide comprehensive and easily accessible preventive and primary health care services to millions of students nationwide, services that keep students healthy, in school, and learning, services that are often the only source of health care for these children and adolescents. And yet, my colleagues would rather cater to the Republican leadership's obsession with repealing health care than expand these vital services that they even support. My colleagues say they believe in school-based health centers, but that we can't afford to fund everything, and yet just last week they voted to spend millions of dollars on a failed D.C. private school voucher program over the objection of D.C.'s own elected officials, which is why I cannot understand why this program, which is supported by evidence in improving the lives of children who participate, is on the chopping block. To be clear, eliminating the funds that would allow communities across the nation to benefit from access to school-based health centers is taking away a guaranteed source of care from our children. In fact, as I mentioned before, interest and need in creating new school-based health centers is so great that this year alone, HHS has received 350 applications for this funding. These requests came from 46 different states, hundreds of congressional districts, including the districts of 17 of our Republican colleagues on this committee. That means that applicants in 17 of our Republican districts have taken the time and resources to compile their applications, to submit them, and are expecting to hear if their projects can move forward. And my colleagues are so eager to cater to the Republican leadership's failed obsession with repealing the Affordable Care Act that they will vote to rescind money applied for by centers in their very districts. Let me be clear, 350 applicants are ready to expand school-based health care service centers today, but this bill will prevent any of them from doing so. Nearly 8 million children in our country still lack reliable access to health care services. As I said before, school-based health centers are often the only source of health care for these children and adolescents. These children can't wait for our Republican colleagues' promise to repeal, and maybe one day Congress will get around to replacing what was cut in this rush to repeal. Our school kids need access to the care that school-based health centers provide, and they need it now. The program the Republican majority is trying to cut would fund at a minimum 200 centers across the country. These centers would not only increase access to health care for students, but would create jobs. At least 200 construction projects for hardworking Americans. During these tough economic times, these are exactly the kind of shovel-ready projects we should be funding, not eliminating. School-based health centers construction is a great economic stimulus, and it will provide incredibly important new services as well. It's a win for American workers and a win for American children. Instead, if this bill passes, none of them will receive funding and no jobs will be created. Now, I want to clear something up. Some of my colleagues state that school-based health centers were eligible for $1.5 billion in Recovery Act dollars for construction, renovation, and equipment. They use this as an excuse why their support of this bill does not indicate that they are against the school-based health center program. What they fail to mention is that these funds were only made available to FQHCs, health care centers, meaning 75% of school-based health centers could not even apply. This was not a drafting error of the Recovery Act. It was money for a completely separate program, pure and simple, and any kind of depiction otherwise is false. Furthermore, the school-based health centers program was not even authorized until the Affordable Care Act became law. So the funds we are voting to eliminate today are not duplicative. They are the first and only federal funding specifically for school-based health centers construction. I request unanimous consent to submit a letter from for the record, from the National Association of School-Based Health Centers opposing H.R. 1214, which is signed by representatives across the nation, including representatives in 37 states. I think it's a shame that school-based health centers have been caught up in the Republican leadership's repeal frenzy. I think it's a disservice to our children, to our communities, and I urge a no vote on this short-sighted legislation. I yield back the balance of my time.
Gentlelady yields back. Are there other amendments or other members wishing to offer an amendment or strike the last word? Gentleman from New Jersey, Mr. Pallone, is recognized for what purpose?
Are we on an amendment, Mr.
No, no.
We are?
Not
No?
yet.
Okay.
Well, Ms. Capps did. Let me recognize the gentleman from New York to strike the last word.
Mr. Chairman, I strongly oppose H.R. 1214. This bill would strike Section 4101A of the Affordable Care Act, which provides critical funds for the construction of school-based health centers. As I indicated during our subcommittee markup on this same bill, this section was included in the Affordable Care Act to increase access to clinical preventative services. I've long been a strong supporter of good work that school-based health centers are doing. With 6 of these centers in my district, I can certainly attest to the important role that they play in providing critical access to care. I assure you that if every school could have one, they would open a school-based health center immediately. Many students who receive care at these centers would otherwise not be in a position to do so. Frankly, I said this before, and I will say this again and again and again. I believe that we should be constructing more of these centers rather than cutting their funding. I urge my colleagues to oppose H.R. 1214. Mr. Chairman, on that note, I yield back the balance of my time, but before I do that, I also at the appropriate time would like to offer an amendment. I yield back.
Thank you. Gentleman from, let me go to this side, Dr. Burgess for 5 minutes. For what purpose does the gentleman from Texas seek recognition?
Move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you, Mr. Chairman, and I just feel obligated to speak on the bill itself before we get to the amendment process, because that seems to be the direction we're going. Look, this is the perfect metaphor for what's wrong with the Patient Protection Affordable Care Act. You are funding the bricks and mortar, the construction of a clinic with a nice exam bed and a blood pressure cuff, and you got no doctor, no nurse. What's wrong with this picture? This is what this bill, this law gets you. You build things that are going to be nice in someone's district, but you're not taking care of anyone. And that's my objection to this part of the Patient Protection Affordable Care Act. Section 4101A specifically says that you're going to provide $50 million in mandatory spending. You've got to spend it. You've got no choice. Mandatory spending for construction of school-based health centers every year through 2013. 4101B is to staff these centers that are built. Now, that might be good in as far as it goes, but that's discretionary. And how many dollars did President Obama put in his budget for the year 2012? Zero. So you're going to have a clinic, and you're not going to have a doctor, and you're not going to have a nurse. Now, I know if you subscribe to the theory of if you build it, they will come, maybe some doctors and nurses will show up at some point in some future budget, and it's a fantasy that we can all subscribe to. But we are dealing with reality today, and the reality is, already been pointed out, 42 cents out of every dollar that is spent is borrowed, and half of that borrowed money comes from foreign countries. Now,
Would the gentleman yield?
No, I will not yield. From 2008 to 2011, health centers received $2 billion in funds each year in discretionary spending. Under the Patient Protection Affordable Care Act, they received $11 billion in authorizations. In addition, $1.5 billion was included in the stimulus that could have been used for the construction of school-based centers. There was not a complete unmet need, and if you'd like to talk about those school-based centers that would not qualify this money, we can do that at the normal time and the normal place in this committee, because we are, after all, an authorizing committee. We should welcome the chance to bring this money back under the authorization side. Mr. Chairman, I don't think the committee's in order.
Yeah. Gentleman from Texas has the time.
The $150 million in grants under 4101A are for construction only, and there is an express prohibition from these funds being used to provide health services. Applicants have to say that they will find a way to provide the funds, but what if they can't? What if the plans fall through? What happens then? What happens to the land they bought? What happens to the bricks they bought? What happens to the mortar they've got mixed up? What happens? We will have allowed schools to purchase land to construct facilities that will not be able to deliver one tongue depressor's worth of care. There is a smarter way to tackle this issue, and I'm open to having that discussion. All my legislation does is rescind any unspent funds that are mandatory and return them to the Treasury. Now, there are certain times where it's reasonable to put things on autopilot. I don't completely disagree with that. But in this case, does it make good sense? Are we being good stewards of the taxpayer's dollar? I'm more than happy to work with anyone in this committee on either side of the dais to see what construction needs there are for school-based clinics and to ensure that care is delivered. I will also point out that Section 4101B of the Patient Protection Affordable Care Act created a new discretionary grant program for school-based health centers, but this grant program requires them to use funding to provide health care services. That would be a logical place to start to discuss any need for new construction funding. But providing a post-dated check to our favorite projects in favored districts is really not the answer, and it's not the work that the American people sent us here to do. I am not against health centers. I want to do more in this realm, but providing mandatory spending to construct facilities without adequate safeguards is irresponsible. And I would just point out, the Secretary of Health and Human Services, when she sat at this very table, I asked her the question, why would you do this? Why would you make it mandatory to build the clinic and discretionary to staff the clinic and then zero out those discretionary dollars in the President's budget? And she looked back at me and said, well, I didn't write the legislation. I will submit that no one in this committee did either. We are left with an impossible task. This thing was the Senate's bill. It was passed to get them out of town before a snowstorm on Christmas Eve. That's why we've got to deal with all of these inconsistencies within the legislation. This thing was written by the staff of the Senate Finance Committee. No member of this committee actually participated in the writing of this bill, this law. It is a travesty that this is what we're here talking about today, but nevertheless, that's what we have to do. But you know what? Why is it that we have to fund this with mandatory spending, but if we're going to build a new VA clinic, we've got to go through the normal authorization process? This is a step toward us becoming responsible and reclaiming our useful activity as an authorizing committee, and I urge support of the legislation.
Gentleman's time has expired. For what purposes, the gentleman from California, Mr. Waxman, seek recognition?
Strike the last word.
Gentleman is recognized for
This is not a patronage thing. People come in with applications, if there are funds available, to construct a school-based clinic. One of the requirements would be to show that they're capable of running it. They'll have the personnel to run it. Now, as I understand the gentleman from Texas who just spoke, he was complaining that we're going to build clinics, but we're not going to have personnel there. and therefore we ought to put money into training. But one of the other bills is to take away the money for training of new health providers like doctors. If he wanted to add money, if I suggested, to add money to this bill, not just to use the money for construction, but for training people who will serve in school-based clinics, I'm sure I'd be told, well, we don't have the money for that. We're borrowing 40 cents of every dollar, which we have to do because we're not asking the upper-income people to pay their fair share of taxes. And we're not doing what's necessary to get the economy moving so that people will go to work and pay taxes. So I think we get hit either way. The fact of the matter is school-based health centers are true success stories. This isn't something that's never happened before. They provide primary care, mental health. Mental health, that's not only needed in the schools but in the Congress. And dental health services. But in the school-based setting, it's for vulnerable children across the country. Multiple studies have found these programs are cost-effective investment of public resources. If you want to add that the money could not only just go for construction but for personnel, fine. But I don't hear anybody seriously suggesting that. And then to say, well, we're not going to put money into these clinics at all doesn't make sense, or to make it an authorization. But there is no such thing as an authorization for it. If this bill passes, there's nothing that would allow any funding of school-based clinics that I know of. So I just think that the argument from the gentleman from Texas left me unconvinced. And I'd be pleased to yield to anybody.
The gentleman yield?
Yes, Mr. Pallone. Yield.
I just want to support what you said. I mean, at one point, Dr. Burgess said that the clinics were mandatory. Nobody's forcing anybody to build the clinics. My understanding is that there's a bunch of clinics that are shovel-ready, already been applied for, ready to go, just waiting for the funding. So this notion that somehow we're forcing someone to build a school-based clinic, it's just nothing could be further from the truth. There's an outstanding demand for these. They're ready to go.
And there'll be others who will want to come in and ask for funding as well once they know that there's mandatory funding available. They don't have to wait and see whether from year to year whether there's an appropriation or whether the government's closed down, that there's going to be a real funding to make sure that schools or school districts could come in and apply for money to build a school-based clinic.
Right. I mean, essentially, Mr. Waxman, my understanding that all we're doing with this amendment is putting off what's about to happen. In other words, these places are ready to go. They're looking for the money. They're all approved. Not all of them, but a significant number of them are approved. And the notion that somehow there aren't personnel that are going to fill them, in order to, when they apply, they indicate that they have personnel. And as Mr. Waxman said, I mean, you have another bill coming up here, I think it's 1216, that provides training for community, for physicians, nurses, exactly that. So, what are we talking about here? The most important thing I think you have to understand is that you save money with these school-based clinics. It results in lower emergency room usage, hospitalization, Medicaid costs are saved. There's a patient seen at school-based health centers costs Medicaid an average of $30.40 less than the comparable non-school-based health center patient. So we're saving money. Nobody's forcing anybody to do anything. I'm not trying to take away, Dr. Burgess, but I just don't understand the whole idea that somehow we're forcing these down somebody's throat. People are waiting for these to happen because they know it saves money. It's going to cover people that right now are not getting primary care. I yield back to Mr.
Gentlemen,
Wax.
thank you for yielding back. I want to yield to any of my Democratic colleagues that have an amendment that they want to offer, because we ought to get amendments on the table. We can debate them, and if we can't pass them, then I would hope members on both sides of the aisle would reject this bill. Anybody wish to be recognized? Mr. Dingell, I yield to you for the whatever purpose you seek recognition.
Be happy to proceed on my own time. It doesn't matter all that much.
Gentleman's time has expired from striking the last word. We'd really like to proceed with amendments at this point. Are there any members seeking to offer an amendment?
I have a fine amendment.
Gentleman from Michigan is recognized to offer an amendment.
Thank you, Mr. Chairman. The amendment is at the clerk's desk.
Which number, sir?
I know.
Number 1.
Yeah.
An amendment to H.R. 1214 offered by Mr. Dingle.
I ask unanimous that the reading be dispensed with.
Yes. Mr. Chairman.
I would recognize the gentlelady for 2 seconds.
Just to reserve a point of
to
order.
reserve a point of order. Ms. Myrick reserves a point of order. The clerk has read the title. The staff will disperse the amendments, and the gentleman is recognized for 5 minutes in support of his amendment.
I thank you, Mr. Chairman. Before I begin, I'd like to observe that I yield to no man in my distaste for the practices of the United States Senate. And if there is a defect in the health bill, there's a high degree of probability that most of the defects there are related to mistakes made back in 1789 when the Constitution was concluded by a compromise adopting the Senate. In any event, it is my hope that we can address the problems of the health care bill here by addressing the real concerns we have, try to amend the bill in ways that accomplishes our purpose, and try to see that there is really a wonderful opportunity here for us to do good things, including saving important progress made during the last Congress. Now, until the Affordable Care Act, school-based health centers had never been an authorized program. But they are now, and the amendment simply says that the bill does not go into effect and terminate the funding for these school-based health centers until such time as all of our young people who are under 21 years of age have health insurance coverage. One of our big problems is our kids are not growing up healthy. There are all kinds of troubles, diabetes, weight, including things like cancer, heart, circulatory difficulties, and other things. Kids go to school some distance from their homes at large consolidated schools. And the end result of this is that they are a long way from home. Parents have to worry about the health of the kids, particularly those who happen to have problems with their health. Now, having said this, this is probably one of the best and cheapest ways of assuring and protecting the health of our kids, because there is almost invariably a nurse on duty there, and if the child becomes sick, it is almost certain that the sickness will be properly addressed rather than having to ferry the child to a hospital some distance away with all the attendant difficulties that carries. Our purpose here with this is to see to it that we do have this kind of service available on a basis of need. There's no great cost associated with this, and if we have seen that the Senate bill has a defect, I'll be happy to match a defect for defect by showing where other similar or worse defects can be found, which is one of the reasons I commend my Republican colleagues for the idea that maybe we ought to go after some of these amendments and correct them, but not by repealing the original legislation or by repealing parts of that legislation. Now, these centers offer critical and essential health services to our kids and to the communities. They provide high-quality health care in convenient and accessible locations to all children and adolescents at their schools. There are some 1,900 of them across the country, some 90 or more in my home state of Michigan, including in your district, Mr. Chairman, as well as in mine. And they serve over 2 million children and adolescents. And until more operating funds are available, it's my hope that members on both sides of the aisle will work with me to try and see to it that we have the funding needed for these particular kinds of programs. In any event, if the legislation that is before us is adopted with the amendment, 100% of individuals in age groups under 21 will have to have health insurance coverage before we can see the system canceled. This is a very solid investment on the part of our country. It will put money into health care for our kids in a way where they will get it, particularly for families of kids who are of limited means. Money will be then available to the kids to have health care in school, which they do not now get. I would hope my colleagues would be supportive of me in this amendment and supportive, if the amendment fails, in rejecting the legislation, which I think is dangerous, not well thought out, and probably is bottomed on some outrage about the way the Senate handled this bill. I would observe that we will find lots and lots of instances where the Senate handles legislation poorly. With that, I yield back the balance of my time, and I thank you for your courtesy, Mr. Chairman.
Gentleman yields back his time. Chair would recognize Dr. Burgess for 5 minutes in opposition to the amendment.
Actually, I'm in favor of the amendment. Oh, no, I'm in favor of the underlying bill. I beg your pardon. But, you know, and the Chairman Emeritus, Mr. Dingell, I certainly value the service that you've provided to the country. As I've told you before, I treasure every day that I have the privilege of serving on the committee with you. I should point out to you that we had the fellow here from the CBO, Dr. Elmendorf, just the other day, and he will tell you that the Patient Protection Affordable Care Act will not accomplish 100% coverage. That, in fact, is part of the published CBO interpretation of the Patient Protection Affordable Care Act. But more importantly, this bill doesn't have anything to do with coverage. It has to do with mandatory spending for the construction of school-based health centers. So I just wonder why we continue to confuse the issue of coverage and access. Coverage does not always equal access, and this provision of the Patient Protection Affordable Care Act only accounts for the building of school-based health centers. While a fully staffed health center might improve access if the population is in need of services, this amendment does not address the fact that as constructed, 4101A cannot provide services, and there is no way to recover the funds if the land is purchased, the bricks are purchased, the mortar is mixed up, and the plan to provide services subsequently dries up, as it might, for example, if a president refused to provide any funding in the discretionary budget, because after all, it is the discretionary part of the president's budget that will pay for the staffing of these clinics. If access to care was the primary reason for the inclusion of this section, why did it not include staffing of the centers, just like the construction? Section 4101B of the Patient Protection Affordable Care Act authorized a separate discretionary grant program to provide care at the clinics. This program was not provided mandatory funding. Providing funds for construction without funds to staff and provide health services is the kindest thing you can say about it. It's incoherent. The President's budget did not request funding for grants for that section that actually provides the care. When addressing the access to care issue, which is a conversation I'm willing to have on the discretionary side, why aren't we focusing more on the things that will actually end up delivering the care to the people who need the services? Now, the President of the United States, when he gave his State of the Union address, said he was willing to talk about doing things that would improve the Patient Protection Affordable Care Act. I am of the opinion that this is so fatally flawed that it cannot be saved. However, I will take the President at his word that he is willing to work with anyone on either side of the aisle to try to improve the product. In fact, I think we heard that just today the Senate passed the legislation to remove the dreaded 1099 provision, the paperwork provision that was going to drive people crazy. So maybe there is some hope. But at the same time, I can't help the President if every time I come forward with an idea, I'm subject to all of these ad hominem attacks. I mean, do you want help or not? I am trying to help you. This is really incoherent policy. We fund with mandatory funding the construction of the clinics, discretionary funding, the staffing of the clinics, and oh, by the way, no money for next year for staffing the clinics. The kindest thing you can say about that is it's incoherent. I would also say that, you know, I feel sorry for my friends on the other side of the dais. They're stuck with defending the language of 3590, which was never their language.
Would the gentleman,
language-
yield me just a sec? Would you yield me just 2 seconds, please, just so I can withdraw my objection to?
Please.
Point of order.
Yes, I'd be happy
Thank
to
you.
yield.
Yes,
Okay, the
Mr.
lady
Chairman.
withdraws her
Yes, I
point of
withdraw my point of order.
This language, mandatory language for the construction of school-based health centers, was not in H.R. 3200, which, for as bad as it was the product of this committee. If it was so important to have it drafted just that way, why was this not part of our discussion in July of 2009? I'll yield back the balance.
Would the
of my
gentleman
time.
yield to 20 minutes? I mean, 20 seconds. Dr. Burgess, I don't understand. You said that this bill will not provide coverage. The school-based clinics are providing access to care for people. It may not be insurance, but what does it matter as long as people are getting primary care?
Reclaiming my time, there is no coverage if you have a clinic built and an exam table but no doctor or no nurse. No treatment can be rendered. No, the treatment does not come down from heaven in a lightning bolt. The treatment has to be administered by a person, unless you repealed that in this too, and I somehow missed it.
The gentleman's time has expired. Is there further discussion of the amendment? If there is no further discussion, the vote occurs on the amendment.
One question, please.
We have gentleman, Dr. Cassidy is recognized.
Just for my edification, this speaks of folks 21 years of age or younger, but school children are 19 or younger at the most. Was there a reason that 21 was chosen as opposed to 18 or 19 or 17?
If the gentleman could yield, I mean,
Yes,
in my school districts, you have kids that are 20 and 21. It all depends on the school district.
But
is that New Jersey? Is that called 8th grade?
No, well, I mean, you know, you guys are getting out of hand now. I mean, look, the point is, you have kids in school that go up to age 21. So what's the big deal? We're just trying to cover people that are in school. They have to be in school.
Okay. Is there further discussion of the amendment?
Yeah,
Gentleman.
Mr. Chairman.
The
answer.
Gentleman from Michigan.
And I appreciate the question raised. This matches up with the requirements of Medicaid. You know, so we have the same rule here with regard to age that we would with regard to Medicaid and the age of children.
So S-CHIP, just so I know, S-CHIP is available for 21 or younger, and so this corresponds with S-CHIP eligibility. I'm asking in honesty, I just don't know.
If the gentleman would yield, I believe
yield.
the answer to that question is yes.
Okay. And Ms. Capps, I yield to you.
Thank you. I'm not sure about every state, but in the state of California, students with disabilities are served in the public school system through age 21.
Okay.
You want a gentleman yield?
I will.
Yeah. Mr. Chairman.
Gentleman from Illinois is recognized.
And members of the committee, I have a similar amendment, but I'm just kind of stunned by the type of discussion and the argument that's being presented by my friend from Texas. I mean, I represent a district that is very poor. I represent students that have very little access to medical care. And one of the primary reasons, or places rather, that they're able to secure any type of medical attention, and really the best way for them to get the medical attention is through school-based health clinics. These provide a vista, an opportunity, an avenue into further complications and problems that they may have at home. Getting a student in a school-based health clinic that might have suffered from chronic headaches may reveal some other issues that prevents the student from getting quality education or from becoming a problem in school. And it just kind of, it just don't make sense to me for the argument to be presented that if you don't build it, then you don't need it. Well, I think if you build it, they will come. And I just would invite the gentleman from Texas to build one and watch the stampede to the health center because it's needed in places in this nation. Every citizen in this nation don't have access to health care. Don't you get it? Where will you get it? This is an amendment that speaks loudly and speaks powerfully to those in our nation who are less fortunate and who are disadvantaged. And I think that this is a great amendment, and I have a similar amendment that I'll be presenting at some point later in this hearing. I yield back.
Chair, thanks, gentlemen. Is there further discussion of the amendment? If there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. Those opposed, no. No. The nays have it, and the amendment's not agreed to. Are there further amendments? The gentlelady from California is recognized.
Thank you, Mr. Chairman. I have an amendment at the desk.
Mr. Chairman, may I reserve a point of order?
The clerk will report the amendment, and the gentlelady reserves a point of order.
Amendment number 2?
Yes.
An amendment offered by Mrs. Capps.
The reading of the amendments dispensed with, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. As we sit here today, I can't help but think about what the rhetoric being thrown around here in this committee really means to the health of the young people at home in our communities. For example, barely 2/3 of teenagers receive a wellness checkup each year. That means that nearly 1/3 of our young people are missing a key preventive health visit that could spot problems early, intervene before more chronic ailments arise. We all agree that we'd like to see our children to be healthier, and the Affordable Health Care Act seeks to rectify this situation in part by expanding the reach of school-based health centers. Checkups that help detect lifelong challenges for our children, such as obesity, diabetes, and asthma. Detecting these illnesses early, we can help improve the quality of life of a child and save on healthcare costs for a whole lifetime. In fact, the fact that only 2/3 of our students have access to these checkups is simply not good enough in this country. Students need access to these critical checkups, and school-based health centers are our safety net for providing them. Without the money to build the centers, thousands of children will go without a guaranteed source of care. My amendment is straightforward. It would simply establish that, if enacted, the school-based health center construction funds repeal would only go into effect once our shared national goal is met, which is to ensure that at least 75.6% of individuals in the United States who are 10 through 17 years of age have had a wellness checkup during the previous 12-month period. While the ultimate goal is to ensure all children get this needed care, the 75% goal would put us in line with that which is included in Healthy People 200, an evidence-based 10-year national target level. These goals are nonpartisan, based on science and data, and are set out to be both ambitious and achievable. Until we reach the 75% marker, it's really critical that we need to support any effort to achieve it, including the need to build additional school-based health centers to provide these services. Students spend a majority of their time in school, making school-based health centers the most reasonable place to provide an annual checkup. Bringing providers to students, the centers create an atmosphere of trust and support that these children need. Centers help provide medically underserved students regular access to preventive and primary care, dental and vision screening, and mental health service in one of the places they spend the most time, school. As I've said before, school-based health centers are often the only sources of health care for our young people. They are also our first line of defense against the spread of infectious diseases among our children and in our communities. In the past year, 40% of students missed 3 or more days because of illness or injury. School-based health centers ensure our children receive quality medical attention promptly so they can get healthy and get back in the classroom. Just think, with the services provided by these centers, children will be spending more time learning in their classrooms, less time clogging our emergency rooms. And we need our children in their classrooms, learning so that we can out-educate, out-innovate, and out-build the rest of the world. As a former school nurse, I've seen firsthand the impact of health on a child's education. A student can't pay attention if she can't hear her teacher because she needs hearing aids. A student can't read if he can't see the blackboard because he needs glasses. A student can't learn if she has undiagnosed asthma and it's hard to breathe. And if a student can't learn, they will fall behind, and many never catch up. All these ailments are easily detected with an annual wellness checkup, and they are provided without additional barriers by school-based health centers. Until 75% of children receive annual checkups, we simply can't afford to eliminate funding for one of our best deliveries of care. So I urge my colleagues to support this amendment as a very common sense way to ensure that funding could be there for this critical program as long as the need is there. And I yield.
Could I ask
I'll
the
yield.
gentlewoman to yield?
I will
You know,
do that.
I just wanted to thank you for having a very positive, vision of what we're trying to do here. This is a values issue as well. And there's a lot of cynicism about, what we do in Congress or what we don't do. And you just laid out a very practical reason why we have these school-based clinics, what it means for kids' education, why it allows for equal opportunity, which is what this country is all about. And, I just want to tell you, I'm just pleased, having been here since 10 o'clock, to hear such a positive-oriented vision about the future. It's really nice for a change.
Oh, and I'll just say in response, since you're getting to that level of conversation with 10 seconds left, that my feelings about this legislation have not anything to do with which side of the aisle I happen to sit on. It has a lot to do with where I spent my life before I came to Congress. Thank you, Mr. Pallone.
The gentlelady's
And I
time
yield
has
back.
expired. Is there further discussion of the amendment? Chair recognizes the gentleman from Texas, Dr. Burgess, for 5 minutes.
Thank you, Mr. Chairman. I just need to point out that once again, this amendment doesn't have anything to do with increasing access to care or access to services. Remember, the underlying bill provides construction funding, mandatory funding for construction of school-based clinics. It does nothing to provide a doctor or a nurse. It doesn't provide a single hearing aid. It doesn't provide a single asthma inhaler. The problem with Section 4101A of the Patient Protection Affordable Care Act is the mandatory funding for building school-based health centers with no guarantee that these centers will have the resources to staff the center and actually deliver the care. Ensuring that children are able to access care is reasonable. However, this section does not lend or increase the ability to obtain services. As a committee, I do need to point out that as a committee, we've not heard testimony from the Department of Health and Human Services that 75.6% is an accurate target for this Healthy People 2020 initiative. How can we on this committee justify the mandatory spending of $50 million a year through 2014 if we don't have a verified level that we're trying to achieve? If increasing annual wellness visits for children aged 10 to 17 is a priority, then increasing physician workforce should also be a priority, not throwing money at construction projects that could lay abandoned if the law is deemed to be unworkable by the courts. Once again, I urge rejection of this amendment and support for the underlying
Would the
bill.
gentleman yield?
Yes, I'll be happy to yield to the gentleman.
I just don't understand. There's other bills here today that provide for training of primary care
Reclaiming my
physicians,
time, because this
nurses.
is an important point. Reclaiming my time. This is not about training. This is about construction.
But you have
and
another
staffing.
bill that
This is
eliminates the
not-
training.
We are not talking about training. We're talking about construction and staffing.
We're
Why is
not
construct-
now, but
why
the
is
bill that
reclaiming
does
my
the-
time, controlling the time, construction is mandatory, staffing is discretionary. Now, we'll get to
But
training.
the other
Training is-
bill is on the agenda
this,
to eliminate
but we are
all
not
that.
talking about training at this time. We're talking about a mandatory construction
Okay,
bill.
well, half an hour
and a
from now, we'll talk
discretionary
about it then.
Staffing bill.
Gentleman's yields back. Is there further discussion of the amendment? The gentlelady from California is for a purpose of the gentleman.
Thank you, Mr. Chairman. I move to strike the last word.
Recognized for 5 minutes.
Mr. Chairman and members, we're having a make-believe debate here, in my view. I've listened for a long time today, as you all have as well, and participated in some of it. It's as if the majority is saying, we don't like what's in the bill, but we're for community-based health, we're for prevention, we're for building upon the progress that our nation has made against obesity, against cancer, making progress down those very, very important roads that really benefit not only the American people, but humankind, because America is the leader in this. You're not for any of these things. You've named the bill after a president that, I don't like using the word, but I've come to the conclusion that you detest. You mock the bill by calling it Obamacare, as if there's a boogeyman in this. And yet, you know what? You're playing with people's lives. You are playing with people's lives. So this is a pretend debate. Build it. What do you mean, build it? They're going to. Are you afraid of who's going to show up in these clinics? Have you read the bill? It doesn't matter that we built into it that there would be a whole new generation of primary care physicians that would be trained in our country. I think that that's progress. I think that's synonymous with what our country is about. Now, there are a lot of new members on this committee. You haven't had an opportunity to travel relative to congressional travel. Go to other countries in the world and see what those countries look like without what we're talking about here. Look at their infant mortality rates. Look at their expected lifespans. So pretend that you just don't like this, but that you have something wonderful in store for the American people. What is it? We've been here for 90 days. There's nothing on jobs. It's destroy, destroy, disrupt, disrupt, and destroy some more. So I don't know. What is your agenda? You hate the government so much that you have to come here to try and visit this upon people. Maybe you want to visit it upon your constituents. Mine don't like it, and they reject it. They know we have to do something about our deficit. As I said earlier today, I believe this morning, we cut $41 billion. You're still dinking around with whatever you're going to do on a CR. We cut $41 billion in December. But health care and a system to make sure, I'm sorry, it's my time.
Under words, please, Mr. Chairman.
It's my time. It's my time. And to set up a system of health care in the country, you don't like what's in the bill. What do you have to offer? What do you have to offer? We haven't heard anything. Nothing is on the table except to destroy this. And if you really read the bill, which you all use that phrase, campaigning, read the bill, read the bill. If you read the bill, you would know that one thing is hooked to another, that there's a nexus between these centers, primary care physicians, funding for that, and the needs to speak to the needs to the people in our country. So, I'm sorry to say that this is kind of a fake debate, but you know what? If you're not going to put on the table something positive for the American people and just continually seek and destroy, what do you have to offer? Say it. I think the cameras are on. Maybe someone can give us a clue what you might be coming up with next week for health care for the American people. Or does that cost too much, too? You have health care. Easy for everyone here to say. Maybe some people here didn't accept it. You have nothing to worry about. Everything's good in your life. Well, everything is not well in America, and people deserve better. So that's what I want to say, and I've gotten it off my chest, and I look forward to hearing what the majority plans to do about health care to address the needs of the American
The gentlelady's time has expired. The chair recognizes the ranking member emeritus. 5 minutes.
Well, thank you, Mr. Chairman. let's try to have a fact-based debate. We know why we're here. The majority doesn't like all the mandatory spending in the new health care law. It doesn't mean we don't like some of the things in it. We certainly support community-based health clinics and school-based health clinics. I've gone to openings in my district. I've supported funding for both the community clinics and the school-based clinics. The hospital system that my wife worked for until recently, John Peter Smith, which is the public hospital in Tarrant County, Texas, I believe has 8 school-based health clinics, maybe 10, 4 of which I believe are in my congressional district. So this isn't a debate about school-based health clinics. It is a debate about the mandatory nature of the funding, not just in this bill, but in on this particular bill that's before us, but in the other bills that we debated earlier today, and at least one other bill we're going to debate later this afternoon. You know, the Republicans support federally supported health care, but we do not support the particular law that was passed, rammed down our throats in the last Congress. We have an obligation to try to repeal as much of it as possible, but once that's done, we're more than happy to work with our friends on the minority on specific issues, one of which would, I think there's probably a commonality of interest in school-based health clinics. So, you know, when we were in the minority, we came up with all the amendments that we could to try to do what we call gotcha amendments, and I commend the gentlelady from California. This is a gotcha amendment. She feels strongly about school-based health clinics, and so she wants to put us on record that we don't want to spend mandatorily funds for that. That's part of the political process. When we were in the minority, we did it to then the Democratic majority, and now the Democrat minority is doing it to us. That's part of what an open, transparent markup is about. It's fair. It's no fun, but it's fair. So, you know, but don't, you know, my other good friend from California, Ms. Eshu, who we've worked so well together on so many issues, this isn't a fake debate. And I see a noticeable absence of anybody defending mandatory spending, which we don't have the funding for. As Mr. Shimkus pointed out earlier, we're borrowing, 40 cents of every dollar? 42 cents? Where's that money coming from? You know? That's what we're trying to do something about. And so, you know, those of us that have been on the committee a while, we understand the process. We understand what these amendments are about. But don't for a minute think that this is debate about whether we support school-based health clinics. There's not a member of this committee on either side that doesn't support school-based health clinics. But we oppose mandatorily requiring that money be spent which we don't have. That's what this bill is about and the other bills before the committee. And that's not a fake debate. It's a real debate. And so I oppose the Capps amendment with great respect. I have nothing but personal respect for Mrs. Capps, but you know, we want to repeal as much of the new health care law and then replace it with something that is market-based and something which we can fund, that we can afford to finance. And with that, Mr. Chairman, I yield back.
Chair thanks the Chair Emeritus. Is there further discussion on the amendment? I think we'll go to the gentlelady, Ms. Christensen, for 5 minutes.
Thank you. I just wanted to say a word in support of the amendment. I think that Ms. Capps has made offered a very reasonable amendment. It's important that our young people, when they are at that very vulnerable age, have the services and the care that the school-based centers would provide. And it allows for the repeal of the balance of the funding once we reach that important threshold. And yes, I agree with Congressman and Chairman Pallone that arguing about not having the providers is not consistent with H.R. 1216 that would remove funding from the training of primary care doctors. We need those physicians, and I just want to support your amendment. Ms. Capps. Thank you.
Chair, thanks.
Yield back.
Gentlelady, is there further discussion on the amendment? If there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. All those opposed, no. No.
Mr. Chairman, would I ask
The nays
these
have it,
liaisons-
and the amendment is.
Mr. Chairman?
The ranking member requests a roll call vote. The clerk will call the roll as soon as we get a clerk here.
Mr. Barton?
No.
Mr. Barton, no. Mr. Stearns? Mr. Whitfield? Mr. Whitfield, no. Mr. Shimkus? Mr. Shimkus, no. Mr. Pitts?
No.
Mr. Pitts, no. Mrs. Bono Mack? Yes. Mr. Walden? Mr. Terry?
No.
Mr. Terry, no. Mr. Rogers? Mr. Rogers, no. Mrs. Myrick? Mrs. Myrick, no. Mr. Sullivan? Mr. Murphy? Mr. Murphy, no. Mr. Burgess? Mr. Burgess, no. Mrs. Blackburn? Mrs. Blackburn, no. Mr. Bilbray?
No.
Mr. Bilbray, no. Mr. Bass? Mr. Gingrey? Mr. Gingrey, no. Mr. Scalise? Mr. Scalise, no. Mr. Latta? Mr. Latta, no. Mrs. McMorris Rogers? Mrs. McMorris Rogers, no. Mr. Harper? Mr. Harper, no. Mr. Lance? Mr. Lance, no. Mr. Cassidy? Mr. Cassidy, no. Mr. Guthrie? Mr. Guthrie, no. Mr. Olson? Mr. Olson, no. Mr. McKinley? Mr. Gardner? Mr. Gardner, no. Mr. Pompeo? Mr. Pompeo, no. Mr. Kinzinger? Mr. Kinzinger, no. Mr. Griffith? Mr. Griffith, no. Mr. Waxman? Mr. Dingle? Mr. Dingle, aye. Mr. Markey? Mr. Towns? Mr. Towns, aye. Mr. Pallone? Mr. Pallone, aye. Mr. Rush?
Aye.
Mr. Rush, aye. Mrs. Eshu? Ms. Eshu, aye. Mr. Engel? Mr. Green? Ms. DeGette? Ms. DeGette, aye. Mrs. Capps? Mrs. Capps, aye. Mr. Doyle? Ms. Schakowsky? Ms. Schakowsky, aye. Mr. Gonzalez? Mr. Inslee?
Aye.
Mr. Inslee, aye. Ms. Baldwin? Ms. Baldwin, aye. Mr. Ross? Mr. Ross, aye. Mr. Weiner? Mr. Weiner, aye. Mr. Matheson? Mr. Matheson, aye. Mr. Butterfield? Mr. Barrow? Mr. Barrow, aye. Ms. Matsui? Ms. Matsui, aye. Ms. Christensen? Ms. Christensen, aye. Mr. Upton?
Are there other members wishing to be recorded? Mr. Bass?
Mr. Bass, no.
Mr. Stearns?
Mr. Stearns, no.
Mr. Sullivan?
Mr. Sullivan, no.
Mr. Walden?
Oh, Mr. Walden, no. That's about it, right?
The clerk will report the result.
Mr. Chairman, on that, there were 16 ayes, 28 nays.
The amendment is not agreed to. Are there further amendments?
Mr. Chairman.
Mr. Chairman, I have an amendment at the desk.
All right, the clerk will report the amendment. Record the amendment.
Number 3, Mr. Towns?
Number 4.
Number 4. An amendment offered by Mr. Towns.
Without objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of his amendment. Gentleman, Mr. Towns, is recognized for 5 minutes.
Thank you very much, Mr. Chairman. The amendment that I am offering maintains the current mandatory funding structure for school-based health centers. However, in lieu of putting the funds into construction, this amendment provides mandatory funds for the operating costs of these centers. And I was happy to hear my colleague from Texas indicate that he felt the same way. Many of my colleagues on both sides of the aisle have indicated in last week's Health Subcommittee hearing that they would support funding for operating costs, though I feel that we should do both, build more school-based health centers and provide operating funds for them. I think this might be a place for us to meet in the middle. This amendment does that. In addition, some arguments have been raised that the ACA does not provide operation funding, so funds for construction would be wasted. It's worth noting that the HRSA guidelines issued for funding through this program requires applicants to demonstrate their ability to maintain operations of the center for at least 2 years. About 76% of school-based health centers depend on funds from state governments, while 37% receives funds from local governments for their operations. Half receive some support from private foundations, while only 23% are sponsored by and only 28% are eligible for federal funds under Section 330 of the Public Health Service Act. This source provides targeted federal funds towards the provision of primary health care for the nation's underserved populations. I am interested in working together on shared priorities. School-based health centers have long been supported by Republicans, Democrats, independents, all alike. Many are located in the congressional district or members on this committee, Republicans, Democrats, and independents. Let's work together to support programs that have long been supported by members of this committee. I urge my colleagues to support this amendment, and then I also note that the business community loves this amendment, because what it does is that if a mother does not feel like leaving her daughter, but if there's a school-based clinic, then she's able to, if the youngster has a little temperature, maybe a little problems, not feeling too good, but the point is she knows that the health clinic is there, that they will go on to work, and of course, and to be able to function in a normal kind of way. And of course, I think that that's something that we should not ignore as well. So, Mr. Chairman, I wait for a successful conclusion that will make life better for our children, because I think that, as I listen to some of the comments on the other side, I think this is the amendment that they've been waiting for, that they are now ready to vote and to be able to show how we can work together and to make certain that we provide the best quality health care for our children. And I think that's what we all should be about. And if you're not about that, then I'm not sure you should be on this committee, because this is a committee to help people. On that note, I yield back.
Chair, thanks, gentlemen. Recognize the gentleman from Illinois for 5 minutes.
Thank you, Mr. Chairman. I just move to speak out against the amendment.
Chair is recognized.
And I have great respect to my friend, Mr. Towns. We're glad to have him back on the committee. He prefaced his comments talking about moving the mandatory fund from the building to the operation fund. And that brings up our opposition. It's mandatory funding that we have the problem with. Our national debt, which is $14.5 trillion, is based upon mandatory funding. It's mandatory funding. That's what's driving us into...
Will the gentleman yield?
I'd be happy to yield.
You know, this money comes from a lot of different sources. It's just not, you have to understand foundations involved in
No, I understand.
And even community...
Reclaiming my time, but this is $50 million of mandatory spending that we're going to borrow $21 million. We're going to borrow $21 million from, and then about $10 million will come from the Chinese and the Japanese and the Brits. So we're borrowing, in essence, 42 cents on every dollar. So, I mean, we could wrap this debate this cloak around for the kids. I mean, $47,000 is what we are giving to our children and our grandchildren to pay for the national debt. So these debates, as Joe Barton mentioned, are really good debates to have. And we should do them with passion, but we also should do them with talking through the process. We should be debating these clinics on an authorization level. How much do we think we should authorize for the building of these? Hold us accountable. We should debate how much we should authorize if you think it's a federal government's role to operate these school-based clinics. Some people would say, I'm not sure it's the national government's role to do that. And some people would say, I'm not sure it's the national government's role to build community health clinics. We have a great history in this country of local control of education. So our problem is in this bill, however we want to call it, is the mandatory aspect. And all we're trying to do is reclaim the constitutional legislative integrity of the process in which we authorize and we appropriate. So when November election occurred and the debate was government's too busy, spending too much, we fear what's going on in the national health care bill. We came back here to say, okay, what is the things that we can do to reclaim control of the legislative process? You reclaim control by going through an annual authorization, or at least authorizing a program for a set number of years, where then you then have a reauthorization process. We were not sent here to put mandatory spending without checks and balances into the system where we are bankrupt. And so, again, it's a great debate to have. It's $50 million mandatory spending in which $21 million is going to be borrowed. $21 million is borrowed from China. It's borrowed from Japan. It's borrowed from the Brits. And so let's get back. Let's really reclaim and have these policy debates here in this great committee, but let's do it the way it's supposed to work. Not automatic pilots, mandatory spending. That's done. We're not going to look back. Boom, let's go. 10 years in a row. Let's go back to say, is this a credible program? Should we authorize it? At what level? And then if we do that in a bipartisan manner, then we take our committee and we go to the budgetary process and we fight for the appropriation of that set amount of money. So that's our problem. The mandatory aspects of what happened in the health care law, which mandated mandatory spending without a check and balance on the legislative branch. That's why we oppose this. I know your amendment is well-intentioned. It does address Dr. Burgess's issue, but I can't speak for him. But I think the mandatory aspect of mandatory spending is why we're having these bills here today. And I have 13 seconds left. I yield back my time.
Thanks, gentlemen. Is there further discussion of the amendment? If there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye.
Mr. Chairman.
All those opposed,
no.
no.
Mr. Chairman, I ask for a roll call vote.
The roll call votes requested. The clerk will call the roll.
Mr. Barton. No. Mr. Barton, no. Mr. Stearns. Mr. Stearns, no. Mr. Whitfield. Mr. Whitfield, no. Mr. Shimkus. No. Mr. Shimkus, no. Mr. Pitts.
No.
Mr. Pitts, no. Mrs. Bono Mack. Mr. Walden. Mr. Walden, no. Mr. Terry. Mr. Terry, no. Mr. Rogers. Mr. Rogers, no. Mrs. Myrick. Mr. Sullivan. Mr. Sullivan, no. Mr. Murphy. Mr. Murphy, no. Mr. Burgess. Mr. Burgess, no. Mrs. Blackburn. Mrs. Blackburn, no. Mr. Bilbray.
No.
Mr. Bilbray, no. Mr. Bass. Mr. Bass, no. Mr. Gingrey. Mr. Gingrey, no. Mr. Scalise. Mr. Scalise, no. Mr. Latta. Mr. Latta, no. Mrs. McMorris Rogers. Mrs. McMorris Rogers, no. Mr. Harper. Mr. Harper, no. Mr. Lance. Mr. Lance, no. Mr. Cassidy. Mr. Cassidy, no. Mr. Guthrie. Mr. Guthrie, no. Mr. Olson. Mr. Olson, no. Mr. McKinley. Mr. Gardner. Mr. Gardner, no. Mr. Pompeo. Mr. Pompeo, no. Mr. Kinzinger. Mr. Kinzinger, no. Mr. Griffith. Mr. Griffith, no. Mr. Waxman. Mr. Dingle. Mr. Markey. Mr. Towns. Mr. Towns, aye. Mr. Pallone. Mr. Pallone, aye. Mr. Rush.
Aye.
Mr. Rush, aye. Ms. Eshu. Aye. Ms. Eshu, aye. Mr. Engel. Mr. Green. Ms. DeGette. Aye. Ms. DeGette, aye. Mrs. Capps. Mr. Doyle. Ms. Schakowsky. Aye. Ms. Schakowsky, aye. Mr. Gonzalez. Mr. Inslee. Aye. Mr. Inslee, aye. Ms. Baldwin. Ms. Baldwin, aye. Mr. Ross. Mr. Weiner. Mr. Matheson. Mr. Matheson, aye. Mr. Butterfield. Mr. Barrow. Mr. Barrow, aye. Ms. Matsui. Ms. Matsui, aye. Ms. Christensen. Aye. Ms. Christensen, aye. Mr. Upton.
Are there any other members wishing to be recorded? Mr. Ross?
Mr. Ross, aye.
Mr. Butterfield?
Mr. Butterfield, aye.
Mr. Weiner?
Mr. Weiner, aye.
The clerk will report the result.
Mr. Chairman, on that there were 15 ayes, 27 nays.
The amendment is not agreed to. Are there further amendments?
Mr. Chairman, I have an amendment at the desk.
The gentleman, Mr. Rush, is recognized to offer an amendment.
Mr. Rush, which number?
It's amendment number 5.
Clerk will report the amendment.
Amendment offered by Mr. Rush.
Without objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. Mr. Chairman, I am exceedingly disappointed by the level of the debate today. National health care reform may just possibly be the most important, if not historic, piece of legislation ever passed by this Congress. Congress should be expanding health care coverage, not limiting it, not axing it. Congress should also be emphasizing preventive care and ensuring that care, when it is needed, is provided to all Americans, especially to our most needy, our children. The Affordable Care Act provides health care for nearly 46 million uninsured American citizens, and with 8.6 million of those being our vulnerable children. Why, Mr. Chairman, on earth are we trying to unravel what has taken us so many, many years to stitch together? With respect to Mr. Burgess's bill, it will rescind $50 million in funding for school-based health center construction. This funding provides critical resources to communities, allowing them to open new health care clinics at their schools. Without this funding mechanism, these centers would not be built. And school and community-based health centers that are already open to the children of my state, especially those 17% of the state's population who currently live in underserved communities, will be strained and hard-pressed to serve the needy patients, the children, and also the seniors who rely on them. Our children are spending most of their time in school, while their parents are struggling to earn a living in order to care for them. This funding is vitally important in giving our school-based health system the capacity to serve and to care for a low-income population. By rescinding mandatory school funding for school-based health clinic construction, my Republican colleagues are telling the American public that our children are not worthy of prioritized care. And Mr. Chairman, I think that that's really what we're missing here in this debate. It's mandatory, Mr. Chairman, because it's a priority. Without the mandatory wording in this legislation, it is doubtful that it would be a priority. Mr. Chairman, I think that our Senate, or the Republicans centering their disagreement, their opposition to this amendment based on the mandatory nature of it, the mandatory wording in it, is a useful canard. But it's not, Mr. Chairman, relevant to the health care of these children who reside in poor areas who need school-based health clinics. I have visited the school-based health clinics in my community, in my district, and I know the function that they serve. I know that we need more and more and more of these clinics. And Mr. Chairman, as I said earlier, if you build it, they will come. They need it. They want it. It's the least that we can do is to provide a basic sense, an entry point for health care, basic health. That's what this nation should be providing for all of its citizens. And Mr. Chairman, I think that is really callous and it's cynical for those of us who care about, and if you say that you care about children's health, well, you ought to do something about it. And this is an opportunity for you to do something about it, if you really care. I yield back the balance of my time.
Chair, thanks, gentlemen. And the chair recognizes the gentleman from California for 5 minutes.
Thank you, Mr. Chairman. Mr. Chairman, I had the privilege of 10 years supervising the baseline health care services for a population of 3 million people. And this idea of mandatory automatic pilot being somehow a compassionate way of applying our services to the public just boggles my mind. There is not a mayor, county chairman, school board member that does not every year look at their budget, make priority decisions, and address the issues for their constituency as they see fit. The trouble is, in this town, it's always easy to put it on automatic pilot and then say, I can't do anything about it this year because it's already locked in. The issue is the 40% borrowing. We're spending 40% more than what we can afford to do. There's some tough decisions. And somebody was pointing out on this, and let me just say this. Be aware that we may be borrowing from China, but we are stealing from our grandchildren. Because we're not even talking about repaying our grandchildren's, the debt we have to our grandchildren. We're talking about just running up the bill, and when the bill comes due, does anybody on either side of this aisle think that the health care provided to our grandchildren and our great-grandchildren is not going to be impacted? Do you really think that when we have to pay the piper, our grandchildren have to pay the piper, do you really think they're going to look back to us and say, thank God Grandpa did all of these great things and dropped this bill in our lap, where my children now, our great-grandchildren, aren't going to be able to get the services because all the money is going overseas to pay the interest on the debt. So I think we need to be aware of that there is limits. Like any good chairman, any mayor, any hospital knows, you've got to live within the fiscal realities, or you're not doing anyone a service by overpromising what you can't afford and trying to over-triage what is able to be delivered. And if the minimum should be that Congress executes its responsibility and looks at these expenditures just like every mayor, every school board member does, and make those priority decisions where the American people can see them made, see us vote, see us make those priorities, and then live with the repercussions every year, not put it on automatic pilot. So we can send this thing off like some ballistic missile and then run for cover whenever it hits and the financial disaster come in. So I think that we've got to be responsible about this, and it's not being cruel to be fiscally responsible.
Would the gentleman yield?
I'll just yield to the gentleman.
Mr. Chairman, all the speakers on the other side, they've always brought up this issue of the Chinese and the debt to the Chinese. And I just hope and I pray that the Chinese aren't.
Sir, I will reclaim my time on this. I know we all talk about independence. We want our children to work. We want people to be to work. I just want to make sure my grandchildren aren't working for foreign nationals to pay a debt that we ran up. And let me just say, one thing I'd like to raise as we talk about these health clinics, you know, some of us have provided this in certain parts of the country, and everybody comes with a different experience. I went to schools where there was many foreign nationals going to school in my public schools that I went to that were not American, did not live in America. And don't assume that just because somebody is going to school in the United States that they qualify for health benefits across the board. That's an assumption you make, but it's not one that's reflected in reality in many communities in this country.
Will the gentleman yield?
I'll yield to the gentleman.
I just want to make a note that the Chinese provide health care for their schools.
Excuse me. The Chinese provide. I'm sorry. I don't think anyone wants to use the Chinese. You're claiming my time.
Well, you use them.
Look, I just ask all of us to remember that what we do here today is setting an example our grandchildren have to live with.
The gentleman controls the time.
Thank you. Mr. Chairman, I just want to say thank you for the time, but I think that the one thing we've got to agree again and again, that it is not humane to spend more than our grandchildren can afford to where their health care is going to be degraded because we basically committed more funds than was affordable, and they had to make the cuts that we weren't brave enough to do. And I yield back.
Chair, thanks.
I yield to the doctor, please.
And
I just
for what
point out that
the ranking members, the gentleman's recognized for.
Thank you, Mr. Chairman. You know, I don't want to prolong it, but I listened to what the gentleman from California said. I mean, there's this committee in Democrat, Republican majority, whoever's in the majority over the years, we can just list and go on and on about all the mandatory spending. Bottom line is you don't want to do mandatory spending for things that you don't like, and you do want to do mandatory spending for things that you like. That's what it really comes down to. And I can't stress over and over again, you know, if you don't have the school-based clinic, then, you know, the kids are going to get sick. They're not going to get primary care. They're going to end up in the hospital, in the emergency room. It's going to cost you more. Same thing could be said for, you know, the immigration status of whoever it is. I mean, you know, I think every state, most states certainly, have a requirement that you can't turn somebody away from the emergency room regardless of their status. So what's the point of, again, arguing over this? Because, again, it's a form of prevention. And I know somebody on the other side is going to say, oh, prevention doesn't work or prevention isn't the issue. But it is the issue. I started out today when this bill first came up, and I'll quote again, patients seen at school-based health centers cost an average of $30.40 less than comparable non-school-based health center patients. We save money because the kids get primary care. They don't end up getting sick. They don't end up in the emergency room. That's what this is all about. It saves money. So you could talk about the debt all you want, and I will come back and say, fine, we're going to save money so there'll be less debt. And it's just a question of, you know, in this case in particular, where we have this amendment with Mr. Rush, where the way I understand the amendment, he's saying that we're definitely going to provide the funding if it's an economically disadvantaged area or a health professional shortage area. I mean, again, this is where the greatest need is for these kinds of school-based clinics, because these people have no primary care and they're just going to get sick, and then they're going to end up in an emergency room again. So I just think it's a very it's a spurious argument that's being used here. I yield back, Mr. Chairman.
Chair, thanks, gentlemen, and recognize the gentlelady from Tennessee for 5 minutes.
Thank you, Mr. Chairman. It's always such an interesting argument for me to sit here, and I would remind my colleagues that as we have worked on this public option health care issue, there is no test case There is not one program where you have ever spent and taken on near-term expenses in order to receive long-term savings where it has worked out that way. Anytime you incentivize use, the cost is going to go up. And as many different ways as you try to slice it, as many different arguments as you try to make, the bottom line is still this. Public option health care and programs like we have had in Tennessee, TennCare, are too expensive to afford. In our state, the program eventually was 35.3% of the budget, and our Democrat governor decided that it had to be reshaped. This is something that we cannot afford to do. You do not see more individuals receiving health care because even though they have access to the queue, at the end of the day, the money is not there to pay for the services that they are seeking to use. And with that, I yield the balance of my time to the gentleman from Texas, Mr. Burgess.
I thank the gentlelady for yielding. This, I feel like I have to point out that there is no established link between an economically distressed area and the lack of a school-based health center. I'm sure it does occur, but I'm sure there are also economically distressed areas that have a plethora of school-based health centers. But one of the great ironies of what we're debating here, the school-based health center will be built with mandatory funding, but the staffing is with discretionary funding, and the president has zeroed out that line item in the 2012 budget. So it's a health profession shortage area. They're already lacking in professionals. How are you going to entice them to work without paying them? We've got this thing exactly backwards, and this is the reason that this amendment needs to be defeated and the underlying bill supported.
Would the gentleman yield?
I'll be happy to yield.
Yeah, I mean, but in reality, we talk all about the health care. This really, in reality, is not a proposal for health care. It's a construction project. You build a building, you employ people to build a building, and then you walk away from the building. The health care, the building doesn't provide the health care. And so it really needs to be reflected in reality. The structure is what's being mandated, not the service. And the concept that you will, if you build it, they will come, obviously is not reflected by a lot of facilities we've seen in this country.
Would the gentleman yield? I don't know whose time it is.
The gentlelady controls the time.
Gentlewoman, yield.
I had yielded the balance of my time to Mr. Burgess, and no, I am not going to yield to the gentleman. I think that in what we have to keep our eye on here is you can build all sorts of buildings, you can name all sorts of programs, but if there is a shortage, if you do not have enough physicians available to deliver the care, individuals end up with access to the queue. They do not end up with access to that care delivery, and you still have a problem. We saw this in Tennessee and had to take some drastic steps in order to address it. And with that, Mr. Chairman, I yield back the balance of my time.
Is there further discussion of the amendment?
Mr. Chairman, and I
for what purposes, gentlemen, seek recognition?
Back the last word.
The gentleman recognized for 5 minutes.
I promise not to use the time, but I have to comment here that, sometimes something looks good and look like you might be saving, but you're not saving. The point is that these young people, in many instances, are going to end up in the emergency room. Well, it's a known fact that it costs a whole lot more to treat a person in the emergency room. And, of course, we get away from the whole issue of prevention. And the other thing I think we need to recognize that if a young person has a problem or a temperature, whatever it might be, that mother is not going to go to work. She's going to keep that child home. But if there's a health clinic, the school-based health clinic, then she could take the young person to the health clinic knowing that that person is going to be taken care of and they will be in touch with her if she needs to come back. So the point is that because you think you're saving, you look like you're not really saving. The business community in that case, they lose out in terms of the person's working that day. All of these issues should be taken into consideration. And I'm afraid that we're just doing something here and not really looking at the bottom line. And I think that we should look at the bottom line. Nobody wants this. I want to save money too. Don't think you're the only one that want to save money. I keep hearing this, the deficit. And look, we all are concerned about the deficit, but we're also concerned about lives. The only person that I know that should be supporting this is the undertakers.
Gentleman yields back. Is there further discussion on the amendment? If there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. All those opposed, no. No. The nays have it. The amendment's not agreed to. The gentleman requests a recorded vote. The clerk will call the roll.
Mr. Barton. Mr. Barton, no. Mr. Stearns. Mr. Whitfield. Mr. Whitfield, no. Mr. Shimkus. Mr. Shimkus, no. Mr. Pitts.
No.
Mr. Pitts, no. Mrs. Bono Mack. Mr. Walden. Mr. Walden, no. Mr. Terry. Mr. Terry, no. Mr. Rogers. Mr. Rogers, no. Mrs. Myrick. Mr. Sullivan. Mr. Sullivan, no. Mr. Murphy. Mr. Burgess. Mr. Burgess, no. Mrs. Blackburn. Mrs. Blackburn, no. Mr. Bilbray.
Mr. Bilbray.
Mr. Bilbray, no. Mr. Bass. Mr. Gingrey. Mr. Gingrey, no. Mr. Scalise. Mr. Scalise, no. Mr. Latta. Mr. Latta, no. Mrs. McMorris Rogers. Mrs. McMorris Rogers, no. Mr. Harper. Mr. Harper, no. Mr. Lance. Mr. Lance, no. Mr. Cassidy. Mr. Cassidy, no. Mr. Guthrie. Mr. Guthrie, no. Mr. Olson. Mr. Olson, no. Mr. McKinley. Mr. Gardner. Mr. Gardner, no. Mr. Pompeo. Mr. Pompeo, no. Mr. Kinzinger. Mr. Kinzinger, no. Mr. Griffith. Mr. Griffith, no. Mr. Waxman. Mr. Dingle. Mr. Markey. Mr. Towns. Mr. Towns, aye. Mr. Pallone. Mr. Pallone, aye. Mr. Rush. Mr. Rush, aye. Ms. Eshu. Ms. Eshu, aye. Mr. Engel. Mr. Green. Mr. Green, aye. Ms. DeGette. Ms. DeGette, aye. Mrs. Capps. Mrs. Capps, aye. Mr. Doyle. Ms. Schakowsky. Mr. Gonzalez. Mr. Inslee. Mr. Inslee, aye. Ms. Baldwin. Ms. Baldwin, aye. Mr. Ross. Mr. Ross, aye. Mr. Weiner. Mr. Matheson. Mr. Matheson, aye. Mr. Butterfield. Mr. Butterfield, aye. Mr. Barrow. Mr. Barrow, aye. Ms. Matsui. Ms. Matsui, aye. Ms. Christensen. Ms. Christensen, aye. Gentlelady is not recorded. Ms. Schakowsky, aye.
Are there other members wishing to be recorded? Mr. Stearns?
Mr. Stearns, no.
Dr. Murphy? Mr. Bass?
Murphy, no.
Mr. Bass?
Bass, no.
The clerk will report the result.
Yeah.
You want this before the next one?
Yeah, we're right back.
Okay, just a second. Yeah.
Mr. Chairman, on that, there were 16 ayes, 27 nays.
The amendment's not agreed to. The ranking member is recognized.
Mr. Chairman, pursuant to House Rule 11, Clause 2.1, I request that all members have the requisite time to file supplemental minority or additional views to the bills considered at today's markup. I guess that would be for all the bills today, Mr. Chairman.
Without objection, so ordered. Are there any other amendments? All right. If there is no further discussion, the question now occurs on favorably reporting the bill. All those in favor say aye. Aye. All those opposed say no. The ayes
Request
have
a
it.
roll call, Mr. Chairman.
The clerk will call the roll.
Mr. Barton.
Reporting the vote. Supporting the bill.
Mr. Barton, aye. Mr. Stearns? Mr. Stearns, aye. Mr. Whitfield? Mr. Whitfield, aye. Mr. Shimkus? Mr. Shimkus, aye. Mr. Pitts?
Aye.
Mr. Pitts, aye. Mrs. Bono Mack? Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mr. Sullivan? Mr. Sullivan, aye. Mr. Murphy? Mr. Burgess? Mr. Burgess, aye. Mrs. Blackburn? Mrs. Blackburn, aye. Mr. Bilbray? Mr. Bilbray, aye. Mr. Bass? Mr. Bass, aye. Mr. Gingrey? Mr. Gingrey, aye. Mr. Scalise? Mr. Scalise, aye. Mr. Latta? Mr. Latta, aye. Mrs. McMorris Rogers? Mrs. McMorris Rogers, aye. Mr. Harper? Mr. Harper, aye. Mr. Lance? Mr. Lance, aye. Mr. Cassidy? Mr. Cassidy, aye. Mr. Guthrie? Mr. Guthrie, aye. Mr. Olson? Mr. Olson, aye. Mr. McKinley? Mr. Gardner? Mr. Gardner, aye. Mr. Pompeo? Mr. Pompeo, aye. Mr. Kinzinger? Mr. Kinzinger, aye. Mr. Griffith? Mr. Griffith, aye. Mr. Waxman? Mr. Dingle? Mr. Markey? Mr. Towns? Mr. Towns, no. Mr. Pallone? Mr. Pallone, no. Mr. Rush? Ms. Eshu? Ms. Eshu, no. Mr. Engel? Mr. Green? Mr. Green, no. Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Weiner? Mr. Matheson? Mr. Matheson, no. Mr. Butterfield? Mr. Butterfield, no. Mr. Barrow? Mr. Barrow, no. Ms. Matsui? Ms. Matsui, no. Ms. Christensen? Ms. Christensen, no.
Are there any other members wishing to be recorded? Dr. Murphy?
Mr. Murphy, aye.
Mr. Ross?
Mr. Ross? Mr. Ross, no.
Clerk will report the result.
Mr. Chairman, on that, there were 27 ayes, 15 nays.
The ayes have it, and the bill is reported favorably. The chair calls up H.R. 1217 and asks the clerk to report.
H.R. 1217.
Without objection, the first reading of the bill is dispensed with. So ordered. The chair recognizes himself for 5 minutes. Section 4002 of PPACA establishes a Prevention and Public Health Fund, and H.R. 1217 would repeal this section. The section authorizes the appropriations of and appropriates to the fund from the Treasury the following amounts: $500 million for fiscal year 2010, $750 million for 2011, $1 billion for 2012, $1.25 billion for 2013, $1.5 billion for 2014, and for fiscal year 2015 and every fiscal year thereafter, $2 billion. The Secretary of Health and Human Services has the full authority to use this account to fund any programs or activities under the Public Health Service Act that she chooses, without congressional input, approval, or oversight. On June 18, 2010, HHS announced $250 million in prevention and public health fund dollars would go, quote, to support prevention activities and develop the nation's public health infrastructure, end quote. On September 27, 2010, HHS announced another $320 million in grants from the fund to, quote, expand the primary care workforce, end quote. On February 9, 2011, HHS announced an additional $750 million from the fund for various prevention activities, including preventing tobacco use, obesity, heart disease, stroke, and other diseases, and increasing immunizations. The goals of these three disbursements from the fund are laudable, and there's no doubt that we must focus on preventing disease rather than simply treating people once they become ill. But we must remember that this funding is over and above the amount that Congress has already decided should go to these activities and the amount that Congress has already appropriated for these activities. When Secretary Sebelius testified before the subcommittee, I asked her whether she needed further congressional approval to spend the money from Section 4002 fund, and she answered no. I then asked her if she could fund activities above and beyond the level Congress appropriated, and she stated yes. This should concern every member that we have created a slush fund that the Secretary can spend from without any congressional oversight or approval. No one here can tell us what this funding will be used for next year, or 5, 10, 20, or 50 years from now, and this fund exists in perpetuity. My friends on the other side of the aisle bring up potential uses for this funding, like workforce development. There's no doubt that we're facing a provider shortage, especially in primary care and nursing. But there is no guarantee that the Secretary will choose to fund workforce development with this money. Also, the priorities of the next Secretary may be very different from those of Secretary Sebelius, and that Secretary will also have complete discretion over the fund. We can't predict how the money will be spent, and worse, we can't even influence it. I would suggest that if you wanted more funding to go towards training more doctors and nurses, the health care law should have contained a section explicitly authorizing that funding. If you're hoping that the Secretary will use the fund to finance smoking prevention and cessation programs, or if you're hoping that money will be spent on obesity or disease prevention, and there's nothing wrong with any of these purposes, you must realize that you are not guaranteed a dime. A direct authorization should have been written into the law. By eliminating this fund, we are not cutting any specific program or activity, because we have no idea what programs or activities will receive this funding. I'm not against prevention and wellness. That is not what this is about, despite what some of my colleagues on the other side of the aisle will say. This is about reclaiming our oversight role of how federal tax dollars should be used. I urge support for my bill, H.R. 1217. And at this point, for what purposes, gentlemen?
Strike the last word.
The chair recognizes the gentleman for 5 minutes.
Mr. Chairman, since the Affordable Care Act was enacted, every state has benefited from the Prevention and Wellness Fund. This year, over $750 million in grants were dispersed, building on a $500 million investment last year. And repealing this program would mean putting the brakes on investments that are already beginning to make a difference. Now, you said, how can the money be spent? Well, I'll use my own state, in New Jersey. Many of my constituents have benefited, and I should also say, add Congressman Lance, have benefited from over $15 million in prevention and public health grants for HIV prevention, tobacco cessation, mental health care, critical public health infrastructure improvements, as well as support for primary care training and workforce development. Those are all examples. You asked how the money can be spent. In your own state, in your state, Chairman Pitts and Representative Murphy's home state of Pennsylvania, there have been $22.5 million in grants dispersed through the Prevention and Public Health Fund. Everything, again, from community and clinical prevention, public health infrastructure, workforce development, the list goes on. Now, you also asked, Mr. Chairman, or suggested that Congress doesn't have any control over the fund. Contrary to what our Republicans have suggested, the mandatory spending nature of the fund does not disempower appropriators if Congress does its job in a timely fashion. Under Section 4002D of the Affordable Care Act, House and Senate Appropriations Committees have the explicit authority to allocate the fund at their discretion through the appropriations process. In fact, the Senate and the House appropriators attempted to allocate the 2011 omnibus bill, under the 2011 omnibus bill, but that legislation was ultimately not enacted. And only under circumstances such as this, when Congress fails to pass a labor, health, and human services, education, and related agencies appropriations bill, does the Secretary of HHS have the authority to allocate the prevention fund. So, in fact, Congress should allocate the fund. Congress has the authority to allocate the fund. The Secretary only does it if the Congress doesn't act. Now, I want to just use my last 2.5 minutes talking about how prevention saves money, because I really think that part of the problem on the other side of the aisle is a lot of my Republican colleagues really don't think that prevention saves money. And it's simply not true. It does save money. It's true that it's one of the prevention fund is one of the most cost-effective uses of our health care dollars. 75% of the $2 trillion in health care costs are spent on treatment of chronic diseases, many of which can be prevented. Obesity alone costs us $147 billion each year. Chronic diseases cost an additional $1 trillion each year in lost productivity. It's not surprising that prevention can save money. It's truly bending the cost curve. According to researchers at the New York Academy of Medicine, an investment of $10 per person per year in proven community-based interventions to increase physical activity, improve nutrition, and prevent smoking can save the country more than $16 billion each year. That's a return of $5.60 for every dollar invested. The Urban Institute estimates that certain proven community-based diabetes prevention programs can save as much as $191 billion over 10 years. Many immunizations save money. According to the CDC, for every dollar spent on diphtheria, tetanus, pertussis vaccine, we save $27. Other vaccines save between $5 and $26. Childhood injury prevention saves money. According to the Pacific Institute for Research and Evaluation, for every $46 spent on child safety seats, we save $900 in medical costs. Now, I know I really think that part of the problem here is that many of my Republican colleagues don't believe that prevention saves money. We're trying to save money here. That's what this is all about. My friends on the other side can say as often as they want that prevention isn't going to save money. In fact, it does. It's the most effective way to use our health care dollars. And it just, to me, it's just so strange that you want to eliminate this prevention fund, because I don't think there's anything that we could have done in this health care reform or the Affordable Care Act that does more to save money, save lives, prolong lives, increase productivity, all the positive things that I think all of us feel very strongly about. And I just think it's very sad that, you know, we focused on this as one of the 5 bills today, because this is something that I think all of us should support, and therefore I do oppose the amendment. I mean the bill that's before us.
Chair, thanks to gentlemen. Are there any amendments to the bill? The gentlelady from California, Ms. Matsui, is recognized to offer an amendment.
Thank you, Mr. Chairman. Mr. Chairman, I'm adamantly...
The clerk will report the amendment.
Ahead of myself.
An amendment offered by Ms. Matsui.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. I am adamantly opposed to this legislation. This bill would prevent much needed and long overdue guaranteed funding to bolster primary and preventive care in this country. We spent $2.5 trillion, that's trillion with a T, on health care as a country in 2009. 70% of that was spent on managing chronic conditions and to treat preventable diseases. Yet, we spend only 3 cents on prevention for every health care dollar spent. Federal funding for prevention has been erratic, which means that prevention priorities often go unfunded on an annual basis. That is why this dedicated funding is so important to the future health of our country. The Affordable Care Act refocuses much of our health system on the delivery of care to prevent disease and promote healthier living through incentives for patients to utilize primary care as opposed to treating people until after they get sick. By refocusing on disease prevention as a health reform law does, our healthcare system will be more effective for patients, more efficient for providers, and more affordable for Americans. This fund will invest at the state, local, and community level in effective prevention efforts such as childhood obesity prevention, tobacco cessation, and cancer awareness. Chronic diseases like cancer account for 7 in 10 deaths in this country. The costs associated with treating people with chronic diseases in California reached nearly $27 billion recently. Many of these cases could have potentially been prevented or managed better had adequate primary care programs and funding been in place. California has received over $40 million in grants from the Prevention and Public Health Fund to enhance the public health infrastructure, expand the primary care workforce, and to bolster community prevention programs such as cancer awareness and tobacco cessation. Without this funding, community cancer awareness programs may not be able to survive, given the budgetary crisis in California and difficult economic times throughout most of the states. This is troubling, as cancer rates amongst women have actually been declining in California, due in large part to increased awareness by women and increased efforts by public health officials. My amendment seeks to ensure that this decline continues. It would ensure that increased numbers of women receive cancer screenings and consultations with their doctors. Short of a cure, prevention and awareness are two of our best tools in the fight against cancer. By providing adequate funding to primary care, especially at the local level, we can help ensure that women are more aware of the risk factors and signs for cancer. I urge my colleagues to vote for this amendment. I yield back the balance of my time.
Is there further discussion on the amendment? Chair recognizes the gentleman from Illinois, Mr. Shimkus, for 5 minutes.
Thank you, Mr. Chairman. To respectfully speak out against the amendment, I think that the best way to ensure that cancer screening and testing occur is to pass a law signed by the president, and then you fight through the appropriation process. Everything that my colleague mentioned that might be funded or could be funded, we have no idea whether it will be funded, because it is at the discretion of the secretary. We have empowered her to make these decisions upward to $17.75 billion. That's why it's a slush fund. There's no intervention. There's no decision by us, the public policy. We had this debate last fall, and I mentioned it earlier, when the committee did, we brought 20 public health bills through the committee. Why? Because we were unsure whether the secretary would fund these programs. And so even though we had the health care law, we still felt, and this was when the Democrats were in the majority, that we needed to pass these provisions in law to ensure that they were done. So $17.75 billion, that means we'll borrow $7.45 billion. I mean, remember, we're borrowing 42 cents on every dollar. And the other thing about this fund is that it's $2 billion in perpetuity, which means forever. And if we don't change the fiscal position of this country, that means, and it'll probably get worse in this provision, we'll be borrowing $800 million a year approximately just to fund the Secretary's slush fund on this. Now, when H.R. 3200 was moved through the committee, which was your all bill, you addressed this issue. And in the House-passed version of the health care law, it clearly demonstrated on page 665 that the amounts in the fund would be authorized to be appropriated for carrying out various designated provisions in Division C, and would be in addition to any other amounts authorized to be appropriated for such purposes. So remember, as Dr. Burgess always says, this is the Senate bill that we had to accept on the floor that got passed and signed into law. It wasn't the House-passed version, and your House-passed version didn't have this. The House-passed version had that these things had to be authorized, which that's all we're saying. They should be authorized. We should go through the regular process. So that's why if we want to get control and not provide this, if we want to reclaim the authority of the committee, if we want to do what committees do, which is authorize, that we should not support a $17.75 billion slush fund. And I would like to yield to my colleague from Kentucky who would like to address it.
Well, thank you very much. And the comment I would make is that I'm not aware of any criteria in providing this money to grantees, as a matter of fact, and we have concrete evidence of money being spent under this fund that would raise serious questions about what good is this really doing for health care immediately. For example, one community in California, the grantee used the money to pass a city ordinance to ban any fast food restaurant. Well, in one sense, that may be good. In another sense, that prevents the creation of jobs that people may have necessary to have insurance, to provide health insurance for their children. So there's no criteria. In addition to that, in the District of Columbia, they purchased $1 million worth of blackberries so that people on a smoking cessation program could call their counselor if they felt an urge to smoke. So what kind of guidelines do we have with this fund? And with that, I would yield back my 20 seconds. And
and just reclaiming the final 17 seconds, I would say that the authorization process that we go through really helps us identify problems in the bills and change those bills, which we have done in the process. Allowing the Secretary her own discretion doesn't give us that opportunity. I yield back my time.
The gentleman's time has expired. For what purpose does the lady, Ms. Christian, seek recognition?
Strike the last word, Mr. Chairman.
Gentlelady is recognized for 5 minutes.
Thank you. And I want to speak in support of the amendment. I'm not sure that any amendment could improve on this piece of legislation, but my colleague from California probably comes as close as you could get to improving upon it. So I support the amendment. But I really don't understand why my Republican colleagues are doing this. You have supported prevention efforts in the past, efforts that empower individuals and equip them with the tools necessary to take control of their health and to make the changes necessary to lead healthier lives, helping them to take personal responsibility. And as I understand it, you've always been in favor of that. Repealing the Prevention and Public Health Fund will hurt Americans across the spectrum and set the stage for an even more unhealthy nation than we are today. I do not like being behind all of the industrialized nations and most health indicators, including infant and maternal mortality. All of us should want to save the lives of mothers and children, and this fund would be a fund that would help us to do that. But beyond improving health, it's precisely this fund that would provide the greatest savings and have the biggest impact on lowering health care costs and help to reduce the deficit that all of us are concerned about. Just as an example, one study found that investing $10 per person in a proven community-based disease prevention program could yield savings of more than $2.8 billion annually, and by 10 years, almost $18 billion. This is the kind of health care, this is the core of the health care reform effort. It's needed not only for individuals and families, but it's needed for our nations. And I just would like to add that we can't predict what might happen in the next few years. We didn't predict SARS. Just a few years ago, we were worrying about an avian flu epidemic, and we could still have that epidemic. The Secretary needs the flexibility to decide where that funding needs to go. This bill helps to protect the health of all of our constituents. It helps our country to be a healthier nation, and I strongly oppose the bill, but I will support my colleague's amendment.
Chair thanks the gentlelady and recognize the gentleman from Georgia, Dr. Gingrey, for 5 minutes.
Mr. Chairman, thank you. And I want to go back to council, and I asked council this same question last week, but I think it's appropriate to ask again since the gentleman from New Jersey touched on this subject. Council, I had previously asked whether the Congress has the power to appropriate funds absent Section 4002D of Patient Protection Affordable Care Act. You answered yes last week that Congress did, and I repeat that question. Does the Congress have the power to appropriate funds absent Section 4002D of Obamacare?
Yes.
Well, you know, some have criticized that eliminating this slush fund that's established by the Secretary of Health and Human Services, but by eliminating that, it eliminates funding for activities like prevention and obesity. And I think there's some misunderstanding of how the fund works. The fund can only be used for existing programs and is designed to be in addition to the level of funding that Congress provides. And I will note that House health care bill did contain a public health fund. However, the authors of the House bill made that fund subject to future appropriations. Even though every member of the other side claims this fund must be mandatory, not one offered an amendment to the House health bill marked up in this committee that would have converted that discretionary fund to mandatory spending at that time. Every member who supports this fund because it provides additional money for a project they deem worthy should understand that no one knows where this money will be spent. If you support increased smoking cessation programs, the only way to guarantee that that funding goes to those programs is to repeal this slush fund, as this bill calls for, and appropriate the money through the regular appropriations process. Could this be used for jungle gyms and bike paths? And the answer, as silly as that sounds, is yes. So for every program that supporters cite, there is an equal probability that the funds will be used for something entirely different with which they may very well disagree with. For that reason, I am very much opposed to the amendment, Mr. Chairman, and I yield back my time.
Gentleman yields back his time. Are there other members wishing to speak on the amendment? Lady from California is recognized for 5 minutes.
Thank you, Mr. Chairman. I do want to associate myself strongly with this amendment by our colleague, Ms. Matsui, and I do want to also speak in opposition to the underlying Bill 1217, a bill that would defund a really strategic investment into our nation's long-term health, and that is the Prevention and Public Health Fund. This fund is the critical piece to making our nation healthier, changing from a sickness-based system, very costly, actually way too costly, into a wellness-based, prevention and education-based, primary care-based healthcare system. The attempts by the leadership of this committee to repeal this a section of the healthcare law is not only misguided, but it's really foolish. Before the Affordable Care Act became law, we had numerous bipartisan discussions of how the status quo was not working. We lived in a nation, as I said, focused only on sick care and ignoring the monetary and quality of life savings that can come with prevention. And the cost to our healthcare system from preventable disease highlights the imbalance in the system as we have known it in the past. Just a few weeks ago, this committee heard from the governors of Michigan and Mississippi about the tough financial times they are facing and how Medicaid spending is impacting their budgets. One of the key drivers in these costs is preventable chronic disease, and that's what makes this bill so short-sighted. The Prevention and Public Health Fund helps defray the growth of both public and private health care costs by preventing the chronic diseases and delaying their onset that drive so much of the entitlement spending, all the while improving the lives of the people that are afflicted by it. And states and counties all over the country are realizing this. As I mentioned last week, in my home state of California, we're putting these kinds of funds to work by investing in programs to promote tobacco control, to implement tobacco cessation services and campaigns, to build up our state and local capacity to prevent and detect and respond to infectious disease outbreaks, and to take steps to slow the alarming rise in obesity rates. And there's been a big objection in this underlying legislation on prevention funds and public health funds to the fact that there is no mandate for them, that they are flexible. And I would say that's exactly the strength of the legislation, is that it gives flexibility to local jurisdictions who know exactly what effective programs are needed because they know the populations and the kind of programs that they will respond to in terms of changing behaviors. It's one of the most difficult challenges you face in any community, and to have those dictated from on high goes cross-purpose to the grassroots efforts that are springing up across this nation to deal with some of our epidemics like obesity. We're also using these funds to support and train our current and next generation of public health professionals to build our health care workforces so we can assure Americans have access to quality preventive care. And this is at a time when counties have laid off thousands of staff, struggle to maintain essential public health services through our downturn times in the recession. So the program, it becomes even more critical. It's a sound investment. Reports have shown that an investment of $10 per person per year in a proven community-based program to increase physical activity, improve nutrition, prevent smoking or other tobacco use could save the country more than $16 billion annually within 5 years. That's a return of $5 for every $1 spent, not to mention the quality of life improvements for the people who are enjoying the health benefits of this effort. That's why so many national groups, so many local governments are so opposed to this dangerous bill. So I want to join with them and urge a yes vote on the Matsui amendment and a no vote on the underlying bill, and I yield back the balance of my time.
Gentlelady yields back her time. Are there further amendments or further members wishing to speak? The gentleman is recognized for 5 minutes.
I have a question for the author. Why would not California fund this? The state of California.
Well, we do have some funding, but as you know, just like all states, we're having some difficulties in the budget. But I must say, we're talking here about this Affordable Health Care Act, which is law here, nationwide law.
Reclaiming my time. I think there's a relationship you just acknowledged about the fiscal health of a government entity and the ability to sustain even good programs. Now, maybe where we differ is that apparently if it's federal money, it's okay to borrow 43% of it. But if it's state money, you can't. And so I agree these are great programs, many of them, not all of them. But maybe our disagreement is whether or not when we go into it, we should have a plan to be able to fiscally sustain.
Would the gentleman yield?
I will.
We're talking here about health care, access to health care. We're talking about having healthier Americans. And quite frankly, I think most people here truly believe that prevention is probably the best way to do this. It's the best way to use our federal dollars in order to ensure that we have healthier Americans so they won't have the chronic diseases.
Reclaiming my time without going into the argument of the value of preventive medicine, which I strongly believe in many aspects of preventive medicine. The fact is California doesn't do it because they're in a budget crisis. You said, like many other states, don't have the money. Now, we can print money and we can borrow money, and we're borrowing it from our future generations, but it's clear that we also have budgetary problems. I guess what I don't understand is why are the federal budgetary problems different from the state budgetary problems?
Would the gentleman yield?
I will.
I appreciate your yielding to me, and perhaps because I'm also from California, I wanted to point out that, and speaking also on behalf of the local initiatives that these preventive funds are used for, in almost every case that I know of in California, it's a matching fund. And in fact, then it is a multiplying effect that the federal dollars have when they come into a community, when they're requested by the community for programs that have already been put in place.
But reclaiming my time, it's still a fundamental question. Why doesn't the local or state government pay the whole freight? Now, the fact is, if it comes from the federal government, it's considered to be free money. But it turns out it's not free money. A federal taxpayer is paying for it, or it's being borrowed. And I guess I don't see why there's a distinction drawn between indebtedness on the part of states and local governments and that of the federal liability. Is there a distinction that is any more than, well, it's federal, so it's free, as opposed to no? We should have a different standard for local, state versus federal.
Gentlemen, yield to me.
I will.
We do have federal programs because we recognize that every child in this country ought to have an opportunity for good health And that's why we have a Medicaid program with certain standards that all children be covered. The states may not be able to choose to pay for that if they did it on their own. And we have such a strong involvement in as you put it often on your side of the aisle, government takeover. Well, government's not taking over health care, but we are certainly trying to make sure that we spend less money in health care. And one of the best ways to do that is prevention. So for the federal government, there's a clear reason to spend the money. Now, we can handle that a lot better than the states. When we have a time like now where
reclaiming my time, I'm not quite sure why you can do it better than the states.
Well, I was going to give you an answer.
Reclaiming my time, if the only limiting factor for this program, as described in this amendment, is money, well then those who are closest to the situation should know where to spend it, and that would be the local or state government. And California's got a lot of wealthy people.
Gentlemen, yield.
I will.
It is harder for the people at the local level during a time of recession, particularly, to raise the money. And what we need
reclaiming my time, then, my point being, there seems to be a perception that if it's federal, it's free money. That, sure, we don't have to raise it on a federal level. We just kind of, my gosh, borrow it. And there's no harm, no foul, because it's a future generation that pays it back.
This is not, if the gentleman would yield further,
I will.
This is not money that's going to it's going to programs, not to the states to help them with their budget. These are programs.
No, but I was told, reclaiming my time, that the reason that the state isn't funding it is because the state's out of money. But apparently the federal government is not. At least that's the perception of those who advocate for this deficit spending. I'm out of time, but I appreciate the conversation. I yield back.
Gentleman's time has expired. There are further gentleman from California, Mr. Waxman, is recognized for
Thank you,
5
Mr.
minutes.
Chairman. Look, these are all very good questions, and it also becomes a recipe if we follow them to their logical extreme, that the problems can be ignored by both the federal and the state level. The state and local level have a harder time raising money. L.A. County, for example, is the healthcare system of last resort. And yet they have that requirement under California law, and they are the least able to raise the money. State's a little better off, but when everybody's having a difficult time paying for things, it really does become the burden of the federal government, which has a much greater say over the economy.
Well, the gentleman yield.
No, I'm not going to yield to you because I'm in the middle of my sentence, but I don't have to yield in the middle of a sentence until I've completed my thought. The federal government has a much better say over the economy. For example, with this recession, one of the best things we can do would be to make investments that the local governments couldn't possibly undertake, but can produce jobs. We ought to be doing a lot more infrastructure projects, because those are things that are needed throughout this country. For business to succeed, we need the infrastructure to be rebuilt. And no better time could this happen than now, when borrowing is low, the interest rates are low, and it would provide jobs. The thing that we have a disagreement on, I think, on a party line basis, is that I speak for myself, and I know many Democrats, but I don't want to be so presumptuous to speak for others, that if we make investments, it produces jobs. When people work, it produces income for them, and it produces more income for local and federal government coffers. One of the reasons why I think some of the cuts that are being proposed are so damaging is that those are cuts of people's jobs. And when they are uninsured, when they are unemployed, then it's tough for them. It's tougher on the local government. It's also tough for the federal government. I've heard many people on the other side of the aisle say, President Obama has seen in the last month a widening of the deficit. Well, of course, there's a widening of the deficit because he inherited a very deep recession, the biggest and most severe recession since the Great Depression. Well, you've got to deal with that problem, not act as if the dominant issue before us is how to cut people out of work because we're going to cut the expenditures for the jobs that they now have. We're talking about a very small amount of money to keep people healthier, and that should come from the federal government because we're better able to handle it. We can control the economy better. We can get people working faster. Hopefully we can do things that are fair and providing more just opportunities in the economic patterns of our country. That's why I think it's important that we do this at the federal level. The states and local governments will not have the ability to do it until times get better. And when times are better, states can do more things. But until we get people to work and do some of the things that are important for the future for people to get jobs and work, all these other cuts like the savaging of Medicare and Medicaid that's being proposed in the budget, I think will have a negative impact on the economy and certainly a negative impact on middle class and lower income people. Who's asking me to yield?
Cassidy over here, I'm sorry.
Yes, yield to you.
Maybe the real difference between the two sides of the aisle is I see no difference from a taxpayer writing a check to L.A. County and that same taxpayer writing a check to California, the state of California, and to the federal government. I mean, the fact is the same taxpayer just spreading it 3 different places. Now, there's again a perception that the check going to the federal government is an expandable check, that somehow there's no reason it has to be based into the income of the nation, but rather it's just free money. Now,
well, let me reclaim
lots of
my time.
wealth. I'm sorry.
Reclaiming my time, I don't agree with that. I know you stated that it's free money if it's coming from Washington, but I don't agree with that. A taxpayer, we have a broader base of federal taxpayers to do things in the federal and the national interest. We ought not to take on everything because we do have a system of government where we have local governments as well as the federal government. This is a responsibility, I believe, for the national government, especially since we're spending so much money in the health care services area. Medicaid and Medicare and other public health things come from Washington, and we ought to continue, and we'll let the states and local governments do other things, but this is already a clear responsibility, and I think we are better able to handle it.
Gentleman's time has expired. If there are no further members seeking time, I think we can vote on this amendment. All those in favor of the amendment say aye. Aye. All those opposed say no. No. Noes appear to have it. The noes have it. The amendment is not adopted. Are there further amendments to the bill? If not, the question now is on passage of H.R. 1217. All those in favor say aye. Aye. All those opposed say no.
Mr. Chairman, would ask for a roll.
Roll call is asked. The clerk will read the names.
Mr. Barton. Aye. Mr. Barton, aye. Mr. Stearns. Mr. Whitfield. Mr. Shimkus. Yes. Mr. Shimkus, aye. Mr. Pitts. Mr. Pitts, aye. Mrs. Bono Mack. Mr. Walden. Aye. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mr. Sullivan. Mr. Sullivan, aye. Mr. Murphy. Mr. Murphy, aye. Mr. Burgess. Mrs. Blackburn. Mrs. Blackburn, aye. Mr. Bilbray. Mr. Bass. Mr. Bass, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Scalise. Mr. Scalise, aye. Mr. Latta. Mr. Latta, aye. Mrs. McMorris Rogers. Mr. Harper. Mr. Harper, aye. Mr. Lance. Mr. Lance, aye. Mr. Cassidy. Mr. Cassidy, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Olson. Mr. Olson, aye. Mr. McKinley. Mr. Gardner. Mr. Gardner, aye. Mr. Pompeo. Mr. Pompeo, aye. Mr. Kinzinger. Mr. Kinzinger, aye. Mr. Griffith. Aye. Mr. Griffith, aye. Mr. Waxman. No. Mr. Waxman, no. Mr. Dingle. Mr. Markey. Mr. Towns. Mr. Pallone. Mr. Pallone, no. Mr. Rush. Ms. Eshu. Ms. Eshu, no. Mr. Engel. Mr. Green. No. Mr. Green, no. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Ross, no. Mr. Weiner. Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Barrow? Mr. Barrow, no. Ms. Matsui? Ms. Matsui, no. Ms. Christensen? Ms. Christensen, no. Mr. Upton? Mr. Upton, aye. Mr. Stearns, aye.
Matheson?
Mr. Matheson, no.
Mr. Pompeo, have you voted? Are there other members wishing to cast a vote? If not, the clerk.
Mr. Walden is recorded as aye.
Dr. Burgess?
Dr. Burgess, aye.
Are there further members? Seeing none, the clerk will count the tally. So that's the next.
This gentleman is not recorded. Mr. Bilbray, aye.
Ready.
On that, there are 26 ayes, 16 nays.
26 ayes, 16 nays. The bill H.R. 1217 is passed and adopted. So the next order of business is H.R. 1216, a bill to amend the Public Health Service Act to convert funding for graduate medical education and qualified teaching health centers from direct appropriation to an authorization. So I call that bill up and ask the clerk to report.
H.R. 1216.
Without objection, the first reading of the bill is dispensed with, so ordered, and would look to Mr. Green to offer an amendment.
I have an amendment at the desk, Mr. Chairman.
Clerk will report the title of the amendment.
Which number, Mr. Green?
Mr. Chairman, I ask unanimous consent to amendment. Oh,
which number?
Amendment number 2.
An amendment offered by Mr. Green.
The amendment is considered read, and the clerks will pass the amendment out, and the gentleman from Texas is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. The Affordable Care Act authorized and appropriated $230 million for a 5-year payment program to support accredited primary care residency training operated by community-based entities, including our community-based health centers, our FQHCs. The Teaching Health Center program supports the training of individuals who are practiced in family medicine, internal medicine, pediatrics, obstetrics, gynecology, psychiatry, general dentistry, pediatric dentistry, and geriatrics. These disciplines where we are experiencing significantly physician shortages. This training takes place in community-based settings such as our community-based health centers. Research shows that the CHC community health center trained physicians, for example, are more than twice as likely as their non-CHC trained counterparts to work in an underserved area, ensuring that this kind of training takes place, which is what mandatory spending support for the program does. It will help strengthen the primary workforce in underserved areas, particularly rural and frontier areas that are struggle to recruit and retain a sufficient workforce. I know even before the Affordable Care Act, we worked across the party lines, both on support for community-based health centers, but also support for primary care training. It's ironic that this bill, H.R. 216, would want to take away this funding. I know we worked, again, Republicans and Democrats continue to argue that there are not enough physicians now, let alone when the Affordable Care Act is fully operational, to provide care to these people in need of primary care services. This program is designed to help address this problem, and they will keep trying to have it both ways in the debate. But whether we have health care reform or not, this program repeal, I think this program is something that ought to enjoy bipartisan support. There are already 11 community-based entities from states across the country that have committed to train 44 primary care residents and will be supported by an estimated $7.6 million in funding for a full year in its first year program. And why would we want to stop this? I suspect there's no other reason than to slow down or just disrupt the full impact of affordable care. But I think this section can stand alone. The Teaching Health Centers program should continue to receive mandatory funding. It's a terrific investment and will pay off handsomely. The program will increase the ranks of primary care physicians, resulting in improved patient access to primary care and fewer patients seeking care in costlier settings like emergency departments and hospitals. Turning the program into a discretionary one will make it challenging for these 11 programs that have already been made the decision to participate in consultation with key stakeholders like teaching hospitals and their board based on an expectation they'll continued funding will be available. Converting this program to discretionary funding will also deter other entities from making those business decisions necessary to expand residency training, securing commitments from key stakeholders, and to agree to train new or additional residents. Applying for accreditation, if not already part of the eligible consortia, hiring new faculty, since funding over the next few years will be subject to the annual appropriations fight. That's why I'm offering this amendment. I think compared to the other bills that we have today, this is so important it should be considered under mandatory funding for the Teaching Health Center program under Secretary of HHS determines there is no longer any health professional shortage areas in the United States. Health professional shortage areas, HPSAs, are designated by HRSA as having shortages of primary medical care, dental, or mental health providers, and may be geographic, a county or service area, or demographic, a low-income population, or institutional, comprehensive health care, comprehensive health center, federally qualified health center, or other public entity. Medically underserved areas or populations or areas of populations designated by HRSA that have too few primary care providers, or high infant mortality, high poverty, or high elderly percentage. HPSAs may be designated as having shortage of primary medical care, dental, or mental care health providers. They may also provide for rural or urban or population groups that are medical. According to HRSA, there are 6,204 primary care health professional shortage areas with 65 million people living in them. It will take 16,643 practitioners to meet their needs in primary care. We need 4,230 dental health care service areas with 49 million people living in, and we have 3,291 mental health care professional service areas with 80 million living. I guess my point is that this should be separated because, again, I know we've enjoyed bipartisan support for community-based health centers, and we've also enjoyed bipartisan support for the need to continue medical training, particularly in the underserved areas, whether we have the current Affordable Care Act stays in existence or not. We need to ensure we have physicians so they no longer have health professional service areas. That is what the Teaching Health Center provisions intended to do. By stripping the program of mandatory funding, leave the discretion to appropriators. And again, this is a need that I think no matter what happens with the Affordable Care Act, this is something I think we probably ought to do, and I may introduce it separately as legislation if this bill goes forward. And
gentleman's time has expired.
Thank
Is
you,
there
Mr. Chairman.
further discussion on the amendment?
Mr. Chairman.
Chair recognizes Mr. Guthrie for 5 minutes.
Thank you, Mr. Chairman. I'd like to speak against the amendment. And I appreciate the opportunity that we've come together today to try to look at changing mandatory programs of the Health Care Act into appropriated programs. And I agree, and I think everyone here agrees, and I appreciate the bipartisan work that's been done before on the need for more primary care physicians in our health system, need for more health care providers in our health system. But what we're talking about is moving it from automatic mandatory funding to discretionary funding. And it's not just a set of priorities, because the nursing program, I think all of us realize that we need more nurses in our system. In the Health Care Act, there was a section for grants for nursing retention grant program, but that was discretionary and left. It was authorized and left up to the appropriators to decide. Secretary Sebelius said here in her testimony before the committee that the President's budget eliminates graduate medical education for children's hospitals, and what we're saying is that that'll go through the appropriations process, and we're asking just to go through the appropriations process as well. We're facing monumental budget constraints. For $230 million, we'll borrow $96 million at the 42 cents per dollar for this program to go forward. And I was traveling through my district just a couple of weeks ago and talking about people. Somebody mentioned earlier individuals that will be hurt by different bills that are moving forward. I talked to businesses and businessmen and women who are saying their businesses could be hurt if we don't change these not this particular program, but the bill overall. And as you showed a pie chart of 2011 spending, you look at a pie chart and you see non-defense discretionary and defense was in the discretionary side, and greater than half is in the mandatory spending, Social Security, Medicare, Medicaid, interest on the debt. And there's a subject on the pie chart called other mandatory spending, and it's over $400 billion. And all we're saying is we need the opportunity for our Appropriations Committee, if it's an annual basis, that's been before. I know there are other things in the discretionary side that people say we'd like to have it mandatory because it's longer and you can plan better. But we have an annual appropriations process, and all we're saying, like the nurses are going to have to do, the rural health services is authorized at $45 million. It should be fully funded, but we're creating a new program that's mandatory, takes the discretion away from the appropriators, and so I oppose the amendment and I support the bill. I yield back.
Sure. Thanks, gentlemen. Recognize gentleman from New Jersey, Mr. Plone.
I'm not going to use the whole time, but I just wanted to say, following up on Mr. Green, I know that Mr. Green has been a long-time supporter of community health centers and the authorization bill for the community health centers in previous Congress. But what he said, and I listened to it carefully, is that, you know, when you're trying to train residents, whether it be doctors, nurses, others for primary care, it takes a while for those people to be trained, and they need to have the certainty that the dollars are there to perform that function. And that's why when we train medical residents with the Medicare GME funding, since its inception in 1965, it's been funded using Medicare Trust Fund dollars, and it was mandatory spending because teaching health centers were had to have the stability, if you will, of the Medicare GME. So what we've done here is very similar. Residents aren't trained in a short period of time. It takes years. So in the same way that we use the Medicare GME, we're trying to do the same thing here with those who are trained in the community setting. And we know that if people are trained in a community setting, they're more likely to continue on when they graduate, and their physicians to stay in the community center situation. So I just think that for the Republicans to say they want to take away this funding, and make it discretionary, well, why is it any different from what we do under Medicare GME? I don't see any difference. Bottom line is you have to have some kind of stability, and you're only going to have that if you have the mandatory funding. So as Mr. Green said, this is a perfect example of why you need mandatory funding rather than the discretionary funding. It makes perfect sense in this context. And I would yield back.
Sure. Thanks, gentlemen. Is there further discussion? The gentlelady from California is recognized for 5 minutes.
Thank you, Mr. Chairman. I want to speak in support of Mr. Green's amendment. And in opposition to H.R. 1216, the critical medical education program in our community, the Teaching Health Centers program, this is a classic example of cutting our nose to spite our face in this committee. In our all-out assault to repeal and defund, the program that would normally have bipartisan support fulfills the need of each of our congressional districts is caught in a political crossfire. Can't count the number of times we've sat here talking about shortages in primary care workforce, underserved areas, and often working in a bipartisan way to think of ways to increase our primary care ranks. And that's one of the reasons that I'm can't help but speak now, even though we've been at this markup for a very long time today. I want to just mention that one of the big obstacles to delivering primary health care in this country is the expense of education and the reward of going into specialty by becoming a resident, which entices people in medical school to continue on with their education because of their huge bills. And so much of the part of our health care new law is allowing scholarships and loan forgiveness programs so that people can go into primary care and underserved communities. Having the community-based health centers provides an opportunity for culturally appropriate centers to train and educate people in those things that they're skilled to do. These programs expand primary care services to the very people who need them most, and trains new providers with expertise needed to serve these population. Here we're going to defund these programs. There are already 11 community-based entities from states across the country already committed to training primary care residents and expanding their programs to do so. They're ready to go. Just last week in this subcommittee, members on the other side of the aisle warned of a shortage of medical professionals and that the Affordable Care Act would permit too many Americans access to primary care, and we don't have enough providers. Well, this is the exact part of the legislation that allows for the training of people to do this kind of work. So we have to make a choice here. Defunding the teaching healthcare centers would only occur under this amendment once we eliminate the shortage areas in our nation. That makes sense to me. We know we have a need for the centers now and for the funding for them. So let's take care of the underfunding, underprepared field that we have, and then when that reaches its maximum and we no longer have people waiting in line, then we can cease to fund this program. And with that, I want to yield the balance of my time to the author of the legislation, Mr. Green, the amendment.
Thank you, and thank my California colleague. Let me just ask you to wait a minute and let's talk about it, because this is part of the Affordable Care Act, and I know my Republican colleagues want just to eliminate it all, but this is actually passed on a voice vote, this program, because just like my colleague from New Jersey said, Medicare has graduate medical education that's mandatory, and if we're going to ever get a handle on how we can serve the underserved in our country, federally qualified health centers are the solution. I know I share that with a lot of my Republican colleagues. We've worked for years to try and expand them. President Bush, every year, up his budget for federally qualified health centers. So it's something we do enjoy across party lines. But the whole goal is to get those healthcare professionals in that underserved area. Most of the district I represent is underserved. I have physicians, though, who practice in my area, and they support our expansion of our FQHCs so much because they don't have enough time in their day to see the people who show up at their offices. So it's the medical community actually supports it, and that's why the mandatory is needed, so we will have a continuity so they will know that over a period of 3 years and a fellowship you will actually have, and the success of the program shows that they will come back into these harder to serve communities instead of the regular graduate if they are in these FQHCs. And that's why it's so important. And again, federally qualified health centers, community centers has enjoyed bipartisan support no matter who's in charge and no matter who's the president. And this just adds to that. And I can't say too much that it was passed in our committee in one of our late night votes on a voice vote because of support on both sides of the aisle. So that's why I'm disappointed to see this here, because it's one of the great things that we did in there in the in the Affordable Care Act. And with that, Mr. Chairman, I yield back my time.
Is there further discussion on the amendment? The gentlelady, Ms. Christensen, is recognized for 5 minutes on the amendment.
Thank you, and I won't take all of the 5 minutes. I also wanted to speak in support of the amendment and against the bill itself. I think, like several of the other amendments that have been offered, this is a really good approach. It makes no sense to stop the training while there's still health professional shortage areas. We've heard over and over again today that we need more providers. This amendment ensures that we keep the funding to train those providers. And it is true that the centers, those 11 centers and any other centers that are going to participate in this program need certainty. They can't depend on a year-to-year appropriation. Yes, we need nurses, but we need all the providers, community health workers, physician assistants, dentists, and doctors. In my training, I had the opportunity to do part of it in a community health center. I think it made me a better physician. And so I just want to, again, support this amendment and oppose the underlying bill.
Chair, thanks.
Yes, I'll yield to my colleague from New York.
I appreciate the gentlelady yielding, and I see that Chairman Emeritus Barton is here, and perhaps he or the chair can address this issue. You know, all of the portraits that are around this room, including Mr. Barton's, represent an ethos in the Energy and Commerce Committee that maybe transcends all political lines. And that is the idea that we wanted to always claim as much jurisdiction for ourselves as we could. You know, it's kind of like, you know, you guys are our opponents, the Senate is our enemy, the other committees I don't know how to extend the metaphor further than that. And here we are, we pass a bill, and like it or dislike it, it gives us the authority over this bill. Now, there's a series of bills that I'm seeing today, Mr. Barton, which say, let's give the appropriators more authority over legislation that we wrote in this committee. It seems wildly counterintuitive. We used to be a committee that we would proudly join shoulder to shoulder to fight for the jurisdiction you had. It says, you know what, we really can't be trusted with this. Let's give it to the Appropriation Committee. I want to tell you something. That's not a, it's not exactly the Nobel Committee over there in that panel. I'm not sure that they can do that much of a better job than we could. We wrote the bill here. It's in our jurisdiction. Let's keep it in our jurisdiction. Why are we suddenly issue a series of bills saying, oh, we don't trust ourselves to do this. Let's give it to the annual appropriation process. I just don't think that that should be where we go. And whether it's a Democrat in that chair or a Republican in that chair, I would hope that one of the things that we join together to do is make sure the jurisdiction of this committee is as big and powerful as possible. And here we are this afternoon. It's been a pretty bad day. A lot of these guys who are up on these walls, and some of them that I have the good fortune to know, and a couple of them that still work here, every single day we get together and huddle in a bipartisan way to fend off efforts by other committees to take our jurisdiction, and now we're willingly giving it away. This is a pretty dark day in this committee, and I hope that it doesn't reflect a new kind of roll over and rub our belly mentality here in the Energy and Commerce Committee. This used to be the Fighting Energy and Commerce Committee when Mr. Barton was the chair.
Would the gentleman yield?
I certainly will.
You wondered how long you'd egg me on before I took the bait.
You lasted longer than I thought, Mr. Barton.
It's almost 5 o'clock. It's 5 o'clock somewhere. Let's. Actually, the Republican portraits up here believe that this is an authorizing committee, and we would authorize programs and then send them to the appropriators to fund at the authorized levels. And that's what this bill is doing. It's converting a mandatory spending program to an authorized program. So with no disrespect to my friend from New York's metaphor, we never claimed to be an appropriation committee. Now, I will say in the last Congress, or perhaps the Congress before that, I think it was when Mr. Dingell was chairman, we did try to become the Ways and Means Committee, too, in one of the health care bills.
True. And if we're reclaiming my time, Mr. Barton, where have you gone, Joe DiMaggio? Look at us now. We're a mere authorizing committee. We are not. We are the Energy and...
I didn't say mere.
We are the Energy and Commerce...
We are the authorizing committee.
Somewhere next door there's a picture of the Earth photographed from the moon. That's our jurisdiction, Mr. Chairman.
Which is only half of the Earth.
That's this committee. There is nothing that's not in our jurisdiction, and we may give up jurisdiction from time to time, but we do so fighting. We don't do so willingly. We are no mere authorizing committee. We are like no other committee in this body. And I have to tell you something. You built that proud tradition. This is not a proud day when we start characterizing so we're just an authorization. We're just a little old authorization. No, we are not. We are the Energy and Commerce Committee.
I didn't use the term little.
We are not going to yield jurisdiction. Anyway, we may lose this vote, but we're not going to stop fighting. I want to tell you that right now.
Mr. Chairman, gentleman yields.
Gentleman's time has expired.
Anthony,
is there further discussion of the amendment? If there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. All those opposed, no. No. The nays have it, and the amendment's not agreed to. The ranking member requests a recorded vote. The clerk will call a roll.
Mr. Barton? No. Mr. Barton, no. Mr. Stearns? No. Mr. Stearns, no. Mr. Whitfield? No. Mr. Whitfield, no. Mr. Shimkus? Mr. Pitts?
No.
Mr. Pitts, no. Mrs. Bono Mack? Mr. Walden? No. Mr. Walden, no. Mr. Terry? Mr. Terry, no. Mr. Rogers? No. Mr. Rogers, no. Mrs. Myrick? Mr. Sullivan? Nope. Mr. Murphy? Mr. Burgess? Mrs. Blackburn? Mr. Bilbray? Mr. Bilbray, no. Mr. Bass? Mr. Bass, no. Mr. Gingrey? Mr. Gingrey, no. Mr. Scalise? Mr. Wada? Mr. Wada, no. Mrs. McMorris Rogers? Mr. Harper? Mr. Harper, no. Mr. Lance? Mr. Lance, no. Mr. Cassidy? Mr. Cassidy, no. Mr. Guthrie? Mr. Guthrie, no. Mr. Olson? Mr. Olson, no. Mr. McKinley? Mr. Gardner? Mr. Gardner, no. Mr. Pompeo? Mr. Kinzinger? Mr. Kinzinger, no. Mr. Griffith? Mr. Griffith, no. Mr. Waxman? Mr. Dingle? Mr. Markey? Mr. Towns? Mr. Pallone? Mr. Pallone, aye. Mr. Rush? Ms. Eshu? Ms. Eshu, aye. Mr. Engel? Mr. Green? Mr. Green, aye. Ms. DeGette? Ms. DeGette, aye. Mrs. Capps? Mrs. Capps, aye. Mr. Doyle? Ms. Schakowsky? Mr. Gonzalez? Mr. Inslee? Mr. Inslee, aye. Ms. Baldwin? Ms. Baldwin, aye. Mr. Ross? Mr. Ross, aye. Mr. Weiner? Mr. Weiner, aye. Mr. Matheson? Mr. Matheson, aye. Mr. Butterfield? Mr. Butterfield, aye. Mr. Barrow? Mr. Barrow, aye. Ms. Matsui? Ms. Matsui, aye. Ms. Christensen? Ms. Christensen, aye. Mr. Upton? Mr. Upton, no.
Ms. Kathy McMorris Rogers.
Oh, Ms. McMorris Rogers, no.
Dr. Burgess.
Dr. Burgess, no.
Ms. Blackburn.
Ms. Blackburn, no.
Any other members wishing to be recorded?
Mr. Scalise? No. Mr. Scalise, no.
Clerk will report the result.
You know, I didn't count Pompeo. Sorry, I wrote on Pompeo. Mr. Chairman, on that there are 14 ayes, 25 nays.
The amendment is not agreed to. Are there any further amendments? Gentlelady, Ms. Matsui has an amendment. The clerk.
An amendment offered by Ms. Matsui.
The gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. H.R. 1216 will put the future of the primary care workforce into question. The Affordable Care Act, or current law, provides a historic investment in primary care. As we have heard already today, primary care has long been neglected in this country. However, refocusing on the importance of primary care is critical. It will turn our delivery system from one of sick care to one that focuses on keeping people healthy. One of the barriers to providing better primary care is a lack of primary care providers. The law which this bill tries to chip away at would help train, develop, and place 16,000 new primary care providers. That means 16,000 more primary care doctors to children, teenagers, young adults, and seniors. That, coupled with the important insurance market reforms in the Affordable Care Act, will mean that primary care is a focal point rather than an afterthought for patients of all ages. This means that Americans will have better access to ongoing care. Studies strongly associate healthier outcomes with regular access to care. Ensuring that regular source of care is a primary care provider and not the emergency room is critical to not only providing quality and coordinated care, but also helping to keep costs down for patients and the system in general. Having a primary care provider as a usual source of care will increase the likelihood of appropriate care and act as a trusted health counsel that will help better coordinate care to ensure that complications do not arise, something that is sadly lacking in far too many seniors' lives. And that is what my amendment works to ensure, that all Americans have a source of ongoing care, especially those over the age of 65. However, without this funding, without this investment, We will likely continue to see a decrease in the number of medical students interested in primary care. This will further exacerbate the growing shortage of primary care providers in our country. This will in turn further continue the sick care model as opposed to working to keep people healthy. This is something of which I'm immensely concerned. I recently held a roundtable discussion with a group of University of California at Davis medical students who are seeking careers in primary care. I was elated to hear of their enthusiasm for not only primary care, but also the new incentives in current law for primary care providers. However, as I said a moment ago, should this funding come into question, we threaten the future of primary care in our country and the futures of these medical students seeking a career in primary care. Primary care, as a main ongoing source of care, is critical to a healthier America. For seniors, it means a trusted source of consultation, someone to help coordinate care to better ensure that proper care is administered. I urge my colleagues to vote for my amendment, which again would help ensure that children, teenagers, young adults, and seniors really receive the care they need and deserve. And I yield back the balance of my time.
Madam Chair thanks the gentlelady and recognizes the gentleman from Georgia, Dr. Gingrey, for 5 minutes.
Mr. Chairman, thank you. And with all due respect to my good friend from California, I am in opposition to her amendment and want to speak favorably for the bill, H.R. 1216, that my colleague from Kentucky, Mr. Guthrie, has brought forward. Healthy People 2020 is an office within HHS that develops objectives to improve the level of health care in a decade, in 10 years. The objectives are determined even when there's no or insufficient national data available. So some of these objectives are still evolving. They're developmental and should not be used to make specific decisions on health policy and programs until there is sufficient data. Today, the debate is about whether or not my Democratic colleagues should have voted to appropriate $230 million without going through regular order. If you look at Section 5508 of Patient Protection and Affordable Care Act, it provides $230 million direct appropriation for teaching health centers residency programs. H.R. 1216, Mr. Guthrie's bill, would convert the direct appropriations into an authorization of appropriations. The legislation allows for teaching health centers to receive funding through the normal appropriations process. If you look at Section 5301 of PPACA, that allows hospitals, and I'm talking about accredited public and nonprofit, to receive funds for training in family medicine, general internal medicine, general pediatrics, and physician assistantships. Section 5301 is authorized and it's subject to appropriations, whereas Section 5508 of PPACA provides automatic funds for these teaching health centers. Many members of this committee have supported graduate medical education for children's hospitals like Children's Healthcare Center of Atlanta. In her testimony before the committee, Secretary Sebelius stated that the President's FY 2012 budget eliminates duplication, and then specifically she said eliminating spending on children's hospitals' graduate medical education. By providing mandatory funds to these teaching health centers, this section of PPACA actually disadvantages children's hospitals like the Children's Healthcare Center of Atlanta, who must go through the normal appropriations process to receive funding. Some have advocated the need to move away from hospital-based medical education. That may or may not be the appropriate, correct policy. I have my bias, but if we need to have a discussion on the most appropriate sites for medical education or changing the mix of where providers are trained, let's have that discussion. But we should not have this hodgepodge set of policies where some facilities get mandatory funding while others have to go through the normal appropriations process. Really, that's what this is all about. That's what this is all about in all 5 of these bills. And I'm just amazed that my colleagues on the other side can't seem to understand that. But for that reason, I respectfully oppose Mrs. Matsui's amendment and continue to be very supportive of 2016, the bill that the gentleman from Kentucky has presented today. And, Mr. Chairman, I'll yield back my time.
Chair, thanks, gentlemen. Is there further discussion of the amendment? If there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. All those opposed, no. No. The nays have it, and the amendment's not agreed to. Are there further amendments on the bill? If there's no further discussion, the question now occurs on favorably reporting the bill. All those in favor say aye. Aye. All those opposed say no.
No. I'd ask for a roll call, Mr. Chairman.
Roll call votes.
We won?
The clerk will call the roll.
Did we win?
Mr. Barton.
This is final passage.
It's reporting the bill, yeah.
Reporting the bill. Aye.
Mr. Barton, aye. Mr. Stearns. Mr. Whitfield. Mr. Shimkus. Mr. Pitts.
Aye.
Mr. Pitts, aye. Mrs. Bono Mack. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Ms. Myrick. Mr. Sullivan. Mr. Sullivan, aye. Mr. Murphy. Mr. Burgess. Mr. Burgess, aye. Mrs. Blackburn. Mrs. Blackburn, aye. Mr. Bilbray. Mr. Bilbray, aye. Mr. Bass. Mr. Bass, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Scalise. Mr. Wada. Mr. Wada, aye. Mrs. McMorris Rogers. Mrs. McMorris Rogers, aye. Mr. Harper. Mr. Harper, aye. Mr. Lance. Mr. Lance, aye. Mr. Cassidy. Mr. Cassidy, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Olson. Mr. Olson, aye. Mr. McKinley. Mr. Gardner. Mr. Gardner, aye. Mr. Pompeo. Mr. Kinzinger. Mr. Griffith. Mr. Griffith, aye. Mr. Waxman. Mr. Waxman, no. Mr. Dingle. Mr. Markey. Mr. Towns. Mr. Pallone. Mr. Pallone, no. Mr. Rush. Ms. Eshu. Ms. Eshu, no. Mr. Engel. Mr. Green. Mr. Green, no. Ms. DeGette. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Ms. Schakowsky. Mr. Gonzalez. Mr. Gonzalez, no. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Ross, no. Mr. Weiner. Mr. Weiner, no. Mr. Matheson. Mr. Matheson, no. Mr. Butterfield. Mr. Barrow. Mr. Barrow votes no. Ms. Matsui. Ms. Matsui, no. Ms. Christensen. Ms. Christensen, no. Mr. Upton.
Are there further members wishing to be recorded? Mr. Rogers.
Mr. Rogers. Aye. Mr. Rogers, aye.
Mr. Scalise.
Mr. Scalise. Mr. Scalise, aye.
The clerk will report the result.
Mr. Chairman, on that there are 21 ayes, 14 nays.
The ayes have it, and the bill is favorably reported. Chair calls up H.R. 1215 and asks the clerk to report.
H.R. 1215.
Without objection, the first reading of the bill is dispensed with. So ordered. Are there any amendments to the bill? The gentlelady, Ms. Baldwin, is recognized to offer an amendment.
Mr. Chairman, I move to strike the last word. I do indeed have an amendment, but I wanted to ask Council a couple of questions before offering it.
The gentlelady is recognized for 5 minutes.
Thank you. Council, I have a couple of questions related to both the Personal Responsibility Education Program known as PREP and also Section 2954 of the Affordable Care Act, that section that restores mandatory funding for the abstinence-only education program under the Social Security Act. I would start by asking, is the abstinence-only program that is authorized under Section 510 of the Social Security Act supported by mandatory spending?
Yes,
And is the amount of this mandatory spending $50 million per year?
that's correct.
Are you aware of any statutory requirement or directive in Section 510 that abstinence-only education programs funded under this authority be based on any kind of evidence that the program actually works? Is there an evidence-based aspect to this?
To the best of my knowledge, no.
Okay, and this is very different from the statutory requirements of the Personal Responsibility Education Program, which state that an education program must, I quote, replicate evidence-based effective programs, end quote, and be, quote, medically accurate. Isn't that correct?
That's correct.
So the abstinence-only program has no similar standards, this replicate evidence-based effective programs or be medically accurate as far as you know?
That's correct.
Okay. And just to be clear, Section 2954 of the Affordable Care Act restores $50 million in mandatory spending per year for the next 5 years to the abstinence-only program, correct?
Correct.
All right. Well, it's the end of my questions, but I have to say I'm really confused by what we're doing today with this bill. We're about to end mandatory funding for PrEP, which must be evidence-based and requires substantial emphasis on both contraception and abstinence for the prevention of teen pregnancy. But we're leaving intact $250 million of mandatory spending over 5 years that evidence clearly indicates does not work. I wanted to ask the Chairman unanimous consent to submit a letter from the Sex Education Coalition. I had previously given it to the majority to review and would ask unanimous consent at this point in time.
Without objection, so ordered.
Okay. And, Mr. Chairman, if appropriate, I would now yield back my debate time and seek recognition to offer an amendment.
The chair recognizes the lady to offer an amendment.
Thank you, Mr. Chairman. I have an amendment at the desk.
Clerk will report the amendment.
It's amendment number 6.
It's amendment number 6.
Amendment to H.R. 1215, offered by Ms. Baldwin.
Without objection, the reading amendment is dispensed with. The gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. The measure that we're considering at present would repeal the mandatory funding for the Personal Responsibility Education Program, or PrEP, and make funding for this program discretionary. I've heard my colleagues on the other side of the aisle assert time and time again that this shift is necessary because as members of Congress, we should have the ultimate say over how much funding each program gets each year. If my colleagues accept that premise, then it would logically follow that mandatory funding for the Title V abstinence-only program should also be subject to annual spending decisions by members. However, as we've just heard from Council, the bills we are considering today will not impact the mandatory funding for the Title V abstinence-only program. My amendment is simple. It states that the bill to repeal the funding cannot take effect until the Title V abstinence-only program is repealed. I would assume that my colleagues who are supportive of H.R. 1215 would also be supportive of this amendment. And while I would like to give Congressman Latta and his colleagues the benefit of the doubt and assume that the decision to threaten the funding for the PrEP program but not the abstinence-only program was inadvertent, I am skeptical that this was indeed the case. However, if I am incorrect, I welcome my colleagues to help accept this amendment. I think the members on both sides of the aisle would agree that abstaining from sex is certainly the safest and most effective way to prevent unintended pregnancies and most sexually transmitted diseases. This is precisely why abstinence is a key component of comprehensive sex education offered through the PrEP program. But unlike the Title V abstinence-only program, PrEP must be evidence-based and must also provide information on contraception and sexually transmitted diseases. 43 states have applied for PrEP funding, including Congressman Latta's home state of Ohio and my own home state of Wisconsin. Notably, of those 43 states, 16 have only applied for PrEP funding and not for abstinence-only funding, including Ohio and Wisconsin. This demonstrates that our cash-strapped states understand the cost is too high to accept abstinence-only funding at the exclusion of comprehensive sex education. Wisconsin will receive $4.7 million over the next 5 years through PrEP. Upon receipt of this grant funding, former Secretary of the Wisconsin Department of Health Services, Karen Timberlake, praised another critical benefit of PrEP funding. The program will lead to cost savings in other areas of our healthcare system. Secretary Timberlake said, for each child making a healthier choice for themselves, we also realize cost savings in Wisconsin's Medicaid program and other programs as well. Mr. Chairman, I fail to see how endangering funding for this critical program will lead to an overall reduction in healthcare spending. I fail to see how endangering this funding for this critical program is fiscally responsible. I also fail to see how endangering funding for a program that will improve the health of young people is morally or socially responsible. Furthermore, I would like to point out that supporting abstinence only at the exclusion of comprehensive sex education is yet another example of the very disappointing attack we have seen lately on women, and this time especially on young women. I remind my colleagues that we should see this in the greater context of what has been the agenda of the majority so far this Congress. The first hearing and markup of this committee was on legislation to take away women's abilities to make their own important life decisions about their reproductive health. Since then, Republicans have taken to the floor in support of measures to block women's access to reproductive health care and especially family planning. And now today, they're offering yet another measure that will impact young women, this time putting a critical program at risk that provides these women, and young men too, with evidence-based information about their health and their choices. I urge my colleagues to support this amendment and to vote against the underlying bill, and I yield back my remaining 20 seconds.
Chair, thanks, gentlelady. Is there further discussion on the amendment? The gentleman from Illinois, Mr. Shimkus, is recognized.
Thank you, Mr. Chairman. Just to ask a question of counsel, because I ran in and out. Does HR, I mean, we're on HR 1215, does it repeal Section 2953?
It does not.
It does not. So that's all the question I have. Thank you very much. Yield back.
Is there further discussion? The gentlelady from Illinois had her hand. No, the gentlelady from California is recognized for 5 minutes.
Thank you, Mr. Chairman. I just wanted to ask the majority if there is anyone that wishes to respond on the questions that were raised by Ms. Baldwin about this program being mandatory spending, the points that were raised in other bills that the majority used as the foundation for their objections to amendments that were being offered. Does anyone care to answer that? This is me.
Would the gentlelady yield? I would just, that's part of my question, because the 1215 does not repeal Section 2953. It just makes it deal with annual authorization process. Is that correct, counsel?
That is correct.
So, I mean, that's why
So you're
I have.
repealing?
That's why it doesn't repeal
I'm just
Section.
taking back my
It
time.
does not repeal Section.
Mr. Shimkus, I'm reclaiming my time.
Okay, you can have it's your time.
This is repealing the mandatory part of the legislation? The mandatory funding?
The underlying legislation gets rid of the mandatory funding of the program and rescinds any unobligated funds.
So that's how it's justified.
Would the gentlelady yield?
I'd be glad to.
Well, I just said it doesn't repeal the section. It repeals the mandatory funding. You could still do annual authorizations. It's really part of that whole debate we've had all day.
But
do we want to authorize and do we want to appropriate?
Wait a minute. Reclaiming my time, you still keep the mandatory funding, though. For abstinence. So you still have mandatory funding. You know, I mean, that's why I said what I said earlier. This is like pretend. You know, I mean, you build a whole foundation for opposing amendments saying that this is wrong, the Chinese are funding everything or our debt, and we simply can't, and we can't afford it, we can't do it, and if you build it, they'll come, and then there won't be people there, or it'll cost too much, and it's mandatory, mandatory since 10 o'clock this morning, and now here comes along one of your favorite things, and you abandon what your principles were today. So that's just the point that I wanted to make. I think it's you know, it took until 25 to 6 to pull the veil off the face of the whole effort, but
will the gentlelady
we finally have gotten to it. Yes, I'd be glad to.
But what the gentlelady's saying is it repeals the mandatory, the underlying bill repeals the mandatory funding for the science-based sex education that includes abstinence education, but it keeps in place the mandatory funding for the abstinence-only sex education, which has been proven by study after study to not work. So what the gentlelady from California is saying is if you're going to be consistent about getting rid of mandatory funding programs, you should do it, especially when the programs don't work. And I yield back.
I'll yield back the balance of my time, unless there's anyone else that wants to use my time. But
gentlelady yields back.
Could I?
Is there further discussion on the amendment? The gentleman from Ohio, Mr. Ladd, is recognized for 5 minutes.
Well, thank you very much, Mr. Chairman. And again, what this amendment does, as the gentleman from Illinois pointed out, is making this from mandatory to yearly authorization. Let's just point out a few things that when we're talking about duplicative, when we're talking in the what this amendment would do, or what the amendment would do, or what the bill would do on 1215. Under the fiscal year 2012 request for teenage pregnancy prevention, right now we're talking $22,300,000. HIV school health, $40 million. Successful, safe, and healthy students, $365 million. Promised neighborhoods, $150 million. Again, these are fiscal 2012 requests, and that's in the Department of Ed. Substance Abuse and Mental Health Services Administration, it's $41,400,000. Minority AIDS Initiative. Health Resources Services Administration, Maternal and Child Health Block Grant, $654,489,000. Title 10, $327,356,000. Office of Assistant Secretary for Health Administration for Children and Families. Office of Minority Health, that's $57,980,000. Promoting safe and stable families, $443,311. And again, what this bill also does is make sure that we're not duplicating programs that are out there right now. It also would, as I said, take it from the direct appropriation down to just an authorization. Over the 5 years, we're looking at about a $375 million saving if you don't have these duplicate programs out there. Also, as the gentleman from Illinois pointed out a little earlier, that we're looking at between 42 to 43% of every dollar out there. So you're looking at, we'd be borrowing about $157.5 million on what potentially could be then a duplicative program, especially when you're looking at this year at a $1.65 trillion deficit. So, what what the bill does is to make sure that we're not duplicating, to make sure that the Congress can look at these each year, because you're looking at well over $1 billion right here, and that could be duplicated in all these other different programs that I listed for the fiscal year 2012. We want to make sure that Congress has the ability to look at that during the authorization process, and that these are not made direct. And you're absolutely correct. You know, when you're talking about what we're borrowing out there, if you look at the January major holdings from foreign holdings of the Treasury, mainland China right now has $1.54.7 trillion of U.S. security. Japan has $885.9. Interesting enough, when you get down into the category of oil exporters, some of the countries out there that also hold our debt are Iran and Libya, and when you're also looking at Venezuela. So again, we want to make sure that we don't have this duplication out there, so we don't have to borrow those dollars. And with that, Mr. Chairman,
Mr. Chair, can I ask the gentleman to yield? Mr. Latta? I'm not sure I understood. I think you were talking about the debt again. Was that accurate? About the debt?
Yeah, reclaiming my time. What we're looking at is, has been talked about a little bit earlier, is that when if you're duplicating programs at $375 million, when as Mr. Shimkus had pointed out, that you're looking at a $375 million, it'd be approximately about $157.5 million that we'd have to borrow of that 375, again, which would go to, we'd have to go out into the market to borrow those dollars. And again, when you, as I just mentioned, that when you're looking at who's holding the majority of our debt today, of that $4.4 trillion, it's $1.15.47 trillion from mainland China, Japan $885.9 billion. And as I said, the oil exporters, we owe them $215.5 billion.
Just for a quick question? Would the gentleman yield?
With my time remaining, I'll yield.
Thank you very much. My question is, why one and not the other?
Well, reclaiming my time with 13 seconds left, again, as I read through all these other programs that are out there in the fiscal year 2012 request, you're looking at well over $1 billion that would be duplicated by the $375 million that's under the Section 2953. And with that, I see my time's expired, and I yield back.
Gentleman yields back. For what purposes?
Strike the last word, and I'm not going to
recognize 5 minutes.
Thank you, Mr. Chairman. I mean, I'm not going to use all my time. I'll yield some of it to others if they want it. But the point is that this abstinence program, I guess it's about $50 million per year, the abstinence only, that's mandatory. Well, we've had discussions, as Ms. Eshu said, all day about different programs in these 5 bills that were, comparable to that $50 million annually. The PrEP program is, I think, the teaching program that we just had on the previous bill. I forget how much. And all we kept hearing over and over again was how we were creating debt, debt to China, debt to I don't even know how many other countries. And I think Mr. Latta was going into that debt situation again. Our only point on this side of the aisle is if your whole premise today was that mandatory spending was bad because somehow it was creating all this debt, why is it any different for the abstinence-only program? And no one on the other side of the aisle seems to be willing to answer the question. So I'll just repeat Ms. Eshu's question again and say, how do you justify the mandatory spending on abstinence only, but say that we shouldn't use it for other things? That's my question. I'll ask Mr. Latta, if the gentleman would respond. To talk about debt and more debt, we've been talking about debt all day.
Chairman yielding. Again,
I would yield.
As I read off, we have all these other programs that were duplicative. And again, as I said,
but if I could reclaim my time, abstinence only is only abstinence. We in the PrEP program include abstinence. Seems to me that you go for the program that has more comprehensive. But in any case, it doesn't matter because the bottom line is you've been saying that mandatory spending is wrong because it creates debt. So there's no difference. I don't know if anybody else on.
Will the gentleman yield?
Yeah, I'll yield to the gentlewoman from Colorado.
Well, it's true there are a lot of other programs, as Mr. Latta said, but those aren't programs that provide comprehensive sex education. And the one they're keeping that provides some kind of, that covers this field is the abstinence only. That's the one mandatory spending program they're keeping that would cover sex education. and it doesn't work. There's study after study after study shows that it doesn't work. So why would you keep this mandatory spending program and cut the one that works? And I mean, that's the question that we're trying to ask, and we're not getting an answer.
Would my friend from Colorado yield?
I don't.
Well, actually,
I don't
it's my
control the
time.
time.
I yield to Mr.
I would think that this is just the first of many bites at the apple on the health care law, where we will continue to look at provisions. And I would suggest that if you're so focused on this, that you submit a bill to defund the mandatory aspects of that, and have it go through the process.
Well, the
Well,
gentleman
reclaiming my time, I yield to the gentlewoman from Wisconsin.
We don't need to submit a bill because I've just submitted an amendment that does precisely that, and if you support it, we
Well,
will
then
be
let's
done.
have a vote.
Absolutely.
Then we're ready to vote.
That process, but we have a program that is evidence-based, medically accurate, that is going from mandatory to discretion in the underlying bill. We have another program that, as my colleague from Colorado emphasizes appropriately, is not evidence-based, is not scientifically based, and has proven to be ineffective. Look, if we can all agree in this committee on something, it's that we want to reduce the number of unintended pregnancies, that we want to reduce the incidence of sexually transmitted disease, that we want to make sure that our youth make healthy choices. Let us adopt this amendment and focus on evidence-based, successful efforts at doing that. That's something I hope we can all agree on. I yield back to the gentleman from New Jersey.
Unless someone else wants the time, I'll yield back, Mr. Chairman.
Chair, thanks, gentlemen. Is there any further discussion on the amendment? If there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye.
Aye.
All those opposed, no. No.
Chairman, I ask for a
Nays
roll
have it.
call.
Amendment's not-
Roll call.
The rank members request a roll call vote. The clerk will call the roll.
Mr. Barton, Mr. Stearns, Mr. Whitfield, Mr. Shimkus, Mr. Shimkus, no. Mr. Pitts,
no.
Mr. Pitts, no. Mrs. Bono Mack, Mr. Walden, Mr. Walden, no. Mr. Terry, Mr. Terry, no. Mr. Rogers, Mrs. Myrick, Mrs. Myrick, no. Mr. Sullivan, Mr. Sullivan, no. Mr. Murphy, Mr. Burgess, Mrs. Blackburn, Mr. Bilbray, Mr. Bass, Mr. Bass, aye. Mr. Gingrey, Mr. Gingrey, no. Mr. Scalise, Mr. Latta, Mr. Latta, no. Mrs. McMorris Rogers, Mrs. McMorris Rogers, no. Mr. Harper, Mr. Harper, Mr. Harper, no. Mr. Lance, Mr. Lance, no. Mr. Cassidy, Mr. Guthrie, Mr. Guthrie, no. Mr. Olson, Mr. Olson, no. Mr. McKinley, Mr. Gardner, Mr. Gardner, no. Mr. Pompeo, Mr. Kinzinger, Mr. Griffith, Mr. Griffith, no. Mr. Waxman, Mr. Waxman, aye. Mr. Dingle, Mr. Markey, Mr. Towns, Mr. Pallone, Mr. Pallone, aye. Mr. Rush, Ms. Eshu, Ms. Eshu, aye. Mr. Engel, Mr. Green, Ms. DeGette, Ms. DeGette, aye. Mrs. Capps, Mrs. Capps, aye. Mr. Doyle, Ms. Schakowsky, Ms. Schakowsky, aye. Mr. Gonzalez, Mr. Gonzalez, aye. Mr. Inslee, Mr. Inslee, aye. Ms. Baldwin, Ms. Baldwin, aye. Mr. Ross, Mr. Ross, aye. Mr. Weiner, Mr. Weiner, aye. Mr. Matheson, Mr. Matheson, aye. Mr. Butterfield, Mr. Butterfield, aye. Mr. Barrow, Mr. Barrow, aye. Ms. Matsui. Ms. Matsui, aye. Ms. Christensen. Ms. Christensen, aye. Mr. Upton.
Votes no.
Mr. Upton, no.
Other members wishing to cast a vote? Mr. Rogers from Michigan.
Mr. Rogers, no.
Dr. Burgess.
Dr. Burgess. Dr. Burgess, no.
Other members wishing to cast?
Mr. Scalise is not recorded. Mr. Scalise, no.
Other members wishing to cast a vote? Mr. Barton.
Mr. Barton, no.
If no other members wish to cast a vote, ask the clerk to report the tally.
Mr. Chairman, on that, there were 17 ayes, 20 nays.
20 nays. The amendment is not agreed to. Are there further amendments to the bill?
Mr. Chairman.
Chair recognizes the gentlelady from Colorado.
Thank you very much, Mr. Chairman. I have an amendment at the desk.
Clerk will report the title.
Number one, Mr. Gutt.
Yes, number one.
An amendment offered by Ms. DeGette.
It is the chair's understanding this may be the last amendment to the bill. Yeah. So the clerk will dispense or will disperse the amendment, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you very much, Mr. Chairman. Mr. Chairman, this is an amendment that follows up what I was talking about with the Baldwin amendment, which is if you're going to have mandatory funding for abstinence-only sex education programs, which this underlying bill apparently retains, you should also have mandatory funding for sex education that actually works. And so what the amendment does is it makes the effective date of the bill the date of the last fiscal years for which the abstinence-only program receives funding, which is October 1, 2014. You know, I agree with Ms. Baldwin and everybody else in this room that we need to teach teens that abstaining from sex is certainly the safest thing they can do in terms of preventing unwanted pregnancies and sexually transmitted diseases and many, many other issues. But in fact, the United States has one of the highest rates of teen pregnancy in the industrialized world. U.S. rates are up to 9 times higher than in other developed countries, and more than 400,000 teen girls ages 15 to 19 give birth each year in the United States. Most of those are unintended, and 1 out of every 4 women in that age group has a sexually transmitted disease. So here's the thing, is this committee, by defeating the Baldwin Amendment, said, well, we're going to make abstinence-only sex education a mandatory program. Now, look, as a mother of at least one young lady in that age group right now and someone who represents many more, I want to make sure that they can get the information they need to prevent sexually transmitted diseases and unwanted pregnancies. And the only way to do that is to have this PrEP program, which gives all of the information. Now, if you really want to improve health care reform, if you really want to reduce the deficit, then you should eliminate the $250 million abstinence-only program, but we don't do that. So let me just give you a couple of statistics. Let me just, I want to give a couple of statistics so I can have them in the record, because we haven't done that yet in this Congress. In 2007, the Mathematica Policy Research completed a 9-year study, and in that study what they found was, quote, findings indicate that youth in the program group were no more likely than the control group youth to have abstained from sex. Federally funded abstinence programs don't stop teen sex, and they're a poor use of all of the federal money that's been spent against them. One of my favorite statistics that I've talked about in this committee before was the Texas A&M evaluation of 5 abstinence-only programs being taught in Texas schools, and what they found, what this study found, is that at virtually every level, all high school grades, the kids were more sexually active after they took the abstinence-only course. I don't know. It's Texas, so I don't know. But my point is that you have to have science-based policy. Otherwise, you're just wasting money. And if we don't want to waste money, then we should give people science-based sex education just like everything else. And so I really think if you're going to keep mandatory spending for abstinence only, you should at least keep spending for something that works. And with that, I'll yield to the ranking member, Mr. Waxman.
It seems to me the essential point is that if they're going to insist that the abstinence-only program, which doesn't seem to do anybody any good, is going to be mandatory funding, then this one should not be anything other than the same. And so I think it's an issue we've already debated very clearly. If you're against mandatory spending, you should be against both programs being mandatory in terms of spending, and if you're for mandatory spending, let's make them both the same.
Reclaiming my time, and let's do something that works.
Yes.
And I'll yield back.
Gentlelady yields back. Are there other members wishing to speak on the amendment? Let's go. I hear let's go.
Would the gentleman yield?
Gentleman from Illinois.
I'm glad he encouraged me to speak out. I would just say that of all the attacks on abstinence education, it was in the bill that you all passed. And I would assume you passed it for a reason.
Well, will
that
the gentleman yield?
I'm just making a point. That it is in the bill that you passed, or that the Senate passed, that we eventually accepted. You all did, and was signed into law. So the president signed the law. So I guess he must have assumed abstinence education. Yes, sir.
Both programs in the bill we passed are mandatory spending. The proposal before...
Yeah, and you must have thought it was a good idea to have abstinence education as mandatory funding.
The gentleman will yield further.
I would yield.
So let's treat them alike. Either make neither one mandatory or mandatory.
Reclaiming my time, I don't know if you were in the room. There's nothing that prohibits you all from dropping a bill that addresses this same issue.
There is.
And now's not the time. Let's drop a bill. Give it the.
Will the gentleman yield?
I would be happy.
Good
to yield.
news. There is a bill sponsored by Representative Lee. You can co-sponsor it tomorrow.
I'm not sure I'll be co-sponsoring. And I'll yield back my time.
Are there other members wishing to speak on the amendment? Gentlelady from Illinois.
First, Mr. Chairman, I'd like to ask unanimous consent to submit for the record a letter of support for the Personal Responsibility Education Program led by youth advocates and signed by 120 national, state, and local organizations, including the AIDS Foundation of Chicago, Illinois Caucus for Adolescent Health, Illinois Maternal and Child Health Coalition.
Without objection.
In just a second, you know, if our goal is to reduce teen pregnancies, if it's to reduce HIV/AIDS and other STDs, if it's to reduce if it's to delay the onset of sexual intercourse and to reduce the number of sexual partners, then what we want to do is have both programs. I support abstinence programs, but it is the combination of abstinence and a comprehensive sex education that does those things. Without having all of that combined, we don't have the results that we want. So the idea of doing these all day, these counterproductive kinds of measures that actually reduce the goals that we all agree that we want to achieve is just utterly baffling, and I would be happy to yield to the gentlewoman from California.
Respecting the fact that the hour is late, I want to, and the points have been made, but I think this piece of legislation highlights the hypocrisy of the debate that we've been having today over mandatory versus discretionary. The program that works is on the chopping block. The program that has been demonstrated not to work, which is mandatory, is kept sacrosanct. All the years I worked in the schools, I worked with teen parents and watched them struggle to do their best for themselves and their children. As a public health nurse, I have seen the economic and community impacts of the spread of sexually transmitted diseases. As a mother and a grandmother, I know, as we all share, the trepidation and anxiety, but the role knowing the importance of teaching our children about healthy relationships so that they can set themselves up for success in their personal family life. These are the critical components that the PrEP program teaches. And any attempt to play politics with this program, I think, is a very dangerous game, especially when we are wasting taxpayer dollars on programs that have been discredited. So I believe it's fair, as the underlying health law demonstrates, that we can take both of them and allow them to be at work and alive in our communities. And that's why I strongly urge support for this amendment. I yield back to my colleague from Chicago. I yield back to you.
I think, are there other members wishing to speak on the amendment? Oh,
And I yield back.
gentlelady yields back. Are there other members wishing to speak on the amendment? Seeing none, I think we can, we'll ask for a recorded vote on the amendment. So the clerk will call the roll.
Mr. Barton. Mr. Barton, no. Mr. Stearns. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus, no. Mr. Pitts. Mr. Pitts, no. Mrs. Bono Mack. Mr. Walden. Mr. Walden, no. Mr. Terry. Mr. Rogers. Mr. Rogers, no. Mrs. Myrick. Mrs. Myrick, no. Mr. Sullivan. Mr. Murphy. Mr. Burgess. Is he back there? No. Mr. Burgess, no. Mrs. Blackburn. Mrs. Blackburn, no. Mr. Bilbray. Mr. Bass. Mr. Bass, no. Mr. Gingrey. Mr. Gingrey, no. Mr. Scalise. Mr. Scalise, no. Mr. Wada. Mr. Wada, no. Mrs. McMorris Rogers. Mrs. McMorris Rogers, no. Mr. Harper. Mr. Harper, no. Mr. Lance. Mr. Lance, no. Mr. Cassidy. Mr. Guthrie. Mr. Guthrie, no. Mr. Olson. Mr. Olson, no. Mr. McKinley. Mr. Gardner. Mr. Gardner, no. Mr. Pompeo. Mr. Kinzinger. Mr. Kinzinger, no. Mr. Griffith. Mr. Griffith, no. Mr. Waxman. Mr. Waxman, aye. Mr. Dingle. Mr. Markey. Mr. Towns. Mr. Pallone. Mr. Pallone, aye. Mr. Rush. Ms. Eshu. Ms. Eshu, aye. Mr. Engel. Mr. Green. Mr. Green, aye. Ms. DeGette. Ms. DeGette, aye. Mrs. Capps. Mrs. Capps, aye. Mr. Doyle. Ms. Schakowsky. Ms. Schakowsky, aye. Mr. Gonzalez. Mr. Inslee. Mr. Inslee, aye. Ms. Baldwin. Ms. Baldwin, aye. Mr. Ross. Mr. Ross, aye. Mr. Weiner. Mr. Weiner, aye. Mr. Matheson. Mr. Matheson, aye. Mr. Butterfield. Mr. Butterfield, aye. Mr. Barrow. Mr. Barrow, aye. Ms. Matsui. Ms. Matsui, aye. Ms. Christensen. Ms. Christensen, aye. Mr. Upton. Votes no. The gentleman is not recorded.
I'm sorry.
Mr. Terry, no.
Are there other members wishing to cast a vote? Mr. Sullivan?
Mr. Sullivan, no.
Are there other members wishing to cast a vote? If not, the clerk will report the tally.
Mr. Chairman, on that, there are 16 ayes, 23 nays.
16 ayes, 23 nays. The amendment is not agreed to. It's my understanding that there are no other amendments for this. Gentlemen, for what purpose does the gentleman?
Just to strike the last word for the purpose of asking the chair a question.
Gentleman is recognized.
Mr. Chairman, can I just kind of get a handle on the schedule of the committee? We're most of the way through.
We are done.
No, I understand that. We're most of the way through.
Get one more vote.
The repeal part of the repeal and replace. Should we as a committee be expecting to get the replacement legislation to provide insurance for the uninsured, reduce deficits by $1.2 trillion over 20 years? Is that coming soon? I've been monitoring the congressional record. That's how I spend my idle hours. I've been monitoring the congressional record, waiting for that legislation. Should we be expecting that next week to be before the committee, the week after? When should we reasonably be expecting that legislation? And I yield to the gentleman.
You'll be seeing a number of pieces of legislation as it relates to the replacement part in the coming weeks. So we look, and we'll make sure that they're all in line with the Constitution.
Yeah,
we've learned that lesson.
And just if I could reclaim my time, will it be living up to the objectives that we share? Covering the uninsured, reducing the deficit, improving competition so that costs are kept down. Because you've got repeal and replace. There should be something to replace everything you repealed. I think the gentleman would acknowledge. Should we be reasonably expecting something that accomplishes the same goals of what we?
You'll be excited. You'll be excited about what we're doing.
Well, as the chairman knows, getting me too excited is not a very high bar.
Exactly.
I yield.
Would the gentleman yield?
We'll even make a mistake and put your name as a co-sponsor and object when you ask unanimous consent to remove your name.
Would the gentleman yield?
Gentleman from New York has the time.
Certainly would.
The gentleman yield to me when he's.
Well, let me
to him.
just yield to.
Didn't the gentleman just recently get married?
Well, it's kind of old news now, but if you're.
I mean, I would hope that
if I forgot to send you a thank you note for your gift, I apologize for that. Apparently, I have a year for that kind of thing.
I just thought maybe there'd be more productive uses of your idle time than reading the congressional record.
Well, I appreciate it, but Mr. Barton, unlike some members of this committee, I have no marketable skills. I don't really have anything else to kind of go and do. This is kind of my gig, but I appreciate it. But while I have your attention, Mr. Barton, will you be sponsoring the replace portion of this bill? I mean, reclaim some of the jurisdiction?
I'm very judicious about what I sponsor, but I will certainly coordinate my sponsorship with the gentleman from New York.
I look forward to that day in hell. I yield to the gentleman from California.
Well, I thank you for yielding to me. I think we found out today some of the things they want to add to replace our bill, rather than cover more Americans, 30 million as we do in the health care bill, hold down costs. Their way is to shift onto the elderly the cost for Medicare. If they make a voucher plan, it would say, this is how much money you have. You go out and buy some private insurance policy. And that's how they want to replace the Medicare program.
If I could reclaim my time, and also $750 billion in cost cuts for Medicaid, which are going to be transferred to the states.
And to the poor people who will be dropped from the program.
Like you've got to, as I'm sure you understand, Mr. Waxman, that simply because you cut money from Medicaid doesn't do anything to reduce the cost of health care or the number of people.
Gentleman's absolutely right.
Would the gentleman yield?
Gentleman controls the time.
Would the gentleman yield?
I don't, we'll get more time on this because this is a very good debate at this time of the evening. But it is clear sign of what they think is a good replacement for the health care bill.
Well, I would also say this, and then I'll yield to Jennifer Morgan. I certainly hope one of the things we should do in this committee is take that piece of Swiss cheese that Mr. Ryan produced today and put it through the rigors of a hearing in this committee. Let's see what it means when you eliminate Medicare. Let's see what it means when you move Medicaid costs entirely to the states. We should have an examination of what that, we should try to reclaim some of that jurisdiction. because certainly having a head in the sand ostrich approach isn't going to work.
Would the gentleman?
I certainly will.
Would the gentleman, the future mayor of New York, yield? Because I'm told you're talking about a plan that would do something like that, merge Medicare and Medicaid in New York City and deal with all your issues and get a waiver to do that. So
No,
I just want to
actually,
make sure that
it's a common
that you get a chance.
Let me record the time. It's a common misconception that someone educating themselves by watching Fox News might be under that impression.
I'm actually reading from
in fact,
Politico.
There's a difference between the waivers, which are a debate we've had here, and something that Mr. Wyden and Mr. Brown proposed that the president adopted, an opt-out in 2017 for states or localities that think they could administer the program themselves.
yield.
That's something I would hope all states, Oregon included, would endeavor to follow itself. But in fact, the waivers that are offered as a sign of flexibility by HHS is not something that New York is going to need. However, we are going to need this committee to do true oversight of the Ryan Swiss Cheese Act of 2011.
Gentlemen's time has expired. It's my understanding that this may be the last roll call vote of the night. We've got one bill after this, but it's likely to go by voice. Are there further amendments to the bill? Seeing none, we are ready for final passage. I'll ask the clerk to report or to call the roll.
Mr. Barton. Final. Mr. Barton, aye. Mr. Stearns. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus, aye. Mr. Pitts. Mr. Pitts, aye. Mrs. Bono Mack. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mrs. Myrick, aye. Mr. Sullivan. Mr. Sullivan, aye. Mr. Murphy. Mr. Burgess. Mr. Burgess, aye. Mrs. Blackburn. Mr. Bilbray. Mr. Bilbray, aye. Mr. Bass. Mr. Bass, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Scalise. Mr. Scalise, aye. Mr. Latta. Mr. Latta, aye. Mrs. McMorris Rogers. Mrs. McMorris Rogers, aye. Mr. Harper. Mr. Harper. Mr. Harper. Mr. Harper, aye. Mr. Lance. Mr. Lance, aye. Mr. Cassidy. Mr. Cassidy, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Olson. Mr. Olson, aye. Mr. McKinley. Mr. Gardner. Mr. Gardner, aye. Mr. Pompeo. Mr. Kinzinger. Mr. Kinzinger, aye. Mr. Griffith. Mr. Griffith, aye. Mr. Waxman. Mr. Waxman, no. Mr. Dingle. Mr. Markey. Mr. Towns. Mr. Pallone. Mr. Pallone, no. Mr. Rush. Ms. Eshu. Ms. Eshu, no. Mr. Engel. Mr. Green. Mr. Green, no. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Ross, no. Mr. Weiner. Mr. Weiner, no. Mr. Matheson. Mr. Matheson, no. Mr. Butterfield. Mr. Butterfield, no. Mr. Barrow. Mr. Barrow, no. Ms. Matsui. Ms. Matsui, no. Ms. Christensen. Ms. Christensen, no. Mr. Upton. Mr. Upton, aye.
Are there other members wishing to cast a vote? Mr. Towns.
Mr. Towns, no.
Other members wishing to cast a vote? No.
Mr. Terry, the gentleman has recorded aye.
How's Mrs. Blackburn?
Mrs. Blackburn. Mrs. Blackburn, aye.
Are there other members wishing to cast a vote? Seeing none, the clerk will report the tally.
17. Mr. Chairman, on that, there are 25 ayes, 17 nays.
25 ayes, 17 nays. Oh, Mr. Is it done? Can I finish this?
Finish it.
The bill is passed, adopted.
I just want to serve notice that the minority wants its appropriate time on every bill that's been passed today.
Without objection.
Other views.
Without objection. So be it. So be it.
In particular.
All right. At this point, the chair would ask UC that the committee call up H.R. 1343, a bill identical to the discussion draft reported by the subcommittee, and treat it as original text for the purpose of amendment at full committee without objection. The chair asks the clerk to report.
H.R. 1343.
Without objection, the first reading of the bill is dispensed with, and the discussion draft will be open for amendment at any point.
Mr. Chairman.
So ordered. Gentlemen, for what purpose is the gentleman from Oregon?
Mr. Chairman, I have an amendment at the desk.
The gentleman is recognized for 5 minutes in support. Oh, the clerk will report the title of the amendment.
An amendment to H.R. 1343 offered by Mr. Walden.
The staff will disperse the amendment, and the gentleman from Oregon is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. I thank the committee for bringing this legislation before us. At your subcommittee on communications and technologies first hearing, the Commerce and Agriculture Inspectors General expressed some concerns that the $7 million in broadband stimulus programs are high risk, as they call it. They also said it would be helpful if Congress would fix some ambiguities between the broadband stimulus language and the Dodd-Frank legislation, as well as improve oversight. The administrators of these two agencies testified before the subcommittee last week, and they agreed that the language of the Recovery Act is discretionary. We make it mandatory. We have worked with the Inspectors General, the NTIA, the RUS, and the staff of the ranking member. We marked up this legislation in subcommittee last week unanimously and worked together between subcommittee and here to refine some of the concerns that had been brought to us. We agreed to make additional clarifications sought by the agencies for today's full committee consideration, which we will consider in the amendment that I've offered here. Now, this is a modest housekeeping but helpful piece of legislation that will provide additional tools to ensure someone's looking after the taxpayer dollars. American people deserve to know whether their $7 billion is being spent appropriately. Now, understand $7 billion has been obligated, all $7 billion. Only $400 million has gone out the door so far. So we've got a long way to go with this program. We want to make sure the money would be returned to the taxpayers and not held up at the agencies. They have that flexibility now under the existing law where they can choose whether or not to deobligate. In addition to removing ambiguities, the legislation includes notification requirements to keep the Congress, regardless who's in charge, informed of problem awards. These will improve our understanding of how the program's functioning. I want to thank Mr. Bass for leading on this issue. I want to thank my colleagues on the other side of the aisle for working with us on this issue, and I would yield to Mr. Waxman first.
I thank you for yielding. I support the manager's amendment before us today. At the subcommittee markup of the underlying discussion draft, members agreed to work together to incorporate suggested changes from NTIA and RUS to ensure that the legislation considered today fulfills the intended purpose and does not unintentionally hinder the ability of the agencies to oversee these programs. In summary, the changes incorporated in the amendment ensure that the agencies will not run into unidentified difficulties when they recover monies, allow flexibility to keep information confidential to avoid disrupting fraud investigations, and permit the agencies to address frivolous or erroneous complaints fairly. This amendment reflects bipartisan collaboration and consultation with the administration and is an improvement upon the earlier version of the bill. Although this amendment improves the bill significantly, there may be additional issues that should be addressed. We've agreed to continue to work together to fine-tune this measure before it's considered by the House. I'd like to thank Chairman Upton and Chairman Walden for their collaborative approach on this legislation and hope that this is a sign of things to come.
I thank the gentleman for his comments. I would yield to the gentlelady, the ranking member of the subcommittee, Ms. Eshoo.
Thank you, Mr. Chairman. I associate myself with the comments that you've made and Mr. Waxman has made. We're glad to cooperate on this. I think it's an important restatement that's being made here, and that is that that there be accountability for the $7.2 billion for broadband. We still have a ways to go in broadband in our country. Those that are from rural districts know that especially well. And I shouldn't say but. However, as I said, it's a restatement of what Dodd-Frank did. And I'm very pleased that we were able to work on what RUS and NTIA had pointed out about some of the ambiguities that might exist with what was being proposed, so that they don't end up on the ropes if, in fact, there isn't any fraud that needs to be investigated by the OIG or the DOJ. So with that, as Mr. Waxman said, it's a very good sign. We hope it's a sign of things to come so that we can work together. This Energy and Commerce Committee has a tradition of having done that, so we'll look forward to it after we get rid of all these repeals. How's that? Okay? Thank you. Yield back.
Reclaiming my time, I appreciate the gentlewoman's comments, and indeed we have major work to do on the subcommittee and the full committee to create jobs in America and improve technology and innovation. And with 10 seconds left, I would yield back the balance of my time.
Gentleman yields back his time. Are there other members wishing to speak on the manager's amendment? If not, the vote is on the amendment. All those in favor say aye. Aye. Those opposed say no. The ayes have it. The ayes have it. The amendment is adopted. Are there further amendments to the bill? If not, vote will be on final passage. Those in favor say aye. Aye. Those opposed say no. Without a doubt, the ayes have it. The ayes have it. And the bill is adopted. Without objection, the staff is authorized to make technical and conforming changes to the bill approved by the committee today. Hearing no objection, so ordered. Chair thanks all members and staff. We are now adjourned.